Thank you. Good morning, everyone.
Recording in progress.
Darren, Chair Hopkins, I'll turn it over to you.
Thank you so much, Marcy. So we will go ahead and call this meeting to order. Please note that Spanish translation is available in Zoom. To select translation services, please click the globe icon on the Zoom screen and select Spanish. If during any public comments, a commenter is speaking in Spanish, our English-speaking participants may go ahead and go to the globe and select English to listen to the translation of the comment. I will now ask that Julie please go ahead and share this message in Spanish.
Muy buenos días y bienvenidos a la reunión de la Junta de Supervisores del 17 de agosto. Esta reunión será interpretada al español simultáneamente. Para escuchar en español, por favor haga clic en el icono del globo que se encuentra al pie de la página y elija el idioma español. También puede hacer clic donde dice Mute Original Audio para silenciar el audio original y escuchar solo la interpretación. Gracias.
Thank you so much, Julie. Really appreciate it. So with that, we are going to go ahead and move on to the flag salute. Bob, do you want to go ahead and lead us in the Pledge of Allegiance this morning?
Of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Have a more limited pool of people to invite for the Pledge of Allegiance, so we're all going to get a little additional practice. All right. And so with that, we will go ahead and move on to the approval of the agenda this morning. There was an addendum to today's agenda. The title of item 22 in the closed session calendar has been amended, and items 25A and 25B have been added to the closed session calendar. Can we go ahead, Marcy, and take a roll call vote on the agenda? And actually, approval of the agenda. And I actually don't remember, we're going with Marcy as leading this, right? Not Darren. Just want to make sure that I'm deferring to the proper. Okay, perfect.
Thank you so much. Supervisor Gorin.
Aye.
Supervisor Babbitt, absent. Supervisor Corsi.
Yes.
Supervisor Gore.
Yes.
Chair Hopkins.
Yes. And so with that, we will go ahead and move on to the consent calendar, which is items 1 through 16. Item 11 is a joint action with the directors of the Sonoma Valley County Sanitation District. I'm just looking to my colleagues to see if there's anything that is requested to be pulled from consent. I didn't have any requests prior to the meeting. So with that, I will go ahead and open it up to any members of the public who would like to speak on the consent calendar today. First, we'll check and see if there is anyone out there waiting in the hall on consent. And I am not seeing anybody in person. Thank you for the confirmation. And so Marcy, I would ask you to go ahead and accept comment via Zoom.
Thank you. And for our members of the public in Zoom, these are for items number 1 through 16. If you'd like to make a comment, please raise your hand in the Zoom app or press *9 on your phone keypad if you are a phone attendee. Thank you. There are no hands for comment.
Wonderful. Thank you, Marcy. So I will go ahead and bring it back to members of the board for a vote on this item. And just as a reminder, items 8 and 13 do require a 4/5 vote. And we do have that separate item for Sonoma Valley County Sanitation District. Marcy, would you go ahead and lead us in a roll call vote on the consent calendar, please?
Supervisor Gorin.
Aye.
Supervisor Corsi.
Yes.
Supervisor Gore.
Yes.
Chair Hopkins.
Yes. And then do we need a separate vote on the Sonoma Valley County Sanitation District item?
I don't believe so since you're all there, but it's kind of up to you.
As long as we're good, I am completely happy. I just know that sometimes we do that in case there's any member, another member of the sanitation district present. So with that, I will go ahead and move on to the regular calendar. The first one on our agenda today is item 17, an ordinance to dissolve the Mayacamas Community Facility District number 7. And this is the first reading. So I'll go ahead and hand it over to Terry Wright and Kristen Horrell to go ahead and do this presentation.
Good morning, Chair Hopkins and members of the board. Yes, Terry Wright with the County Administrator's Office. I'm here to provide a brief oral presentation of this item that introduces an ordinance to dissolve the Mayacamas Community Facilities District, which was formed by an approval of the territory voters in 2000 pursuant to the Mello-Roos Community Facilities Act of 1982. This action is necessary to formalize the change in service that resulted from the annexation of this territory with the Sonoma Valley Fire District. The dissolution of the Mayacamas Community Facility District was approved by the Sonoma County LAFCO when the territory was annexed by the Sonoma Valley Fire District in 2020. But the process required the payoff of an apparatus lease before the dissolution of the Community Facility District could be finalized. The payoff of this apparatus lease has occurred, and the Sonoma Valley Fire District has requested that the Board of Supervisors officially dissolve the Mayacamas Community Facilities District. Today's first reading of the ordinance will be followed by a second reading of the ordinance that is planned for next week's meeting. This concludes my very brief presentation, and Kristen Horrell and I are here to answer any questions that you may have.
Thank you very much. Now we'll go ahead and go to Supervisor Gorin.
Thank you, Terry and Kristen, for working on this. We know that it's complicated when we are consolidating and merging districts. And in fact, I think Shell Vista may have a Mello-Roos district, or the Mayacamas has a Mello-Roos district. And I think we navigated through that during the last consolidation, perhaps. But my question is, do we have other districts out there? And I consider you, Terry, the guru on all fire districts. Do we have other districts out there with these kind of special assessment districts that we're going to have to navigate through?
Yes, Supervisor Gorin. In addition to the Mayacamas Community Facility District, the county also formed a Community Facilities District via the Mello-Roos Act, as you mentioned, for the Wilmar Volunteer Fire Company and for the Sodayome Dry Creek Valley Volunteer Fire Company. So it is likely, it's not required that these Mello-Roos districts be dissolved, but it was at the request of the Sonoma Valley Fire District that they would prefer that the district be dissolved when they annexed. So it would be at the discretion of each annexing district, fire district, as to whether or not they would choose to dissolve the Mello-Roos district.
Thanks for that information. So another question that I have is, if in fact there's still an ongoing assessment, maybe not for apparatus, but for operations, Mello-Roos, for example, in some area, if it's dissolved, what happens to the obligation? Or is that assessment then lifted from the property owners?
Yes, Supervisor Gorin. With the dissolution, that would absolutely cease the collection of this assessment. However, because it was always planned that this district, the Mello-Roos district, was going to be dissolved, we worked with the Sonoma Valley Fire District, and we ceased the collection of this Mello-Roos assessment following the full annexation of the Sonoma Valley District of the territory. Because it was always, the only reason why we didn't do this when the district, the Sonoma Valley Fire District, annexed this territory, was because there was a lease, and this lease was entered, it was a co-lease with the CSA 40, and so it required that we also had to pay off the CSA 40 portion of the lease for the apparatus, in addition to the Mello-Roos Community Facilities District apparatus. So way more complicated than this action really requires, but that's why you'll see a delay in this. So that we've done no collection in the territory since the Sonoma Valley Fire District annexed this territory.
And this is why I bow to your expertise. Great explanation. And thank you so much, both of you, for your work on this. Complicated, but we're moving forward.
Any other questions from members of the board? Okay. All right. So with that, we can go ahead. None to my left. Okay. So with that, we can go ahead and open it to comments from members of the public. And just confirming that there is no one in person. Great. Thank you.
Okay, if there are any members of the public who would like to comment who are participating in Zoom, this is item number 17. Please raise your hand in the Zoom app or press *9 on your phone keypad. And there are no commenters.
Thank you very much, Marcy. So I'll go ahead and bring it back to the board for any closing remarks before we look at the Supervisor Gorin.
Once again, I just wanted to thank you all. And I really want to thank the great folks at Mayacamas and Sonoma Valley Fire for working together to come up with a solution for that really is the model for consolidation moving forward. So I'm excited that Sonoma Valley and the districts therein lead the way. So thanks so much.
Supervisor Gore.
A couple things. One is that I want to just slow down and honor the work that you are doing. The reason I say this is because I know, even though this is an item for Mayakama, and I remember a fiery board meeting where we executed the agreement with Sonoma County Fire and went on to this long path, that you have this work that you have to do to get all the administration set up right. And at the same time, you are neck deep with a lot of folks in negotiating another round of this. So all I wanted to do is just say thank you publicly and appreciate your service and that of those here with us. There ain't no fight like a firefight.
Thank you, Supervisor Gore. Supervisor Korski, anything to add? Thank you so much, staff, for the work on bringing this forward and for the members of the community who engaged in this process as well. With that, I will go ahead and ask Marcy to lead us in a roll call vote on this item.
Supervisor Gorin,
Aye.
Supervisor Corsi,
Yes.
Supervisor Gore,
Yes.
Chair Hopkins.
Yes. And so that one passes unanimously with the members present, and that will bring us on to item 18, our COVID-19 emergency response strategy update. So we'll go ahead and hand it over to our interim director of health services, Tina Rivera. I believe that we are also joined by Dr. Mace. There she is appearing on the screen, Dr. Shende, Kate Pack, as well as Paul Gullickson. So I'll hand it over to the COVID team.
Thank you, Chair Hopkins. We're happy to present this morning our Health Services COVID-19 Emergency Response Strategy Update. I'm Interim Director Tina Rivera, and with that, I'll hand it over to Dr. Sundari Mace to begin our presentation. Thank you.
Yeah, hi. Good morning, everybody. Good morning, Chairwoman Hopkins and the board. Thank you for having us present the updates for COVID-19 today and our strategy moving forward. Let me pull up the PowerPoint slides. Can you see that okay? Yes? Okay, good.
We can. There we go. Perfect.
Okay, fantastic. Well, let me go ahead and run through the slides. So I'm going to start off with our metrics as usual, and you can see our metrics as of August 16th. We are now up to 19.6 new cases per 100,000 residents per day, and we have an overall test positivity of 6.1%. Our test positivity in the lowest HPI quartile, or the lowest 25%, is 7.7%. And our, you can see the trends here. We're starting with the new cases. We are up to sort of where we were back in January and February. Not quite where we were with our surge in December and beginning of January, but we are definitely headed upwards again. And our overall test positivity is also now nearly what it was at the peak of our surge. And our lowest HPI test positivity is also close to where we were in the end of the year last year. Our hospitalizations, more worrisome, have been creeping up as well. And actually, we currently have 84 persons hospitalized. That's the most we've had since probably the end of December. I think at our peak, we had somewhere around 95 to 100 hospitalizations on any given day. So far, we've had 23 people who have died from COVID in the past 2 months also, after we had seen a couple months with really very, very few deaths. So everything looks like it's trending upwards again. But what's behind this? Well, as we've been noting again and again, it's really, the cases are occurring predominantly in the unvaccinated population. We have close to 40 new cases per day per 100,000. That's the orange line here. And we have 8 new cases per day per 100,000 in the vaccinated population, giving about 4 to 5 times more cases, actually about 5 times more cases in unvaccinated than in vaccinated populations. This is really tells the story. So what's happening is the vaccine is very effective in preventing infection and in preventing severe infection in those who do get infected. However, we have pockets in our county of unvaccinated individuals, that generally are in the same geographic locations, zip codes, census tracts, and do things together, whether it be gathering or having events, or simply just family groups that are together that are unvaccinated. And the Delta variant, especially of COVID, is transmitting rapidly through those unvaccinated groups. And then since those persons are also out and about doing other things, potentially other indoor activities like restaurants or malls and shopping and things like that, vaccinated people are coming into contact with the unvaccinated persons. And since Delta is so highly transmissible, and we know that the COVID vaccine prevents the worst outcomes of COVID, that people can get infected, we're seeing an increase in the case rate in vaccinated also. So that kind of tells the story of what's happening. What we've also been noting is, if you take a look at case rates, that's the trends by racial and ethnic groups in the past 60 days, we have increased case rates per 100,000 residents, especially in the American Indian, Alaska Native population, the Black African American population, Pacific Islander, Latinx, multiracial. And the reason why these look so high is because, remember, they're case rates. They're per 100,000 population, and the population of these racial groups, ethnic groups that live in our county are very small. So these rates look high because the actual numbers of persons in those groups are really small. Nevertheless, it's the trend that we're seeing. We are testing more again because there's an increase in demand in testing. Testing has increased by 60% in the past month. And our current testing volume is getting up to where we were earlier in the year, 365 tests per 100,000 residents. And testing has increased for all race and ethnicity groups, age groups, and geographies. And we are testing generally over the state average, although we're not in the blueprint and being tracked and getting adjustment for our case rate any longer. Still, it's good to know that our testing is above that of the state. As far as the test positivity by demographics, you can see our test positivity is still highest in the Latinx and Black groups, 15% and 13% respectively. That would be the blue line, and I believe the yellow line here. And then it's also increased amongst our white residents at 10%. Positivity has increased for all age categories. The largest increases observed in the 5 to 17-year-old group, 18 to 24-year-old group, and the 25 to 34-year-old group. And why is this? Because these are the groups that are less vaccinated in our county. So again, this is where we are. This is one of the areas where we're really focusing our vaccination efforts. As a result, as you know, we did really well with vaccinating our older age groups early on, and that's helped us incredibly for the outcomes of COVID. Test positivity increased for all geographies, with Cloverdale 27% and the Russian River area 30% showing the greatest increases. So trends everywhere all around the county. Again, the unvaccinated population is driving both case rates and test positivity. This again shows us what the age of the new cases have been in the past 60 days. While increased case numbers have been observed across all age groups, cases remain most frequent in the 20 to 39-year-old age group. Again, this is the group that, again, we need to encourage more and more vaccination in the younger age groups. And these are folks that are out and about and doing things and probably attending gatherings and things like that. As I mentioned, the variants are definitely impacting the increase in case rates and test positivity. The Delta variant now accounts for over 93% of all new infections nationwide, and it is the predominant variant detected in our genotyping results. We're not genotyping all of our cases, but of the genotype cases, the majority now, over 90% are Delta. I can see we had 379 cases of the Delta variant here in our genotyping results so far, and the others are much less present. Delta is over 60% more transmissible and contains about 1,000 times the viral load. That just means that people are much more infectious. That might be one reason why we're seeing a lot more cases amongst fully vaccinated individuals, simply because Delta is more transmissible and much more infectious from person to person, because the load of the actual virus is much higher. And it's contributing definitely to our outbreaks. Looking at the source of infection, we've always seen a lot of infection in households. That's this kind of light green. And you'll have a big chunk of unknown source of infection, because close to 45% of people don't tell us, even close to half the people, of their exposures any longer. However, of people who are telling us what's happening, we do have an increased cases and outbreaks in the congregate settings again, the skilled nursing facilities and the residential care facilities for the elderly. The homeless shelters, as everybody knows, we had one of the largest homeless shelter outbreaks in the country recently in the jail. Childcare and youth camps. Gatherings still account for over 1/4 of our new infections when the source is known. And it probably counts for a lot more than just 1/4. People just aren't telling us that they are attending gatherings. So the gatherings are large weddings, family friend gatherings, youth sports. So we've seen cases from large and small gatherings, and over 12 is considered large. Community transmission is happening in locations such as bars, restaurants, and other public venues, and that has increased over time as well. So again, seeing a lot of community transmission, gatherings and travel have contributed as well. Okay, so moving to the hospitalizations and deaths, we've had the largest number of patients hospitalized since probably February at this point. We have 84 in the hospital with COVID-19, 15 in the ICU. And part of what's happening for our hospitals is they are also admitting a lot of people due to deferred care. What that means is people who didn't get care or seek care last year, who now are presenting as a result of not having had care last year and being hospitalized for things that potentially could have been prevented if they had gotten appropriate medical care last year. So we're seeing patients admitted due to deferred care and COVID admissions. Over 80% of the hospitalizations and over 90% of the ICU patients are unvaccinated. Again, the same trend is being seen. Everything that is happening right now is being driven by the unvaccinated population, essentially. 99% of the COVID deaths have occurred amongst unvaccinated individuals. The handful of deaths, 5, I believe, occurring in fully vaccinated individuals. Of those, 4 occurred in those over age 90, and the last one is in over 65 with significant underlying medical conditions. If you look at the trends in age of hospitalized patients, while the 65 plus age group accounted over the entire course of the pandemic for the majority of hospitalizations, now we're seeing an increase in the 50 to 64-year-old age group, the blue line, as well as the 18 to 49-year-old age group, this orange line. So that is concerning. Again, it's being driven by the fact that that's where we don't have as many people vaccinated. So we've done a really good job protecting our over 65 population from the worst outcomes. Although I mentioned there were outbreaks in the skilled nursing facilities and the residential care facilities for the elderly, since 95% of those residents are vaccinated, we are not by in any means seeing the kind of really negative outcomes of death that we saw earlier before vaccination. I'm going to turn this over now to Dr. Shende, our vaccine chief, to discuss where we are with vaccine administration.
Thank you, Dr. Mace. Good morning, Chair Hopkins and board. So at this point, we actually reached a milestone last week in that we achieved 72% of our Sonoma County population becoming fully vaccinated and 8% who are partially vaccinated, giving us a total of 80% who have been at least partially vaccinated in Sonoma County. This is a big milestone. Of course, we hope to get that fully vaccinated number up higher because we know that with Delta, it's fully vaccinated that is most protective. Because this Delta variant is so much more transmissible and contagious, as Dr. Mace mentioned. So 72% are fully vaccinated. We're at 311,064 doses who are fully vaccinated. As we will see in subsequent slides, we've made significant progress in different age groups as well as ethnicities. So next slide, please. So currently, a gap still remains in those who are 34 years and younger, who are fully vaccinated. In our youngest population that's eligible currently, the 12 to 15-year-olds, 48% of them are fully vaccinated, with an additional 12% who are partially. 60% of the next age group, 16 to 24-year-olds, and 61% of those 25 to 34-year-olds. Again, this is the age group in which we are seeing more cases. Unfortunately, we are seeing more who are in the hospital. And so we continue to reach out to these groups to try and encourage vaccination. The way that we are doing this at this point, we currently have 2 fixed sites, which are at Rohnert Park OptumServe and also at Roseland Community Center, which is now operated by Fox Home Nursing. And that site is now open 7 days a week from 9 to 6:30 p.m. So we are trying to make it as convenient as possible on weekends, as well as evening hours, and also walk-ins are welcome. The clinic in Rohnert Park is also open on Saturday, so it operates Tuesday through Saturday. In addition, we have smaller clinics that are available throughout the county, so one can still go to socoemergency.org/vaccine to see what clinics are available. In addition, we have been trying to encourage vaccination in this younger age group by supporting and encouraging clinics at schools. We know through many studies and surveys that schools are seen as trusted sites where people are comfortable in going for their vaccination. So because of that, we had set up 10 different clinics at school sites over the past week to coincide with school orientation and back to school events. These were done in collaboration with Sonoma County Office of Education, as well as many different health partners throughout Sonoma County, including Alliance Medical Center, Providence, Sonoma Valley Health Center, and Cheryl Fox Home Nursing, as well as community-based organizations. This, again, as has been the case since January, the collaborative work of all of these different groups made these clinics possible. We will continue with second dose clinics, and we are planning to have 6 additional clinics that will begin in the month of September that are to address the most impacted communities within Sonoma County, those that have the lowest vaccination rates, the highest case rates over the last couple of months, as well as those who have a higher proportion of English language learners to try and reach our most disadvantaged communities. In addition to that, we are planning to have communication events called charlas, such that health providers can meet with families and with parents to answer questions and to, again, increase confidence that this is the right decision for them. We are planning to continue these kind of conversations also at work sites and other places for pop-up events going forward, to try and meet people where they are and make it as convenient as possible, and again, to answer questions that they may have. Next slide, please. And one other thing I meant to mention is, in addition to schools, the other location that has been identified by many people as a trusted location is their own medical home, their medical provider's office. And to that effect, we have been encouraging our medical providers to reach out to their patients, their unvaccinated patients, to encourage vaccination, as well as to help to set up an appointment or even have it available at their clinic. This has shown to be quite effective, and we hope that that will continue. So this slide wanted to highlight the progress that has really been made in the youngest population, particularly in the 12 to 15-year-old population. They became eligible for the vaccine roughly May 11th, May 12th, And since that time, you can see that they have the steepest rate of rise of any age group, and they have continued to have significant gains in their vaccination rates compared to other groups, which were also steep, but seem to level off. We're encouraged that there continues to be interest in vaccinating the youngest population, as well as the next age groups of 16 to 24, as well as 25 to 34. We strongly encourage people to get vaccinated. As has been discussed, this is the way to mitigate the effects of this Delta virus and to Delta variant, and also to decrease our hospitalization rate and further complications such as mortality. Next slide, please. So in terms of our our ethnic breakdown. So we can see from this slide that a smaller proportion of the Latinx and the multiracial residents are fully vaccinated compared to others, but progress has been made. When we look at the weekly change, the cumulative number of Latinx individuals rose by 802 between August 2nd to August 9th, with an increase of 1.5%. We are seeing the fully vaccinated number for the Latinx population tick up by about 1% per week. Again, we continue to reach out to these various populations to encourage full vaccination. And next slide, please. Similarly, when we look at the breakdown by HPI quartile, which is looking at the lowest, the Healthy Places Index, looking at those who have the least access to economic stability as well as healthcare. We see that in our HPI 1 category, 25% have been vaccinated. 69% of those in HPI 1 are at least partially vaccinated. And 77% of those in the highest are fully vaccinated. We again have been able to narrow this gap. It's not perfect, but at this point there's an 8% difference, and it had been much higher before, in the range of 13 to 15%. So progress has been made, and again, we will continue to reach out to these groups to try and improve our vaccination rates. And I believe that's my last slide. And I'll turn it back to Dr. Mace to speak about health workers. Thank you.
So we have done many things.
Unfortunately, you sound like a robot. So I don't know, something's weird with the connection.
Okay, let me, I'm going to jump back on just a second.
Great, thanks.
Sorry.
It's providing us our entertainment for the morning, so don't apologize. That was a good one. Supervisor Gordon suggested Mrs. Darth Vader. And unfortunately, we don't have Supervisor Rabbit here to entertain us with dad jokes. So we'll just have to take a momentary silence. Supervisor Gore, you've got any? No? You're still training to be a dad joke dad?
Can you hear me better now? Okay, thank you.
So much
Sorry
better.
about
Thank
that.
you.
Little entertainment for the morning. Okay, thank you so much, Dr. Shende. I wanted to now talk about what our response has been to the increase in cases. Our surge, it's considered a surge at this time. So effective August 3rd, Sonoma County went to an indoor masking health order, effective in all public indoor settings. That includes office settings as well as retail stores, restaurants when not eating and drinking, hair salons, etc. So that has been in effect now for the past couple of weeks. California Department of Public Health also put forth and will be in effect by August 23rd, requirement for vaccine verification in high-risk settings, such as healthcare facilities, hospitals, clinics, as well as homeless shelters and the jails, for all staff to provide verification of vaccination status, and if unable to provide verification of full vaccination, then they would have to be tested as well, either once or twice weekly, depending on the high-risk setting, in addition to masking, wearing medical grade masks, especially in healthcare settings. So this will go into effect on August 23rd. All of these facilities are expected to have full compliance by that time. In Sonoma County, with the collaboration and the coordination with our fire, law, and EMS providers and our temporary disaster shelter workers, we did extend this order to those groups. And we're working very closely with our fire, law, EMS partners to ensure that they're able to come into compliance with the vaccine verification, masking, and testing requirements by September 1st. Our testing team has been working individually with every group to get a platform in place for testing of unvaccinated individuals on a weekly basis. We are also, our HR, that is in the County of Sonoma, has also decided to pursue the same policy for all county employees to set the standard here for Sonoma County, requiring all county employees to submit verification of full vaccination, and if not vaccinated, submit proof of a negative COVID-19 test weekly. Now, these tests can be either the antigen test or the PCR-based test. The antigen test is the rapid turnaround test that can be done on site with a result within 15 minutes. And many of the stakeholders are deciding to use the antigen test. So County of Sonoma policy will be in effect somewhere in the first 1 or 2 weeks of September. And then we also released last week a recommendation to all Sonoma County employers as a best practice, recommending that they implement the exact same policy of vaccine verification for employees and routine testing of unvaccinated workers, in addition to the masking requirement indoors. So these are the things that we put in place so far, and we are considering some other steps along with State of California. State of California, of course, has some new health orders. There's a healthcare worker vaccine mandate. This is a hard mandate. The vaccine verification, some people are referring to as a soft mandate. The hard mandate would require all workers in certain healthcare facilities to be vaccinated unless they have a qualified medical exemption or a religious belief exemption. And all healthcare settings need to be in compliance by September 30th per the state of California. State of California has also extended the vaccine verification, masking, and testing requirements for unvaccinated K through 12 teachers. And all school districts have to be in compliance by October 15th with this. So again, requiring a proof of vaccination, and if unable to show proof, the staff would have to then have weekly testing for the K through 12 staff. Another order was a requirement for visitors in acute healthcare and long-term care settings. All visitors for hospitals, skilled nursing facilities, intermediate care facilities must show the proof of vaccination or a negative test taken 72 hours before entry inside. There is an exemption for emergency, critical care, or end-of-life visits. So these are some other things the state is doing. And we are working very closely with the state to see what else potentially we can do to try to mitigate the surge that we're seeing all over California and really throughout the nation. So now I'm going to turn this over. I believe it's Paul. Is it going to be Paul that discusses this? Paul Goldson?
Yes, that's correct.
Okay.
Yes. Yes. Good morning. Good morning, everybody. Good morning, Chair Hopkins and members of the board. Paul Gullickson, Communications Manager. We just want to give you a quick update of where we are in our COVID communications and marketing plan for 2021 in light of this recent surge in cases that we are experiencing due to the Delta variant. In particular, we want to give you a quick snapshot of our activity via Facebook, as that has been a focus of our communications concerning messaging, live stream community briefings, etc. First, we want to just let you know we are continuing with our Say Yes marketing campaign. I can show you an example of that, but I think you've seen it. We are, this includes ad buys in local print, broadcast, digital media, radio, and this includes public service announcements in both English and Spanish. Our digital marketing in particular is focusing on those areas of our community that have the lowest percentage of vaccinations. This Say Yes campaign uses photos of Sonoma County residents getting the vaccines or engaging in activities at home, at work with their masks on. The emphasis of this message is on the positive things that we were able to do once we all get vaccinated. So the message is say yes to being together again, say yes to doing the things that we love as a community, and say yes in particular to protecting yourself, your families, and your community by getting the vaccine. We also emphasize that the vaccines are safe, effective, and free, as there remain many myths about the vaccine that we in the health community, our health team, continue to encounter each day. In addition, our communications team has been producing flyers, posters, even refrigerator magnets, as well as daily messages on social media, all promoting where people can find vaccination clinics in our community, as well as where they can get information about such resources as the Spanish language vaccine hotline and the 211 line. We continue to share these materials with community-based organizations, businesses, cities, and other government partners and other groups. We also, I should add, we also have produced, members of my team have produced a series of videos in Spanish that include interviews of county residents who were hesitant at first to get a vaccine, but have since decided to go ahead and get their shots. And these are really informative interviews of these individuals as to why they changed their minds. And these videos too are being shared with our community partners. And finally, if we could just go to the next slide, I just want to point out this series of live stream community briefings that we've been having, holding over the past year. Many of you, all of you have participated in those briefings at one point via the county's Facebook and YouTube platforms. These community briefings have provided updates on COVID while also having an opportunity to respond to community questions. And these have been particularly successful, I think. As you can see by this first slide, our numbers of followers on Facebook has increased 115% since 2019, which pretty much coincides with the rise of the COVID crisis, if you will. Just keeping in mind reach in that last category, our reach average. Reach is the total number of unique individuals who see your content. So that's our average for each post on social media. If we can go to the next slide, please. This slide is, I'm sorry, it's a little hard to read. Hopefully you can read a little more on your own time, I mean, separately, but it basically shows that since November 2020, more than 623,000 unique individuals in the area have seen our content on Facebook. And the county averages right now about 77 posts per month, and with averaging about 150,000 viewers per month. And they engage with those, meaning that they share or like or offer to comment on that context 640,000 times. Overall, that includes 41,000 comments, and they have been shared. These have been shared about 10,500 times. Facebook provides its own benchmarks, and they rate our levels of engagement as excellent in terms of the average minutes viewed, comments, and shares. So that's nice to know. In particular, if we go to the, it is interesting also that most of our viewers tend to be women, which I found it to be interesting. If you go to the next slide, please. Yeah, and then this one, it really focuses on the videos that all of you have participated in. These are the community briefings. As you can see, the the traction, the viewership that we get, engagement that we get in those views have really tracked the rise of our cases, the rise of vaccinations, the rise of our cases, and the real peak interest was around the time of January. But we've continued to see surges of interest, and we're starting to see a surge right now. Between March 1st and August 12th, the county has offered, just in that period of time, we've offered 24 community briefings and have reached 172,000 viewers. And our average readership and engagement has been pretty consistent on those recently. I want to point out in particular, last week we had 2 community briefings in partnership with the Sonoma County Office of Education, and with a focus on the return to school. And these were very successful. Tuesday's briefing, which was in English, reached 10,300 viewers with 2,200 engaging, liking it, or sharing it in some way. Thursday briefing was all in Spanish. And that one was particularly encouraging as we reached 6,200 viewers in that particular streamed event, with 975 engaged viewers and 170 reactions, likes, shares, and comments. So we are going back to resuming these community briefings on a weekly basis. We had tapered off there in the middle of summer, but we're re-engaging them. And this week we're doing a briefing tomorrow at 4 p.m. on COVID to go over much of the information that we are sharing with you today. And then we will follow on Thursday at 4 o'clock with sharing much of the same information in the Spanish language presentation. And so we are hoping to continue those, offering those presentations in English and Spanish on alternate nights. So if you could go to the last slide, I think that's our last slide. Okay, I think we now will go to Tina Rivera to talk about our EREP program. Thank you.
Tina, if I may just just wanted to add one thing that we forgot to mention, and that is that I think all of you know that CDC and CDPH has now recommended a booster of an mRNA vaccine for those persons who are severely immunocompromised. And we just wanted to update the board that the CDPH statement or recommendation hasn't come out yet. We expect it to be released anytime. And this will impact severely immunocompromised people. For example, those receiving chemotherapy for cancer, organ transplant recipients, people who are on significant immunosuppressive doses, significant doses of immunosuppressive medications. So we are going to work with our healthcare partners to try to identify the best way to reach those populations with the boosters. But I just wanted to make sure that you're aware of that. Tina, back to you.
Thank you, Paul, and thank you, Dr. Mace. At this time, we'll share briefly how our emergency rental assistance program is working, how it's performing. Next slide. Since the inception of the program in April, mid-April, till August 13th, which was last Friday, we have processed with respect to tenant applications in excess of 2,400 of those particular applications. With landlord applications, we've seen an uptick of over 1,000, with a total of approximately 3,400 applications that have been processed. So with respect to direct assistance, as of Friday, this is almost $7 million that we've been able to get out the door with respect to assistance to individuals who have needed this critical assistance. Next slide. Just some brief demographic data. We are seeing with respect to the ethnic breakdown, not a whole lot of changes in these particular numbers. So one of the things that we are going to do is staff and our community-based organizations will be meeting with our equity work group to really dig into some of the gaps, some of the disparities that we're seeing still yet in our communities of color, and how we can better address and reach those areas and those disparities, address those disparities within our communities of color by using and leveraging our current relationships and using those partnerships and addressing those gaps, because we know that individuals respond well to trusted partnerships. And with respect to race, we're still seeing those applications that have been processed. Most of those have been in our white community, about 51%. Those identifying as multiracial and those who decline to answer that question are roughly about 19% of those applications that we've processed. And with respect to our other communities of color, we're seeing about 3 to 4% of those demographics or race populations being reached. Next slide. With respect to the cities that we're seeing that we're serving, most of the applications and most of the individuals that are reaching out for assistance are coming from the city of Santa Rosa, with about 49%. About 13% of the assistance is coming from Rohnert Park, with 9% from Petaluma, 6% Sonoma, 2.5% from Cloverdale, 4% from Guerneville, and 5% from the city of Sebastopol. Next slide. So we wanted to share with you some other things that we're doing to get the word out. We have been working with our PIO team here, and we're looking at some ongoing marketing and promotional activities to put those things in place to really reach into the community and address getting the word out. We're looking at the emergency rental assistance program, running one social media post a week on Facebook and Instagram or Instagram stories. This post would include how to apply, where to apply, and how much funding is still available. We still have a lot of funding available to address the needs of our community, funding that will even go through 2025. We're looking at putting out additional resource flyers. We have been doing this, but we will continue to do this, circulating resource flyers with respect to having contact information, additional referral information as to where people can go. We're putting additional resource flyers at our COVID testing sites and other places. We're looking at connecting with our city partners and having them do another round of inserts into customer bills. We're looking at 211, providing information on program eligibility. They began this effort on August the 8th, and they're also going to provide application assistance to anyone who calls in and needs this particular assistance. We'll be providing updates to local media partners bi-weekly. We'll also be doing radio interviews twice a month. This will be taking place. Next slide, please. Some of the upcoming and potential marketing options that are in development. There are 2 videos that are in development at a number of locations, such as locations as Ortega's Market in Petaluma, Ortega's Juanita's Market, in Rohnert Park, Lola's Market in Healdsburg, Chavez's Market in Santa Rosa, and just a host of others that we're looking at boosting and putting out those particular videos. We're looking at boosting some social media posts for targeted Facebook advertising in Spanish. We're also increasing our PSA frequency with our current partners, both in English and in Spanish. And then also looking at some direct mailers. We're looking at doing a direct mail to approximately 100,000 targeted zip codes so that we can really address those disparities and inequities that we are seeing and hearing. So with that, that ends our presentation, and I'll turn it back over to you, Chair Hopkins, for any comments, questions, or feedback. Thank you so much.
Thank you so much. Since this is an informational item, I will just sort of open it up to questions or comments from my colleagues. Supervisor Gore.
Thank you all very much. This is a wealth of information about where we're at, and I think where we're going. I wanted to start with some questions about about testing. And I really appreciated the details about it, but a couple things about testing and then vaccines and some other stuff. But with respect to testing, we have our number, which is, I think, Dr. Mace, as you mentioned, we're up around 360, or maybe it was 380, 390, whatever that was. So this goes back to, I think about a year and a half ago when we were doing this, and we were trying to figure out, is what we're testing really calculating the true testing metric that's in the community? And I guess I just want you to kind of maybe go through this a little bit. Like, for example, I went down and got a rapid antigen test at a CVS the other day because potentially one of my kids had been exposed, and then I got a second one. And so obviously in my mind, number one is that antigen tests performed at home are not being calculated. And there's really no way for us to track that in any way that I can imagine. The other one, which is more to my interest level, is now that we have so many businesses that are requiring testing or new job classifications. And I don't know about everybody else, but the school that my kids go to are going to now require weekly testing. And so is there a way for us to make sure we aggregate that data? Because back in the day, we didn't get credit for the fact that initially some private groups like our casino were doing testing and we weren't getting them into our system. So once again, we're not being judged based on this by the state for our reopening. I understand that, but I'm just trying to make sure that our testing numbers are reflective of really the true testing capacity in the community. And any thoughts you have on trying to make sure that we see what's going on with businesses that are willing, or schools or other things of the like.
Yeah, I think that's a great question, and it is a big gap that we aren't able to count all of the Binax antigen tests, especially for individuals like you just described who are just able to do that at home. There's actually no guarantee we would get even positives reported if they're going to be done by individuals at home. We're hoping, of course, that anybody who turns out positive is going to, contact the health department, and we'll be able to get that in the system, confirm it with a PCR if necessary, that kind of thing. Now, as businesses start using Binax now, schools and even our law fire partners, positives will be reported. And we're putting that in place. That's definitely, I think a procedure that's already in place with the fire law EMS groups. Negatives, however, it's much harder to track, because it adds a whole layer of reporting if they have to put into place a mechanism for reporting every test that's done. That's what I'd like to see happen, especially with, like I said, the groups that are going to undergo weekly testing. But it's something that we definitely we're not going to capture it all. And we need to work with the partners to try to get as much of that information as possible. Now, again, because it's not linked any longer to our metrics and reopening and that sort of thing, back in the fall when we were in the blueprint, it was incredibly important to get every test counted just so we get credit for it. Now, that is not in the equation, but still, for just general surveillance and for our data, it would be really good to try to have some approach to maybe even estimate the numbers of tests being done. I don't know, Kate, if you, from the EPI standpoint, wanted to add anything?
I think you covered it pretty well. I think that you make a really good point about the antigen tests that, that when we look at our case rate, we see that it's increasing, but it may be an underestimate because we don't really have a sense of all tests being conducted. But yeah, the hope would be that as individuals are getting positives, that's coming to the attention of their employers, to the health department, and that really that it's serving the purpose that we're hoping that we're finding cases so that individuals can quarantine and isolate as needed, even if we're not able to track every test.
I guess just the follow-up would be a request for you all to maybe at a future COVID update, I'll ask again, is for you all to think about what's the appropriate testing that you want to be doing as a health department. We're not we're not tied to the state in terms of metrics anymore. So, instead of having somebody like me say, are these true numbers? Because obviously the people who choose to get tested now, for a while, that was only individuals who were, I think, more symptomatic once we did opening. That's what I would think. And now we're back into this place where there's a lot of businesses and job classes. And now we're going to have testing be a requirement for schools and for potentially schools and other things. So it's kind of like, as we've talked about with the strategy of tracking these numbers, are they really tracking something consistently? Are they tracking just a flow in, like number per 100,000 tested? Is that even relevant anymore? And I only say that because all of these things are the questions that people ask me, and they buy into us really owning our own messaging and making sure our community tracks what's consistent. So maybe, for you all, I would love for you to say, these are the things that we think we want to test. So just set that aside. The other thing I really want to I ask and pass over is for the vaccine verification and where we're at with moving forward. It seems from what we hear is that we're going to have a emergency use authorization at some point be approved for Pfizer and Moderna, not for the others here. And then we're also moving in, as you mentioned, into the booster kind of world. For vaccine verifications and all these things, I guess, I just want to state that I'm very supportive of what the orders that we've done so far in terms of vaccine or testing. We see certain companies like Kaiser saying, no, we're not going to allow testing. We're going to go straight for vaccination. Like, we're requiring this. And I think there's going to be a big question and a big discussion coming up about schools and about other things. So what we've talked about before is, how do you compare what's going on with vaccines right now and what the law is for schools and other areas versus regular vaccines in our community? And so I don't know if you're prepared to answer any of this, but I mean, for me, I remember we had conversations about vaccine hesitancy in certain areas of our community prior to COVID. And there was a bill actually in the state legislature by a guy, State Senator Pan, who basically had a huge movement of folks who were anti-vaccination who descended upon the state capitol. And we saw notices of upticks in outbreaks of measles and mumps and all these other things. So part of my interest is normalizing the conversation of vaccines. So it's not just based on COVID, it's based on our community, where we're at and where we need to be. And I don't know if you're prepared to answer any of that now, but I just in a future briefing would love to see also some slides that potentially do that we could share with the community and kind of talk about vaccines as opposed to just this thing that in some cases has become political or a touch point. Thank you.
Thanks. I think that is a great point. We will put together slides about general vaccinations for our county and what percentage of people are, obviously, getting the flu vaccine or the pneumococcal vaccine or, varicella or whatever it is that other vaccines that are given, because it does normalize it more. I think the big the flu vaccine is the next vaccine that's already here. You can get your influenza shot even now. So I think that's a great discussion to be had. And we at Kate will work on putting those slides together.
And just as a final, I would love to also understand if you need support from our staff or whatever, is not just what are the levels, but what are the rules around this for different areas? Are there certain things that are required? Once again, normalizing this conversation. A lot of people don't think about it because we just do it when they're kids, right? Can you travel to other countries? For example, you can't go travel if you don't have a vaccine in certain countries already. Are there any requirements currently for schools? And my understanding is that mandate for schools has to come out of the state legislature. Was a conversation we had with the governor's office. So just some of those things that let us understand what the kind of field of play is with vaccines. Thank you.
Absolutely. Thanks.
Thank you very much, Supervisor Gore. Supervisor Corsi and then Supervisor Gorin.
Thank you. And thanks for this presentation. It's disturbing information, but good information to have. We've obviously we're dealing with a summer surge here. I'm wondering what your expectations are, maybe your predictions now that we've got a lot of unvaccinated kids going back to school, grouping together all day long and coming home to the parents and being out in the general community. Is this something that is a concern?
I think it's definitely a concern. I think, we're going to find out as we move forward here in the next month or so what's going to happen. We'll follow the data. We have meetings every week with the Sonoma County Office of Education and Dr. Harrington's group. And we'll have to see. I mean, I think we can expect we're going to have more cases and we're going to have outbreaks. We have that population of under 12 that are unvaccinated. Now, the masking mandate indoors in school is meant to really try to mitigate, to the extent possible, transmission of COVID in those settings. And then, of course, I'd like to see that 12 to 15, actually really 12 to 18-year-old group to increase our vaccination in that group. Only 50% of the 12 to 15 from Dr. Shenday's slide are vaccinated at this time, when we should really be closer to 90% now that schools are reopening. So I hope that the vaccine verification and weekly testing for school teachers is going to be helpful to try to mitigate the spread as well. But you have a great point. Of course, we're balancing that with the need to get our kids back to school, face-to-face learning. And we saw that there were a lot of detrimental effects of distance learning and staying at home and not socializing in the last year and a half. So I think we need to really just balance the negative repercussions of that versus now being back in school, and try to do this as safely as possible. We'll track our data and definitely have regular updates on what we're seeing from the school sector.
Yeah,
if I may add one thing. So it's important to note that school districts that stayed open during the pandemic and had preventive measures in place saw very little transmission. We know that there are going to be cases. That's going to happen. But the majority of cases in these school districts that stayed open were from household transmission. And that's exactly what we're seeing in our community right now. It's really household gatherings, large and small gatherings, larger events, sports events, extracurricular activities where we see a lot of the transmission. So making sure that that child is protected by ensuring that the entire household is protected against COVID is one of the best ways to ensure that children stay safe. And again, we will be monitoring this information very, very closely. And if there's concerning trends, then we will act upon that. But the best thing that parents can do right now is for protecting their children is to really protect themselves so that that virus does not get into the household.
right. And I agree that the experience of schools last year that stayed open is instructive and optimistic. But the difference is the Delta variant, and that is a big difference. I wanted to, and also just, yes, absolutely. We're all glad that kids are back in school now. And I can guarantee you the teachers in my family are glad about that too, because they didn't have much fun doing that from home either. What is the protocol in schools if there is a positive case, as far as quarantine, et cetera? And is that set by health, or is it set by school districts?
Well, it's been a joint effort, really, between the school district and public health. So we do give the recommendations, technical assistance. We have a school team that will identify the case, walk through who's been exposed, along with the school, of course, because the school is tracking, which kids are sitting next to each other. Was it an outdoor sitting exposure? Was it an indoor exposure? Who was the index of the first case? And then we'll do the contact investigation and testing of those that have been exposed. And depending on the numbers of cases and the extent of the situation, make decisions along with the school as to whether that particular cohort, that classroom needs to be, that people need to quarantine and needs to be shut down, or whether it's multiple classrooms. And then at some point, there's protocols in place for when depending on the size of the school, whether the entire school needs to shut down or whether we can just do it, on a piecemeal basis while still keeping everybody safe. So the contact investigation teams and the case management teams at Public Health have been doing this for the past year with different situations in schools. So they're well prepared, and the schools now are getting more and more well prepared. So we've been through this drill many times, and it happens very systematically and efficiently.
Thank you. That's all good to know. Just want to switch gears to the rental assistance piece. And I'm wondering what the targeting is for the direct mail. Besides zip codes, is it actually targeted to renters within zip codes? And are there any other subgroups that you are looking at?
And Paul, I'll let you speak to that.
Yeah, do you want, I'll take a look at that. Supervisor Corsi, we are looking into, right now we have it just broken down by key zip codes. And we are trying to see if we can get down to the level where we can target just renters. We're looking into that possibility. But at this point, we are, because we recognize that this direct mailer is not a great efficient way to get the message out, but it is a comprehensive way to get the message out. We know it's going to reach many people who are already vaccinated, for example, and may not even be renters, may not qualify. But this is a real blanket approach we feel would be helpful, at least in this one time, as a one-time effort. But we're looking into that.
Thanks. And can we use that rental assistance pool of money to pay for the outreach?
Yes. Yes, we have some administrative dollars that can be earmarked for this.
Thank you all very much.
Thank you very much. Supervisor Gorin?
Thank you. All good questions. And I appreciate the information that you presented. Man, we thought we were moving into the end of the rainbow now, and now it's more confusing than ever as we're looking at booster shots. We have to go through the rounds of vaccinations again. We had inadequate testing at first, then pushing vaccines, and now booster shots, and now we're doing both. And so it is really challenging, and I thank you all for being nimble and flexible and anticipating how this is moving forward in the community. I share your concerns. My question is regarding testing and the sufficiency of testing, and I bring to it a personal story from last week. Family vacation, vaccinated adult daughter, had symptoms similar to COVID, hospitalized, was given an antigen test that proved it was iffy. They could not determine whether or not she had contracted COVID again based upon an antigen test. So what is and I know Supervisor Gore said he rushed out and got an antigen test, but it's not, is it or is it not definitive?
Yeah, it's a really good question. It's not as good a test as the PCR-based test. Now, the antigen test does pretty well in symptomatic people, but can miss COVID in asymptomatic people. Additionally, in both categories, whether you're detecting someone who has COVID or excluding COVID in somebody, that antigen test is not as good as the PCR-based test. The advantages of the antigen test are that it's rapid and it can be done on the spot. And for operationalizing routine testing of groups of people, it's a lot easier than having a PCR-based test that has to go to a laboratory, be processed, and the result isn't ready for 24 hours, sometimes 48 hours. As we saw in the peak of COVID last year, sometimes it was taking 7 days to get a result back from a laboratory. So it's kind of a matter of balancing the benefits of the use of the rapid antigen test versus, as you just said, the potential that we are going to miss some cases. Now, there are some specific recommendations on when to do a PCR to confirm the results. Positives should be confirmed by a PCR-based result to make sure they're not false positives. If there is I believe it's a symptomatic individual that's negative, you may want to confirm that also with the PCR-based test. So there's some specific recommendations around when to do a PCR-based test. Early on, we were doing a PCR for every binational antigen test that we did to confirm the results. If we are going to be doing a lot more antigen testing with the surveillance testing, it's unlikely we're going to be able to do a PCR for every single antigen test that's done. However, the other thing to note is when you do serial testing with the antigen test, it's better. In other words, if you do it 3 times a week, we saw this in youth sports, the testing with the antigen test just gets better, more accurate because you're doing multiple tests in a row. Similarly, if we're doing weekly testing with antigen test, it's possible that test, how good that test will improve because you're doing that repeatedly every week in the same person. I don't know if Dr. Shende or Kate, if you or Paul, anybody want to add anything?
Just to mention, which I think you did state, that the antigen tests are much more accurate in somebody who does have symptoms. And I think one of our, it's hard for the general public to understand that just doing an antigen test may not be true accurate results. As Dr. Mace mentioned, so symptomatic people, as well as those who are getting tested regularly, improves the accuracy of the antigen test significantly. But the PCR is still the gold standard.
And it's possible that with the Delta variant, as I noted, the viral load is much higher. The antigen test could potentially, and I've got to look at the literature to see if anybody's actually put that out there yet, whether the antigen test is better due to the fact that the Delta variant, there's so many more viral copies that it might be picked up more readily. I don't know if anybody else wants to add anything, but you pointed out a gap in the antigen test, but there's definitely a role for the antigen test given what we're moving towards and operationalizing routine weekly testing in many different groups.
Thank you so much. My daughter proved negative, thus I am here and not in self-quarantine in Colorado, but so that's the good news. But I am concerned that the community's needs for testing, rapid testing, whether if they are being mandated to either have vaccination or weekly testing, do we have sufficient capacity for rapid turnaround testing for large numbers of folks in Sonoma County, if in fact they are among the classes that are required to do so?
So what we're doing specifically now for fire law, we've done it for schools as well, is to get them connected to the state testing platform. So there is a application process. We're trying to shepherd this through our fire and law folks now, where any group can reach out and put in an application for this kind of testing through the state testing task force, and they will send out someone to train how to do the test, to provide the antigen test, to provide a courier service for getting the testing done if it's a PCR-based test, to also record and report the testing. So we're going through this now with like I said, with the different law and fire groups, try to set them up for that. So hopefully that's going to really help boost our ability of different groups. So this is for businesses. They've done it for the schools very successfully. So that's one possibility. And of course, then we have other partners that are doing testing in different groups. We have Curative, we have Molecular Matrix, we have, still some of our other groups that are testing, and then our own pop-up testing. So I don't know if Dr. Shende or Kate want to add anything to that?
No, I think you covered it. In terms of actual numbers, we only had capacity of roughly 1,000 tests a week as of about 2 or 3 weeks ago, and that's really bumped up to 14,000 a week, and we hope to provide even more. But that plus the state assistance in being able to provide for businesses and schools should boost our capacity. But we will continue to pivot as we always do and see how we can meet the needs of the community. We realize that the demands are really high out there, and we're doing our best to try and accommodate them.
And lastly, we do have 2 LHI mobile vans now. We added a van, I think, during the last couple of weeks, and our testing team, Chelsea and our testing team are working really hard and making sure that van is in a different place every day of the week and covering the county to the best possible way to provide 200 to 300 tests a day through each van in different locations around the county. And that's the PCR-based test, not the antigen test. Curative is also doing PCR-based testing. Our own testing in pop-ups is also PCR-based testing. So the county is really providing the LHI some partners PCR-based testing. The Binax antigen, we are recommending for those groups that are going to self-test weekly for the unvaccinated individuals.
Just a real quick question, follow-up question. For those undergoing medical procedures and needing rapid turnaround COVID testing, do we have that information on the website as to where they can get the really rapid turnaround COVID test?
We provide daily updates on social media and the website, the Supervisor Gorin, about testing opportunities. I will check on, I know we have shifted, the county strategy has been to shift to PCR testing. We know pharmacies, as Supervisor Gore mentioned, pharmacies are still offering the antigen tests. So those are available, but I will check to make sure that we have communicating on the availability of the PCR or the antigen test, the rapid tests to the public. But I believe we are.
Thanks, Paul. And I know you're trying to cover all bases and using all platforms to get the information out. Do we know, or do we have a way of tracking the effectiveness of the messages going out, whether people are receiving them, and if so, what platform they are receiving the messages on?
That's a great question, because we're always interested in where people are getting their information, and what messaging is really work. We are doing some surveys right now, particularly with youth messaging, because we are really concerned about that. Well, that younger adult population in particular, about getting them vaccinated. But we are looking into that, and I'd be happy to share that information with you when we get it.
Great. I would appreciate that. Thank you so much.
Thank you very much for that, Supervisor Gorin. And I just want to say thank you so much to staff for a very informative presentation. One question that I have is regarding the intersection of COVID-19 and poor air quality from wildfire smoke. Just happened to catch sight of an article that mentioned that, we likely had exacerbated COVID-19 complications based on the wildfire smoke last summer. And so just wondering, if there's any thoughts or additional information regarding that, and also if there are potentially any recommendations for residents as we anticipate wildfire smoke blowing in later this week.
Yeah, I think that, certainly that could exacerbate if you have underlying COVID-19, obviously, they're both things together are definitely going to create worse outcomes. But I would just say, we really want people to stay out of the smoke, and try to, protect yourself from that, as well as from all the mitigation measures we've been discussing for COVID. Especially if you're at risk, if you're an unvaccinated person, really take care to ensure that you're not part of large gatherings, going to indoor places without a mask. I think it's a real issue, and we don't know really what the dual effect of both of these things are going to be on the outcomes. And that's something I'm sure that there's ongoing, I'm sure people are tracking that and ongoing research. I don't know if anybody else has any thoughts about the question.
Well, the other thing I would add to that is masking, even outside, is going to be very helpful if there's wildfire smoke. And we also know that if there are crowded outdoor places, then masking is also going to be helpful, beneficial in reducing the chance of picking up COVID. But in general, staying indoors, well-ventilated spaces is important. There is concern that wildfire smoke will have other health effects, but again, a lot of those studies are undergoing, and there'll be more information to come. But I think the take-home message is, if one is unvaccinated, please do consider getting vaccinated. That's probably the best protection, and then continue masking indoors and particularly outdoors over the next few days as the smoke blows in.
Thank you very much, Dr. Mason, Dr. Shende. And just a reminder, right, when we talk about masking for wildfire smoke, this kind of a mask will not help you. You do need to wear an N95 or a KN95 to really get, at that particulate matter. So one other, question following up on that, and maybe this is a potential topic for a future board meeting or something that we could consider some contingency funds for. I was approached by a resident who was looking at trying to distribute air purifiers to socioeconomically disadvantaged residents. And this is something that I've thought about for a long time, which is that, my family is fortunate to be able to afford air purifiers, and we have those running whenever there's poor air quality to make sure that indoors, the air that we're breathing is safe to do so. And I'm just wondering, if this is something that could potentially be supported by the county, or if you're aware of any efforts to try to support, I know we talked in the past about clean air centers, right? So that people can go to a location to have safe air to breathe, but it also might be really wonderful to afford that opportunity to those who otherwise might not be able to.
I would add that I believe this was something that Human Services was involved in with the adult and aging population. So this would certainly be something that we could partner with our other sister departments with to look into how we can solution for this. This is an absolute need. As we were making calls to that particular population, this even when we had previous fires, the 2018, 2019 fires, this was one of the concerns with our senior population. So I think this would be an absolute effort, an initiative that we could come together collectively with our other departments and solution for. So something certainly worth moving forward and discussing.
Great. Thank you so much, Director Rivera. I really appreciate that. I feel like my colleague Supervisor Corsi covered it adequately, but I just want to add my voice as someone who is certainly watching closely the reopening and return to schools. And while I am really excited for my children to be able to return to in-person learning, it is also with a considerable amount of trepidation. Particularly since, at least at the school that my children are attending, right, they're looking at indoor masking, but not outdoor masking. And, just knowing that children do tend to congregate in very, close proximity for prolonged periods of time whenever they're let around outside. And so I just want to say that I really appreciate all of you for following and tracking that data and that information, and for staying in close coordination with our schools. And I look forward to, continuing to follow that data. And thank you very much for all of the work that you do. Any other sort of comments, or is there any response from staff on schools? I feel like we sort of covered that with Supervisor Corsi pretty thoroughly. Looks like Supervisor Gore has one more question.
I just one follow up from what you had said earlier. I was familiar with the whole discussion about the Delta virus being, you said 60% more transmissible. I've heard as much as 80% what's been reported. But this other indicator you talked about, which you said, I can't even, what did you say? It's 100 times, or it has 1,000 times more?
1,000 times the viral load. In other words,
talk about that.
The virus. So there's that much more virus in somebody's system. And so it's more likely somebody could be infectious because they have a lot more virus on them.
So it's more likely that they would be infectious. Is it also more likely that it would send somebody into a bad health situation because of that same viral load?
That's a really good question. And that may very well be the case. That we'll have, we might be seeing some of the worst outcomes even in fully vaccinated individuals due to the Delta variant. That's possible. Again, that's something that I think as we see more and more numbers and we have more data on, we can probably comment better on that. So transmissibility and the viral load are go hand in hand. It's more transmissible because the viral load is that much higher.
Okay.
So they're not separate things, in other words.
Well, thank you. I think what we've heard out of the state too is very similar. I was on a call with them with the state leads last week, and Dr. Galley started off by saying that this is very different from the original Wuhan virus, as it's being kind of referred to now. But I guess one further thing is, and I think this we need to make sure we talk with folks about this too. Is that my understanding? Well, in our conversation with the state and what I've seen here is that at this time, even with let's just talk about it. Shutdowns, right? People are asking me all day about shutdowns. Are we looking at shutting down the economy because of the Delta virus? What I have heard from you all and what I've heard from the state and where I stand is that it's this issue of us having to wear a mask To me, that's an inconvenience, even as somebody who's been vaccinated and somebody who's had COVID, right? It's okay. It's an inconvenience to me at most. The idea, though, of shutting down our businesses and getting into a world where we have to subsidize people for unvaccinated individuals is something that currently it doesn't sound like that's being discussed with the health officers, and it's not being discussed, I know for sure, with the state. There's no talk about shutting down sectors of the economy because of the Delta virus. The kicker for that we're trying to be clear with people, from what I heard from the state and from my perspective, is that it's different if we have breakthrough cases. And when you say breakthrough cases, not just folks who are vaccinated who are getting COVID, but if we truly see folks who are vaccinated, not just getting COVID, but getting hospitalized and going back to the world where we're moving into loss of life and other issues. And I want to make sure that we address that. Any thoughts?
I think you summarized that really well. I think that we are seeing more cases, more transmission, especially among unvaccinated individuals. And we're seeing, although we're seeing more cases in fully vaccinated, we're not seeing the kinds of outcomes that we were seeing before in terms of hospitalizations and deaths. There is no talk right now about shutting down the economy or businesses or anything like that. We are really talking about mitigation measures, like you said, the masking, the routine testing, vaccine verification, boosting vaccination rates. That's actually first and foremost the most important thing. And I think the idea that we're going to all be having a booster soon is specifically to address the Delta variant, so that we're going to start again, likely here in the next month or so, to give people a third dose. We're already starting with the immunocompromised individuals, as I mentioned earlier, but then we'll probably be going to healthcare workers and first responders and the elderly again for a third shot, hoping that that third shot will help protect folks even more against the Delta variant. So those are the kinds of things we're looking at to address what's happening in terms of transmission, the Delta variant, but not really looking at the other things like that would affect the economy more, because we're not seeing the numbers of deaths we were seeing in December, January. So it's a different animal right now, thanks to the vaccination effort.
Well, and I think it's crazy. I mean, from the past year and a half, while we talk about the economy, we're really talking about livelihoods, right? I mean, we don't have anyways, we've all talked through that. I want to thank you for confirming some of that. Appreciate it.
Thank you very much, Supervisor Gore. Any other questions or comments from members of the board? All right, I do know that we have a number of members of the public who would like to comment on this item. So I'm going to take a brief bio break before we go into public comment. So we will return in about 10 minutes and begin public comment at that time.
Hi, good morning still. We're ready to begin our process to resume. Just one moment. All right, and I think we're ready to go, Chair Hopkins.
Thank you very much, Marcy. So with that, we will go ahead and begin public comment for this board item. And we'll go ahead and start with in-person members of the public who wish to speak. Thank you so much for joining us today. You'll have 2 minutes. Absolutely. We'll start as soon as you start talking. Yes. Actually, wait, hang on. We can hear you, but we want to make sure that all the members of the public who are participating virtually can hear you. So hang on 1 second. We're not eating your time. Are we good? Let's do one quick test. Testing.
1, 2, 3.
We can hear.
Marcy, can you hear? Perfect.
Yes.
All right, great. And if you stay closer to the microphone, that's actually helpful for the folks who are participating virtually.
Okay.
Thank you so much for being our guinea pig. I appreciate it.
Okay, I'm not a guinea pig. I'm Lee Edwards. I live in your district out in Monterey. I have 2 topics I'm going to talk on. This is just for item 18 on the agenda. I have a big disappointment with our supervisors and the advice they're taking from their medical health advisors. I experienced the COVID virus in late January and was over it in February. I have what every vaccine in the world has historically strived for, the perfect immunity. That's what vaccines are for, to emulate personal immunity. I have that. How do I know that? Dr. Mace, wherever you are, do you know that people in your county are part of a National Institute of Health clinical study? I bet she doesn't even know that. My blood is drawn every 3 months by Kaiser, and they test my antibodies. Guess what? I have robust antibodies to this date. I'll get it, and they're going to run this study for 3 more years. I'll be having my blood drawn every 6 months. Eventually, it's every 2 months now. Why don't you know that? Why don't you know you have 35,000 people in this county like me who experience this virus and have perfect immunity? You should celebrate that. Instead, you pretend like there's these unvaccinated people that experience the virus. That is just, I'll use some words you use in your campaign, bullshit. It's just, that's how it is. And I wanted to express that here loudly, adamantly, emotionally. You are doing a disservice to your county by not recognizing natural immunity in your community. I looked at the Press Democrat. There are nearly 35,000 people in this county that's had this virus, have gotten over it, and have perfect immunity. Recognize it. That's all. I'll be back.
Thank you very much, sir. And if I don't know if there's any documents that you wish to share, but you could leave them on that table.
On this one. If you want you want to see my test from Kaiser, I'd gladly share it.
That's okay. Have a wonderful day. Thank you so much for coming out today. I appreciate it.
Hi, board.
Hi, would you mind putting your face mask above
Are we
on your
close
nose?
to each other? Do we have a problem? I have.
Thank you so much. Appreciate
California.
it.
I'm flying the peace flag today. You probably have never heard of it. You might want to look the peace flag up. But in my hand, I can't do this. I have a medical exemption. And right here, I have the California
Would you mind just
Department
covering
of
up
Public
over your
Health.
nose? Thank
Have
you.
the California Department of Public Health guidance on facial coverings. Okay, exempted people are right here. And it states for the record, at all times, individuals who have medical conditions, mental health conditions, disabilities, hearing impaired, obstructed breathing are exempt at all times. And this is your policy and you are not enforcing all of it, only part of it. That's the first thing I'd like to say. This is bullshit. Secondly, I want to address the safe and effectiveness of this COVID vaccine because right here, I have the Pfizer insert. You are telling false information to your constituents, to this county. Whoever's listening to you is getting false information. And I will read that to you. It's not a US FDA approved vaccine, and it is your choice. It says it right on here. Secondly, you say that it's safe. I'm going to go ahead and read you the severe allergic reactions besides the difficulty breathing, swelling of your face and throat, fast heartbeat, bad rash all over your body, dizziness and weakness, severe reactions. Oh my gosh. I'm sorry. There's an entire list of severe reactions, including death. So you want to tell us it's safe? You are telling us false information and lies. You want to say it's effective? Here on the front.
And thank you very much, ma'am. Your 2 minutes is up. So we'll ask for you to vacate the premises so that the next person can come up to the microphone.
My last question is.
Thank you very much. Thank you very much. It's an opportunity now for the next person to speak. Thank you. Have a great day. You can go ahead and approach the microphone to make your public comments. Thank you so much. We'll start the 2-minute timer as soon as you start speaking.
No?
Perfect.
Hello, my name is James Santana. I'm a longtime Sonoma County resident, property owner, taxpayer, ex-businessman. And thank you for the opportunity to speak. I just have a couple of things to say. I've been following this issue for a long time, looking at both mainstream media and the alternative sources. I read a lot. First thing I want to bring to your attention that I'm sure you've heard of is that the CD reported quite a while ago that 95.5% of the COVID deaths had 2.5 other significant contributing conditions. Most people who have heard this and read this wonder if those who died in the 95% group, those who had the other serious illnesses, if they would have died soon anyway. Just something to think about. Okay. The other thing is that I just checked this morning, there have been about 620,000 COVID-related deaths in the United States since this began. If you divide the number of deaths by the population of the nation.
And I'm sorry to interrupt you for 1 minute, and I'll give you a little extra time. Would you mind coming a little closer to the microphone? We just
Sure.
want to make sure that everyone who's in the audience can hear you as well. Thank you.
If you divide the number of COVID-related deaths by the population of the United States, the answer is less than 0.1%. Okay. So those in opposition to these mandates, the vaccinations to continue working and masking, agree that COVID-19 is a real disease. People really do get sick and some are dying. I have no doubt about that. But is it really an emergency looking at the numbers? Is it really an emergency or is it something else? I'm just asking that. I don't expect an answer. And if it is something else, what is it? The last thing I have to say is, do health officials or governors have the constitutional right to make laws? What happened to the legislative branches of our governments?
Thank you very much. And that will conclude your time. I did give you the extra to make up for it. I really appreciate you coming out here today, and take care.
Thank you.
And if you wanted to come on up, and again, we'll just start whenever you start speaking. Thanks for joining us today.
Hello, Board of Supervisors. My name is Jay Hepper. I've been in the county since the 70s, and I'm concerned with the direction the board's taken in reopening the county and our schools. There seems to be an absence of reliable fact-based evidence to our lockdown and control, making it difficult for an adult, let alone a parent with a kid, to try to really get true information that would help them make an informed decision. The news media overall seems to have lost their credibility, and there are folks in charge out there who don't even follow their own rules they impose on us. I hear what I hear, but what I see is different out there. A Sturgis rally or a Seattle riot, a few have either been hurt or died, but nobody was from a virus. Apparently, the infection potential for kids under 12 getting sick is extremely low. Low risk is what I see. Zero risk of anything realistically is unachievable. There's no information regarding the injury or death of children from complications of the vaccine itself. The data seems absent. Information based on the PCR method of analysis is controversial and could arguably generate a high level of false positive results, unnecessarily frightening parents and keeping our county hobbled in unnecessary and possibly unlawful restrictions. In closing, we're not now in a state of emergency. Our schools need to reopen back to normalcy, and I believe it's the right of parents to decide to inject and mask their own children or not. Board, I'm asking you, free the sanctions on our school and our county. We need to grow and get strong again. Thank you.
Thank you very much for coming today. I really appreciate it. Have a great day. Take care. And again, if you just go ahead and step up, we'll start the timer whenever you start speaking.
So does the vaccine work? 80% you say of Sonoma County is vaccinated, but yet we have a mask mandate. You're forcing employees to be vaccinated or have a weekly test. It either works or it doesn't work. If it's so efficient and so great, then pro-choice, take the shot and don't worry about someone who doesn't want to because you're covered, right? No, you can transmit the virus having a vaccine shot, and you can get the virus. So what's the point of taking the shot? It's simple. You can talk about numbers all day long or go through things that you see in front of you and everything we tell you. It doesn't matter. It's simple. Why would I take a shot where I could still get the virus and transmit the virus? Why? That means it doesn't work. So everything you're saying and going by is not true.
Thank you very much for coming today. And if you go ahead and want to come up to the microphone, and whenever you start speaking, we'll start the timer.
Good morning. My name is Elaine Rotondo. I live in Sebastopol. I'm a mother, a grandmother, and a former county employee. As a matter of fact, I worked right next door for the county administrator for many years, working on the budget. I'm here to add my voice to those protesting the forced mask wearing and the forced vaccine, what's becoming forced vaccines here in Sonoma County. But most importantly, I'm here to speak for people who are afraid to come in here today and speak. And you guys know as well as I do, there are thousands of them, and the numbers are growing here in this county and all over the state of California. I don't know if you guys are familiar with a recent documentary that came out. It's called The Red, White, and Blueprint. It's about the recall of several of the members of the Board of Supervisors in Shasta County. It's an excellent documentary, and if you haven't watched it, you are uninformed, and I think you should watch it because it could apply to you, because our numbers are growing and we're getting angry. No one should be in fear of losing their job due to rules that don't reflect all the science coming out on the dangers of this hasty, non-FDA approved COVID vaccine. You guys know, and you've heard today, and you'll hear more of it, there's a lot of scientific information coming out every day. And, you know, this will be recognized over time. When we look back at this, you guys will realize that what's going on is draconian. It's ridiculous that at this point, you're a bunch of intelligent human beings, or you wouldn't be sitting up there. You're educated, and many of these people out here are professionals and are educated people, and we can see what's going on. So how come you can't see? It's just beyond frustrating. You know, a lot of people say it's a terrible time to be old because the older people are more.
Thank you very much for your comments. That is 2 minutes. I know we have a number of folks after you, and thank you very much for your service as a county employee. If you have anything else, you're welcome to email us and we can share it to the entire board if there's anything that you weren't able to share today. Thank you.
I'll send you all a link to that Red, White, and Blueprint documentary. I highly recommend it to all of you.
I will look at it. Thank you very much. Take care. Thank you so much. And you'll have 2 minutes whenever you start speaking.
My name is Orlene Perla, and I've been a resident of Sonoma County for 38 years. I have been researching for the past year and a half everything about COVID. I've written 2 books that I'm going to leave for the Board of Supervisors. They're both called Unmasking the Masquerade, Volume 1 and Volume 2. Volume 1 is the 10 Ps for loss of liberties, pandemic, pseudoscience, propaganda, paranoia, persecution, prosperity or poverty, politics, power, and population control. The second is all about the vaccines, the 5 Ts of tyranny, tracing, testing, tracking, transmitting and transforming. I just want you to know that my own nephew got the vaccine 20 days afterwards. He came down with MS. He's now diagnosed with a very fast moving MS. You don't get MS at age 56, naturally. His brother, who's the MD, who told him to get the vaccine, is now telling everyone, please don't get this vaccine. This is an experimental vaccine that should not have been given to anyone. He's telling them at least to wait 6 months or maybe even a year. I'm telling you the same. Don't make this vote today. There's too much evidence, both against all the violations that have been happening because of COVID and the vaccines. I also have for you a document that tells all of the violations of the California Constitution by any government officials trying to mandate what we do with our own bodies, and also against the Nuremberg Code. An attorney by the name of Foilmish practices law in both
Thank you very
California
much
and
for your
Germany.
comments. You could go ahead and leave those books on that table and we'll collect them afterwards. I'm sorry to hear about your nephew's multiple sclerosis. Take care. Thank you so much for joining us today.
I think you're starting to see that we, the people, have had enough. COVID has never been isolated. The PCR test can't determine whether you have a cold, the flu, COVID, whatever, if COVID even exists. The vaccine is experimental. There are over 100,000 deaths from this vaccine. Why would you mandate that to people to take? Their deaths will be in your hands. This is not okay. We shouldn't have to take a death shot to be able to work or have a meal. We shouldn't even have to wear these masks that are giving a lot of people bacteria pneumonia. That's what is making people sick. The hospitals are full of vaccinated people, not unvaccinated people. So you might want to really do a little more research on the real science behind this vaccine. Thank you.
Thank you. Take care. Do we have our next speaker lined up? Welcome.
CDC data states COVID recovery rate is over 99% for everyone under 65 and 91% if over 65. PCR test, is that the gold standard, really? In a recent Zoom call, why did Dr. Mace debunk the valid assertion by a resident that the CDC is withdrawing its request for emergency use of the PCR test as of December 31, 2021? This lab alert was posted by the CDC on July 21st, 2021. It states CDC encourages labs to consider adoption of a multiplexed method that can facilitate detection and differentiation of COVID and influenza viruses. Differentiate between the two. Not only did Dr. Mace deny this lab alert exists, which was published by the CDC, she claimed its misinformation was debunked by 11 Alive. 11 Alive is an NBC-affiliated television station in Atlanta, Georgia. Therefore, our highly paid PHO, Dr. Mace, is relying on NBC, so-called fact-checking, over the CDC. Equally as important, it's been the basis of our schools and our businesses being closed. And the inventor of the PCR is on record stating it was not developed to diagnose infection. Dr. Mace has been asked about the integrity of this test since last spring, and she's still not being honest about it. More importantly, or equally as importantly, why isn't Dr. Mace reporting all the adverse effects happening to our local residents shortly after these shots? Deaths, blood clots, miscarriages, amputation, strokes, and Bell's palsy. I know vaccinated people in the hospital right now, and they're on vents. They should be given therapeutics. people in this community.
And thank you very much. Your time is up. If you'd like to leave your comments there, I'm happy to distribute them to everyone else. If you've got some things that you didn't get to, just leave them on the table and we'll ensure they're part of the public record. Take care and have
Thank
a good
you.
day. All right. You're welcome to go ahead and step up and we'll start the timer as soon as you start talking. And it looks like you're tall, so try and get as close as possible. Even if you just step, yeah, if you, I feel terrible. If you, I don't know if it can, yeah, there we go. Thank you.
Good morning. Thank you for fielding commentary and I would like to just question why Sonoma County residents have not been informed of the risks entailed in these experimental vaccines. We have not been provided informed consent through the newspapers, through public releases, as reflected in all of the other VAERS programs, European ill effect reporting programs. We have not been given any idea of the dangers entailed in these vaccines. We're just being told that they are safe and effective. It's safe for the vaccine manufacturers since they do not entail any liability for any of these vaccine ill effects, and they're effective for just corralling people into conforming and taking dangerous products. Thank you for your time.
Thank you. And I apologize for the height of the microphone. Thanks for tolerating that. Take care and have a good day. You can come on up.
Thank you for letting me speak with you guys today. And I just want to come in front of you and let you guys know that what you're doing is not right. I mean, you've got people who don't have the time to come here and speak up for themselves. I have numerous friends, both sheriff, officer, or in police officers, both EMS, firefighters, and none of them want to take this vaccine. They don't feel like them getting tested every week is fair either. I mean, if you're going to do that, might as well do that for the whole people across the board and not discriminate. I mean, I like to treat everybody equally. And when you come and try to force a vaccine, that's kind of a new thing. People are kind of scared to take it. It seems like the information out there might not be totally honest. And, you know, it's the people who you guys are representing. And I just want to come here and speak in behalf of all the people who can't come down and talk with you guys today and let you guys know that there are many, many people who do not want to be forced to take this. So, and I just want to give you guys my word. So thank you very much.
Thank you very much for your comments. We might not agree on anything, but I do agree with what I can see of your shirt. So take care and have a good day. If you want to come on up to the podium and introduce yourself, and you'll have 2 minutes from when you start speaking.
Hi, thanks for having me. My name is Gail. I am a nurse. I've been a nurse for over 10 years. I work here at the local hospitals. I'm fully vaccinated and I vote Republican or Democrat. I just want to let you know that I don't think you're hearing about what's actually happening in our hospitals. We were not filled near to capacity through the entire COVID pandemic, not our ICUs. This is public data you can see. Starting in March, Kaiser became completely slammed. They have been calling me 3 times a day to come into work. And when I go in, I see people there with clotting disorders, autoimmune diseases, and rapid onset neurological symptoms that are causing massive harm and death. So when you think about turning this into a mandate for people, I know we live in a community where there's a lot of people over the age of 60, and those are the people that I'm seeing coming in with these reactions. But every single time I ask them their vaccination status, they say they're fully vaccinated, and it's happened within the last several months. I don't think we're tracking the data. I don't think anyone is paying attention to what's actually happening in the hospitals, but I have never seen this volume of patients. My mom's been a nurse before me for 50 years in this community. We have never seen this volume of patients in the summer months for the last 50 years. And no one is talking about it. My manager told me that Kaiser is on track to have 3 times higher admissions this year than any year since the history of this hospital opening.
Thank you very much for your comments. Your 2 minutes is up, but thank you also for your service as a nurse. Take care. Do we have our next person? If you want to come up and introduce yourself, and we'll start the timer as soon as we can hear you. You want to do a quick test to make sure? I feel like if you could step a little closer, that would be great. Let's see if I can hear you.
Hi, can you hear me?
Great. Perfect.
Great.
Thank you.
Thank you. I just want to start by saying I'm fully vaccinated. I'm a resident of Sonoma County. I've never spoke before the Board of Supervisors, so forgive me, I'm a little nervous, but I felt compelled to come here to talk about this today. And I just want to talk about a few points. The current death rate for COVID-19 is 0.02%. I want to acknowledge that. I also want to acknowledge the Health and Safety Code 24170, which prohibits unlawful coercion to take any medical drug or health experiment. This vaccine is still labeled as an experiment. I also want to talk about California Civil Code 51, which protects our personal rights and states that all persons within jurisdiction of this state are free and equal, and no matter what their sex, race, color, religion, ancestry, national origin, disability, medical condition, genetic information, marital status, sexual orientation, citizenship, primary language, or immigration status, are entitled to the full and equal accommodations, advantages, facilities, privileges, or services in all business establishments of every kind whatsoever. Notice, no mention is made of vaccination status. I also want to go over the 5 requirements a vaccine is supposed to meet. 1, provides immunity to the virus. This is a leaky gene therapy that does not provide immunity to COVID and claims to reduce symptoms, yet double vaccinated are now 60% of the patients requiring ER or ICU with COVID infections. Number 2, protects recipients from getting the virus. This gene therapy does not provide immunity, and double vaccinated people can still catch and spread the virus. Number 3, reduces the death from virus infection. This gene therapy does not reduce death from infection. Double vaccinated people infected with COVID have died. Number 4, reduces circulation of the virus. This gene therapy still permits the spread of the virus, and it offers 0 immunity. Number 5, reduces transmission of the virus. This gene therapy still permits transmission of the virus as it offers 0 immunity.
And that is your 2 minutes. And you were really well spoken. I'm really impressed for your first public comment. If you have anything that you missed, you can go ahead and leave the paper on there, and we can make sure that's distributed to the entire Board of Supervisors.
Thank you so much.
Thanks for coming today. Have a great day. Welcome. If you want to come up and introduce yourself and step up close to the microphone so everyone that's participating virtually can hear you. Thank you so much.
My name is David Vergie. I'm a property owner in Forestville, California. I am here because I'm concerned about the so-called vaccines that are not even vaccines or experimental treatments. I could go on forever, but I only have 2 minutes. They're not approved by the FDA. We don't know exactly what's in them. Vaccines themselves have to be safe and effective by the 1905 Supreme Court ruling or 1903. These, just from hearsay, my sister in Vermont and her friend cataloged 19 people who have terrible problems. My brother's girlfriend in Zurich, Switzerland, 2 of her friends are in an old folks home now. They've got dementia immediately afterwards. Immediately, we need to look a little bit more into this before everybody runs toward it like sheep, and before it's mandated. That's ridiculous, to have mandates like this. I mean, I had COVID a couple of years ago. I'm HIV positive. And I pushed through it, and they called it viral bronchitis. I do a lot of alternative health with supplements, but I've got nurse friends who are saying they're almost intentionally killing people in hospitals with malpractice. We need to look into this more closely. So I'm HIV positive from back in the day when if you were HIV positive, it was practically mandated to give the person AZT, acetylthymidine. Now, I luckily had a physician's desk reference and would look at this, and it said, black box warning, the side effects of AZT are indistinguishable of those of AIDS. So I've been around for a long time. Medicine has iatrogenic effects. And you'd be foolish not to see that medicine causes a lot of problems. It doesn't always solve them. But it's almost as if medicine in this country is our religion.
Thank
It's
you
not
so
a
much.
religion, it's a science.
And that has been 2 minutes. I appreciate you driving out from Forestville this morning and for sharing your thoughts.
Thank
Take
you so
care.
much. You have a good day.
Thank you. You can come on up
Thank you.
and introduce yourself. Actually, I'm having a little hard time hearing you. So if you
Hello?
might, there we go.
Okay.
Perfect.
My name is Greg Hay. I live in Santa Rosa. I've been here for about 30 years. I would like to say that for all the people listening to this broadcast, this recording, your mandates have no force of law. 21 U.S. Code 360 BBB-3 requires that all experimental products be given only with informed consent. Masks, tests, and vaccines, that's the law. If you're going to make a mandate and have businesses or the county follow this mandate, you're going to open them up for liability lawsuits, which includes you in your personal and professional capacity. Thank you.
Thank you for coming today. Take care. Come on up and introduce yourself. We'll make sure we can hear you.
Hello.
Perfect.
Good to be here. My name is Mark Marthaler. I'm here because I believe all of you and every one of the people that have come to speak, everybody in this county and all over the world is concerned about safety. So I just need to comment on the fact that this is an experimental vaccine. It's emergency use. It means that it hasn't gone through FDA approval. FDA approval is a benchmark to determine some sort of safety. It's amazing to me actually that anybody could, especially in official capacity, think that it would be wise. Not that you're not unwise, you're under tremendous pressures, but an emergency use, it's not even approved by the FDA. And then it might go to children. I actually wanted to, I don't have much time, but repeat some of the things that are on the actual Pfizer BioNTech COVID-19 vaccine insert. And it reiterates a lot of the things that some of these people have said. There is no U.S. Food and Drug Administration approved vaccine to prevent COVID-19. None that exists today is approved. Pfizer BioNTech COVID-19 vaccine may not protect everyone. So you can have people getting this vaccine and not getting any protection. Who should not get the Pfizer COVID vaccine? Severe allergic reaction to any ingredient in this vaccine. It's not approved. We don't even know who's allergic or who isn't. We're just finding out. The people that are getting it, some have severe problems. That goes into a statistic to find out what the safety is. We're just rolling blindly into this, not knowing who's going to get hurt, who isn't going to get hurt, who is protected, who is not protected.
Thank you so much. If you'd like to leave any of that literature behind for us to consider, you're welcome to place it on the table. That is your 2 minutes.
Okay.
I know
I'd
it
love
goes
to
fast.
Yeah, it did. But thanks for your time.
Thank you for coming. Take care and have a good day. Thanks for joining us today. If you want to come up and introduce yourself, and then we'll make sure that we can hear you. And I do apologize. It is not rigged very well for taller folks.
Can I take my mask off just to talk?
We would ask that you leave it on, but we can hear you pretty clearly
I'm a little
actually with
muffled with it on.
the
Okay.
microphone.
Good afternoon or good morning. I'm Dr. Kathy Allard, a psychologist holding a doctorate degree as well as 2 master's degrees. I recently watched a county education video with Dr. Mason her team. I was dismayed at what I witnessed. Statistically, our children are among the most psychosocially affected by mandates and restrictions, but are the least affected physically by COVID deaths or infections. Our children have not had one classroom infection or death, although I think there's something in the paper about an infection now. The good news is that news wasn't amplified. What I heard instead was a disturbing campaign to promote this vaccine. And pardon me, board members, can I get everybody's attention instead of reading whatever you've got there? I'd really appreciate some acknowledgement as a citizen. I've waited for months to come up here. Thank you. You also heard nothing from our officials about the fact that this mRNA injection is indeed experimental and has not been fully safety tested. And I mean fully. We simply don't know the long-term effects on our health, on fertility, on our heart, on myocarditis. It's all coming out.
And if you wouldn't mind just holding it up above me, you can hold it sort of away from your face if it's hard to talk, but your mask.
I'm sorry. Oh,
Your
right.
mask. Sorry. And I'll give you a few extra seconds for that interruption.
Okay. What we do know is that there have been thousands of reports of death and injuries, the most for any vaccine in rollout history, but you won't hear about that in the news. Why are parents not being informed of these risks? Our public health officials have an ethical and legal responsibility to overview all the risks for a fully informed consent to be provided. Come on, you guys know this. Does it not all concern you that this is not happening? As a community, we're not getting transparent and honest reporting information from you guys. In that video meeting, Kate Pack presented information regarding why all of us need to get vaccinated and presenting a death count of 337. You guys should have it on your post if that's from last year and this year. You know what the mortality rate is this year? Does anybody know? Anybody? 0.02% for the whole year.
And just a few more seconds. So if you can wrap up in the next 10
was that a
seconds.
significant portion of deaths occurred when the vaccines weren't available to the public. So of course you can say it's the unvaccinated. Do you guys see how
Thank
things
you
are
very
getting
much for your
distorted?
comments. If there's anything that you didn't get to say, you can leave that paper and we will share it with all the members of the board. All right, take care. Thanks for coming today. Welcome. And if you wouldn't mind just introducing yourself, and I'll make sure that we can hear you sort of both
Yeah,
here and
sure.
virtually.
Can you hear?
Perfect. Clear as well.
My name is Brandon. I'm a nurse, and I just wanted to talk about a couple things: safety, effectiveness, and choice. The first thing is all we hear on the media is that it's safe and also effective. And I would agree that maybe to a certain degree it is safe, but I know personally people that have had adverse events. When they started rolling out the vaccine in the hospital, I remember that the staff that were getting it, everybody planned to have the day off after because people would be like decked out by the vaccine. And it happened to a lot of people, and that people planned it that way because it was happening. I had an aunt, she got it. She had migraines for 3 weeks. A coworker, he got Bell's palsy. And I personally heard him say, like, I don't know if I want to get the second shot because I got Bell's palsy after the first shot. And then we have another nurse. She had an anaphylactic reaction and she's still looking for a way, like, how do I get the second shot? Because she's scared. She wants to keep her job, but she had an anaphylactic reaction. You would think that would be enough. And then I just had breakfast down the street. I heard 2 kids talking about it, and I'm talking to her, and she says one of her relatives, perfectly healthy, 2 weeks after getting the shot, she died. And the doctor's not attributing to COVID or anything. It's not even a possibility. And then she said also her grandfather, he got Bell's palsy as well. So for us to say that this is a safe vaccine and all this stuff is going on, why aren't we reporting this? There should be a little bit less bias. And then as for the effectiveness, I know people that work in the ICU. I've talked to 2 people that work in ICUs in different locations. And there's an ICU here in this town that is at half capacity because a lot of their staff are out because they have COVID and a lot of their staff are vaccinated. So how is that effective? And
thank you so much. And I apologize, but your 2 minutes is up.
Yes.
Thank you for your service as a medical professional as well.
A little bit more?
It's 2 minutes and then we have to go on to the next person because we do have a number.
Thank
But
you for
thank
hearing
you. And if there's anything, you can always email us or send it in writing and we'll read it. Take care. Welcome. And I'm going to apologize again for the unfortunate height of the microphone. I know it's not going to be great for you, but thanks for trying.
Good morning. My name is Stanley Edward Laughlin. I've been a county employee. This whole thing should be voluntary, not mandatory at all. I have a whole list here of things that it's violating. And I just want to express that what you're going to make it mandatory. I think that's wrong. Everybody should be like we are today, wear a mask, social distance, and I think that's enough to do. Thank you.
Thank you for your service to the county. If you want to leave that paper, we're happy to sort of make sure it's part of the public record and that we all have an opportunity to review it. You can just leave it right there and we'll pick it up afterwards. Thank you so much and take care. And I'd like to welcome the next speaker on up to the microphone.
Hello, members of the board. Thank you for hearing us today. As you can see, you are hearing from thousands of hours of research that we, the community, have done on our own, unpaid, and many of us have become actually full-time workers looking out for one another to find out what we can do to stop these restrictions that are affecting our lives every day. Not only businesses, but people's health is being affected by the decisions you make. And I would say that looking out for COVID-19 is not your only particular job, and that there are a dynamic range of issues that we're dealing with. I would like to discuss the fact that you have an emergency order currently in state, which shouldn't be in state at all. You have yet to prove to us, beyond numbers of cases that are being misrepresented, that there is in fact a threat to our health by COVID-19, SARS-CoV-19, SARS-2. I would like you to recognize that your job is not to debunk the information that we bring to you, but yet it is to consider it in the decisions that you make on our behalf. In fact, the decisions you make on our behalf end where our bodies begin, and you have no jurisdiction over our bodies. So the masks that we're wearing, you can see I'm wearing one here, which is ridiculous because the whole mask idea is ridiculous and we know it. But beyond that, I am a concerned citizen who knows the diversity of this community and how many different people are being affected in different ways. And there is no one way fits all when it comes to medical treatments. These authorized but not approved devices, masks and otherwise, are a choice for us to make. And you guys make it sound like it is a mandatory thing. It is not mandatory for us to wear masks. We have a right to decline those no matter where we go. We couldn't get into the building today without wearing one. And that is wrong. Now, beyond that, I would love for you guys to prove to us in scientific research, the information that you have that shows that SARS is actually a threat to the community beyond the public threat that you guys are creating by mandating things that may not be good for someone in their specific condition. So we have access to medical care as needed, and we would like to address the concern that we're not helpless, we're not in any measurable state of emergency connected to the coronavirus, and I urge you to end the emergency now. In fact, before you begin to start making decisions in the next point, that you would be mandating medical interventions on your employees. That is wrong. You guys cannot do that.
Thank you very much for your comments. If you have any literature you'd like to leave behind, you can leave it on the table. Take care, and we can go ahead and welcome the next commenter. Thanks for joining us today. And if you want to introduce yourself, and we'll start the timer whenever you start talking.
Okay, my name is Allie Anderson, and I am the wife of a local sheriff's deputy here for the county. He's going to be forced soon to be vaccinated. I know for now it's vaccinate or test weekly, but let's be real and call a thing a thing. Eventually, they're going to be mandated to be vaccinated. And quite frankly, I'm not thrilled about the testing either. We know that there's ethylene oxide on the test swabs, and they're not made to be put in our noses on a regular basis, week after week after week after week. Those are cancer-causing agents. They're mutagenic agents. And in fact, in Europe, they just recently declared there's no safe amount. There's no level or standard level that's safe, but that's a second issue. Right now, my husband and many of his coworkers are miserable. Morale is in the toilet because they feel that they are having their rights stripped, their liberties taken away. These are men and women who love freedom and love the Constitution and have served this community, protected many of you, and they're feeling taken advantage of in this way. They don't really have any choices because getting fired isn't a choice, okay? Not having income isn't really a choice, is it? So our decision not to vaccinate is actually fourfold. One, we've listened to countless experts and whistleblowers talking about this vaccine, raising alarms about it. Virologists, immunologists, microbiologists, doctors, infectious disease specialists, pharma execs, vaccine developers, people who are pro-vaccine but are against this gene therapy. They have been threatened, they have been censored, they have been canceled. They had everything to lose by coming forward with this information therefore are quite credible. The vaccine hesitant are made to sound like idiots, people that can't judiciously and with discernment sift through data and expert opinion.
And I
We
apologize, but your
can.
2 minutes is up. And I would
Boy,
ask,
that was fast.
I know it goes really fast. I'd like
I've
to,
got other great points to make.
if you want to leave any notes that you have, we would be happy to share those with the board, or you can email them to us if you would
I'll
prefer.
email
And
them. This is
please do
not
thank your
legible.
husband for his service to our county and our community. And thank you for your support
You
of your
can
husband.
thank us best by considering what I've said and all the other people in the county that work for this county that
Take
don't
care.
agree with it.
We do want to let the next person up. Thanks so again. And you'd be welcome to go ahead and join us at the microphone and introduce yourself.
Hi, my name is Pat Whittemore from Santa Rosa, and I have some legal points to tell you. First of all, EUA, emergency use authorization products, are unapproved, unlicensed, and experimental. The Nuremberg Code says no one may be coerced to participate in a medical experiment. The individual's consent is absolutely essential, and no court has ever upheld a mandate for an EUA vaccine. In fact, even the US military cannot mandate EUA vaccines for soldiers. The FDA requires that vaccine recipients be given vaccine-specific information specific to each injection, and that information has to be developed by the individual vaccine manufacturer. The FDA's guidance on EUA medical products requires the FDA to ensure that persons have the option to accept or refuse the EUA product, which the vaccines certainly are. If COVID-19 investigational vaccines are ever approved by the FDA, state legislation would be required to allow companies to mandate the COVID-19 injections. And companies and all other institutions or individuals who mandate experimental vaccines on any human being are not protected from liability. Employees can file civil lawsuits against you should they suffer an adverse event, death, or termination of their place of employment. I'd like you to consider whether you're prepared to sign the following.
And thank you
witness-
very much for your comments. Your time, unfortunately, is up. If you have anything that you'd like to leave behind, you can leave it on that table, and we will make sure that it's distributed to the board and is part of the public record. Thanks for taking the time today. And just a quick reminder, and I recognize that we have a lot of first-time commenters here. We do have lights that are in the front of the room, and it goes, so it starts with green when you've got your 2 minutes, and then when you only have 30 seconds left, it shifts to yellow, and then it turns to red when your time is up. So just so everyone can keep track, sometimes that 2 minutes does fly by. And we'll go ahead and welcome our next speaker up to the microphone. I've got one more. Okay. Okay, 1 second.
How are you guys?
Good. How are you doing today?
Doing pretty good. I just wanted to go over informed consent.
And please do put your mask on. That is a requirement when we're in a public space right now. Thank you very much. I appreciate that. Thank you kindly.
So I've been working in the medical field for 15 years. Informed consent is something that's extremely important for patients. And for this gene therapy injection, I brought a couple package inserts for all the other vaccines on the CDC schedule. You can see the clinical trials, and you can form your own risk and your choice based off of the information, the package inserts that come with the vaccine. This is the COVID package insert for all the COVID shots. It says intentionally blank. How are we supposed to have informed consent if we can't see what's in it in the clinical trials? This is not okay. people don't know this. Even healthcare workers that I work with, they have no idea that this is blank. People can't make an informed health choice with this. Also, as a healthcare worker, in one of my units that I was working in, a nurse didn't know that I didn't have the shot, but she said, I hope we test the unvaccinated people outside so they don't get our unit dirty. It's absolutely not okay. The segregation and the discrimination of separating vaccinated and unvaccinated, while the vaccinated are also transmitting SARS-CoV-2 and shedding the spike protein. Why aren't we testing the vaccinated? Because at my hospital, the vaccinated employees are also getting COVID.
And thank you very much. Your time is up. If there's any material you want to leave, you can leave it on the table. Thank you so much for your service in the medical profession. I appreciate it.
Give you guys all of this to review. However, there's nothing to review because it's blank.
Take care. Have a good day. Thank you so much for joining us today. And I apologize in advance for the height of the microphone. You might have to bend down a little bit. Thank you.
Hello.
That sound is good.
Hi, my name's Julian. I've got nothing prepared. I just wanted to just come in and talk to you and just appeal to humanity, really. I mean, there's so much evidence out there that the numbers aren't accurate for COVID, that the injections aren't safe, they're not effective, and mandating them on people is, I mean, I don't know what to say. It's unbelievable that this is even a consideration. All we can do is rely on our board of supervisors and our sheriff's department to keep the population of Sonoma County safe. No one else is going to do it. The federal government aren't going to do it. They're rolling over us, and there's nothing in the way except local government, local governance. Everyone's sworn to protect the population. We know this isn't what we're told it is, and we know this is a very real problem. There's only like a handful of people here, but the numbers of people in this community who see what's going on and absolutely will not take it, I think you'd be surprised. People aren't asleep. People watching the television might be asleep, but there's a lot of people here that aren't asleep. We can see, we're listening to all the experts. We've got all the statistics. We know this isn't what they're telling us it is. So all I can do is appeal to you as our last line of defense. Our board of supervisors, our local lawmakers, and our sheriff's department. That's everything between us and outright tyranny. So I'm just appealing to you, please, to take that into consideration. Thank you.
Thank you very much for coming today and for sharing your perspective. Take care and have a good day. That's it. All right. Thank you, everyone who came down to the county campus to participate in person. And I believe, unless we have one last one, is that it? Okay. So with that, we will be shifting to our Zoom and online commentary opportunities. So Marcy, if you wouldn't mind leading us in public comment via our virtual setup.
Thank you, Chair Hopkins. For our members of the public, if you'd like to comment on this item, number 19, please raise your hand in the Zoom app or press *9 on your phone keypad to raise your hand if you are a phone-in attendee. Okay, I'm going to begin with Alex, followed by Sunshine, and then Lorinda. Please go ahead, unmute and state your name.
Hello, can you hear me?
Yes.
Okay, thank you. I want to point out two very important things when we're talking about the vaccines. One is that the unvaccinated are being blamed on the mutation of the virus, when in fact, it is likely the vaccinated who are continuing to become infected and allow replication of the virus, who are driving the evolutionary process of mutation to become more vaccine resistant and to mutate spike protein. Exactly what we're seeing, which is why the Delta, now the Lambda variants are emerging right after we started the worldwide vaccination process. And that's what happens when you deploy leaky vaccines onto millions of people in the midst of a high viral epidemic. Second of all, something we're not talking about is the long-term safety effects of vaccines, and the fact that they very well likely may interfere with our own innate immunity as the virus mutates and becomes vaccine resistant, because the vaccine-induced antibodies will, but new are there, and the reason why over 9
Alex, I'm sorry, we're having some trouble hearing you.
Further than your,
we're having a little trouble hearing you. Is there anywhere you can go to maybe get a little bit better service? Okay, I think he's gone, but we can remind Alex that he can call in using the information on today's agenda. I'll go to our next commenter. Can you please unmute and state your name?
Hi, my name is Michelle.
Please go ahead.
Hi, I'm a county employee, and I heard earlier said they were trying a third vaccine to see if things work. During these trials and errors, there should be no mandates, especially when it has to do with mandating a medical product or procedure that is not reversible. There should be a choice. I shouldn't get fired for refusing a vaccine, even if it is FDA approved or not. The direction our county is heading is out of control discrimination, especially to lots of people of color who are not getting the vaccine, and it's tyrannical. Please stop this coercion, physical and emotional abuse of your constituents. You'll look back one day and realize you were busy representing Dr. Mace and not we the people. Thank you.
Please unmute and state your name.
Hello, can you hear me?
Yes.
Hi, my name is Lorinda, and I had a couple of different things. I switched because I heard Dr. Mace mention and the talk of considering mandating the vaccines for children 12 to 15. And I just would like to give a couple of statistics that the CDC has estimated that 332 children have died from COVID-19 in the last 18 months. The CDC also estimates that 434 children died from influenza during the 12-month 2019-2020 flu season, and 600 children died from influenza during the 2017-2018 season. I'm wondering what justifies these mandates on our children, including masks and the vaccine, when there have been more deaths from influenza and no mandates or extreme measures for influenza. Excuse me. I also would like to ask Dr. Mace to answer. I heard her mention that a third dose would be considered for the elderly and I think healthcare workers in about a month. And her exact words were to see if that works. I would like Dr. Mace to explain what scientific evidence or experience leads her to believe a third dose so soon is safe, and that if 2 doses haven't worked, why would a third dose be something to try, especially on our most vulnerable population? Thank you.
Thank you. Our next commenters are Terry, followed by Daniel, then SC. If you can please unmute and state your full name.
Hello, this is Terry from Rohnert Park. Can you hear me okay?
Yes, we can.
Thank you. Yeah, I was listening to the reports by the Sonoma County Healthcare administrators, and there were glaring things missing. Where are the numbers of the injured? Where are the numbers of the deaths from the vaccinations? That was not included in the report. And also the PCR tests, according to the guy who developed it, it was never intended to be a diagnostic procedure. I'm concerned about the county mandating an emergency use authorization product. And even if it gets approved by the FDA, it's still, you're going to be financially liable for that if you mandate this. The VAERS reporting system, as you know, was established in 1986 that, you know, pharmaceutical companies were given a free ride. They are not held financially responsible for any damages they cause. And that means that buck gets passed on to the US taxpayers. And if there are mandates, I'm concerned it'll be passed on to the county level as well. I think it's time that we called this emergency use authorization experiment a failed experiment, because clearly there are no freedoms or abilities to move about freely without masks and such that were promised to the people who have been vaccinated. And the EUA, the emergency use authorization, was only allowed to be called that because there was so much suppression and censorship of all of the methodologies that healthcare practitioners have used for decades to deal with these viruses, like ivermectin and hydroxychloroquine and vitamins D.
Thank you for your comment. That does conclude the time. Our next commenter, can you please unmute and state your name?
Hello, this is Dan McCoy. Can you hear me?
Yes, we can.
Hi, I live in Petaluma, and I wanted to say, you know, I consider myself a good citizen. I'm a veteran, but I swore to uphold the Constitution, and that includes the First Amendment, the Fourth Amendment, and the 14th Amendment. And to mandate your workers to submit themselves to a search of their bodies weekly with no probable cause that they are sick is a clear violation of the Fourth Amendment. And, you know, I use my GI Bill to become a lawyer. So I just thank God that I still have the ability to fight for the Constitution of the United States. And this rule by medical doctors is not constitutional. You know, you are the supervisors. You know, you should be responsive to the people that you're hearing today. You know, when they first locked down, I lost my job. The company shut down. I luckily, thank God, found another firm. But there I was homeschooling my kids as I was working as a lawyer. You know, they're doing their Zoom meetings, getting completely ineffective education. And I got my vaccine like a good citizen, but it was a complete bait and switch. I'm still masked again. And the idea that the schools could be shut down or my business could be shut down again, that could even be on the table, is disgusting. And that would be the end of me. That would be the end of my family. It would be the end of us living in this state, that's for sure. So I think you all need to realize that this is hurting people, and, you know, we are adults and we can make our own life decisions. And, you know, I'm not a doctor. I believe what the doctor is saying, but that doesn't mean that you can just make us do whatever you want just because you think it's best for us. It's not true. So that's all I have to say about that. Thank you.
Hi, please unmute and state your name.
My name is Damien. Can you hear me?
Yes, we can.
Okay. So as a community member that has family members and friends that are medical professionals, I am extremely concerned about the potential mandate that we're talking about. You're essentially forcing your local medical professionals doctors, nurses, medical assistants, technicians, surgeons, and all other healthcare workers that are professionally trained in their field, the medical field, to take a medical treatment that they have not been convinced is safe and or effective. I don't believe that we can say that we support our frontline healthcare workers while simultaneously mandating them to take a vaccine that a significant proportion of them do not feel comfortable in taking. It's grossly hypocritical. As the Sonoma County Board of Supervisors, you are setting a dangerous precedent by mandating your local medical professionals to be forced to take a vaccine against their will. Lastly, with the FDA's recent approval of booster shots, will mandates be placed for a second, third, or fourth shot? Like, how far does this thing go? Where does it end? I mean, what are we really doing here? Thank you.
Our next commenters are Lisa, followed by Alex, and then Iona. Please unmute and state your name.
Can you hear me?
Yes, we can.
Okay, I just wanted to address something another speaker had mentioned. The doctor that spoke earlier was referencing a Press Democrat article that claimed a student at Rincon Valley Middle School tested positive, and that actually appears to have been a false report. According to a community update on August the 15th of 2020 from the principal, that student's PCR test results were in fact negative, but the article doesn't appear that it was ever redacted or corrected. It appears the Press Democrat did not vet its info and irresponsibly kind of jumped the gun and wrote an inaccurate scare tactic piece targeting parents sending kids back to in-person learning. Also, in regards to the county employees being mandated to vaccinate, I don't think that that's fair at all. And I also don't think it's fair to pregnant employees to mandate them to get a vaccine when it is impossible to know the long-term effects of this vaccine when administered in utero, as this vaccine has not been available for longer than the average gestation period. On that note, there's no way to ascertain the long-term effects of this vaccine on anyone.
Lisa, does that conclude your comment?
Yes.
Thank you. Hi, please unmute and state your name.
Hi, this is Alex. I don't know when I got cut off last time. I apologize.
Thanks,
Give me a
Alex. I think you
minute
had
if you want.
about 50 seconds left, so we'll.
Okay, great. So 2 points. 1 point is this vaccine is driving the mutations to become vaccine resistant and more virulent. So we're starting a very slippery slope here, and you guys hopefully can see that. A lot of very intelligent virologists are pointing to that, but they're usually censored. Second of all, is we don't know what we're doing to our immune system and our innate T-cell immunity, which is the reason why 99% of people survive COVID and rid it without the vaccine. When the virus becomes vaccine resistant and those antibodies are not able to neutralize it in the future, as we're seeing happen, the effectiveness of the vaccine is dropping off a cliff. That's why we need to vaccinate people already when we're still trying to get people to take their first dose. We could be really screwing up our own innate immunity and putting vaccinated people at risk for what's called antibody-dependent enhancement, which is a very real thing and something that may happen in the future. We have no long-term safety data. This is insane. I'm a healthcare worker, my partner's a healthcare worker, and we're both being forced to take a vaccine that we're not comfortable with when we're busting our butt taking care of people. Thank you for your time.
Thank you for your comment. Our next commenter, can you please unmute and state your name?
Hello, my name is Iona. I'm a healthcare provider. I'm actually a physician. And I wanted to say that first, we do no harm. We need to allow people to make an informed choice. COVID infection mortality rate is low. Risks for death from COVID are obesity and diabetes, just to name a few, yet we don't restrict those people. Major known vaccine risks are thrombocytopenia, anaphylaxis, myocarditis, blood clots. So people should be able to choose what risk they're willing to take. Healthcare workers are scared to come forth for fear of losing their job, being censored, and multiple others. Thank you very much.
All right, our next commenter, can you please unmute and state your name?
My name is Mark. Can you hear me?
Yes, we can.
Okay, good. I didn't know that I was up. Yes, I just want to speak on the vaccination that you're going to be requiring of county officials. I mean, the county employees. I think that some of the evidence is starting to show that the vaccine itself is enhancing the transmissibility of the virus. I think we can look at different countries. We can see that Israel has got a very high vaccination rate, but yet they're spiking incredibly. Iceland has a high vaccination rate, but they're spiking now. There's even travel restrictions placed on those countries. It seems to be the evidence is. So not even considering vaccine injuries, long-term effects of the vaccines, I think that the transmissibility of the vaccine is being greatly enhanced. The transmissibility of the virus is being greatly enhanced by the vaccine. And I think as you as the county, if you're going to require the employees of the county to get this vaccine, and we find evidence later on that the transmissibility is increased because of the vaccine, and you have injured people on that are county employees, your liability is going to be great. If they can prove that the transmissibility was greater because of the fact that they were mandated to get a vaccine and they are injured or they die, then I think county liability is something that you're going to have to consider, because I think this is something that's going to be proven as time goes on. Thank you very much.
Thank you. And just a reminder that the next item, number 19, is relating to a potential policy for vaccinations and county employees. And also that it's just one comment per person, but there will be an opportunity to comment on item number 19 in a little bit. So our next commenter, if you can please unmute and state your name.
Yes, hi, can you hear me?
Yes, we can.
Great. So my name is Steven. I am a father in the local community. My child goes to starting 9th grade this year. I'm really very concerned about the mask mandates that we're forcing children to have at this point. We know that children are not affected statistically by COVID. We know that the flu has more detriment effects than COVID does. And we know that there's tons of studies that show that kids being forced to wear masks, there's health issues that arise from them. And yet we're still forcing kids to wear masks. And, the reality that my child is going to be sitting, in the back of the classroom and being forced to have restriction on her breath for 8 hours a day over the fact that we know that these masks that we get from the drugstore do not prevent COVID. They don't prevent it from exiting the mask. They don't prevent it from entering the mask. And this is criminal. It's ridiculous. And it's your job to look at all this information and to really help disseminate this and remove all of this. It doesn't help. It's hurting our kids. And it shouldn't be the new normal of our lives that we have to wear this. We've been affected by disease for as long as we know. We've never forced masks on people before this point, but yet we still get flu. We still are affected by other things, yet we're forcing this now because of COVID. It's ridiculous, and we need to stop this. Thank you.
All right, and Chair and Board, I see no additional hands for this item.
Thank you very much. So I will bring it back to the board for discussion. And first of all, I just want to say thank you very much to the members of the public who complied with the mask mandate in the board chambers. I do really appreciate that. And also thank you to the deputies for assisting us with a respectful civil discourse with a variety of differing viewpoints in the chambers today. I would offer if any of my colleagues would like to make any comments, and I would also sort of open up the floor for staff if there's any data that they would wish to share in response to some of the comments. I do think it's really important that we can all have different perspectives, that we can all take different stances on policy, but that hopefully we can agree on a common set of facts. One thing that I do recognize was said by, I think, a couple of public commenters today was the sort of intimation or direct statement that there are more vaccinated than unvaccinated folks in the hospital with COVID right now. That is data that we track very closely at the county. And we do actually have graphs to sort of share how that trajectory has gone. And so I don't know if that's something that staff would like to sort of bring up, or if any of my colleagues on the Board of Supervisors have anything else to share in response to public comment. And I do see Dr. Mace appearing. So if Dr. Mace, if there's anything that you'd like to share about that, please do.
Yeah, I can definitely reshare the slide on hospitalizations and vaccinated and unvaccinated. Would you like me to share that?
I think that would be great. Thank you.
Just a second. Okay. Oops. Sorry. Just a second. Let me see if I can.
And just one moment, I do hear that we have some members of the public who are hoping maybe that we're a little bit louder in here, is my sense. They're having a hard time hearing. Is that accurate? They're not able to hear Dr. Mace. So if Dr. Mace, if you could be a little bit louder, I want to make sure that our members of the public outside are able to hear you.
Okay. Can you hear me now?
Let's check. Perfect. Thumbs up.
Okay, let me share my screen. Can you see these slides okay?
Yes.
Okay, so this is a slide that shows what's happening with our hospitalizations. You can see that we're nearly where we were at our surge in back in December and January. We do have 84 patients hospitalized with COVID-19, 15 in the ICU. Over 80%, that is 4/5, 4 out of 5 patients in the hospital are unvaccinated, and 9 out of 10 patients in the ICU are unvaccinated. Among our deaths, 334 of 338 occurred amongst unvaccinated individuals. And let me see if there's another slide that might also speak to this. Oh yeah, so this is just our case rate. Again, I want to underscore the fact that we have 5 times the case rate in unvaccinated individuals over fully vaccinated individuals, 40 versus about 8 new cases per day per 100,000. And that although people with or fully vaccinated people are getting COVID, they're much less likely to end up hospitalized and definitely much less likely to have poor outcomes, such as any kind of morbidity or death. And in fact, people who are hospitalized that are fully vaccinated largely seem to have some underlying conditions, and they may not have gotten immunity from the vaccine. We know the vaccine is only about 95% effective in immunocompetent people. So, and I think another thing that was said in the comments, I just want to note is that the booster shot can be effective in people with underlying immunocompromised states, but may not be fully effective. In fact, the studies and data shows that a third shot could get an additional about 50% of people, that 40 to 50% of people who didn't get antibodies or immunity with the first two shots, about an additional 50% would get immunity against the virus with a third shot. So that's why I said we'll have to see how effective it is, because the small trials that have been done so far show there's definite benefit to a third shot in immunocompromised individuals, but still about 50% of people in the category that get the third shot may not get antibodies to it. That's what I was trying to say there. So I'll go ahead and stop sharing now.
Thank you very much, Dr. Mace. Actually, if you wouldn't mind bringing that screen back up briefly, I actually have a question, which is that when we are looking at the case rate being per 100,000 residents, can you clarify whether that is 100,000 residents total or 100,000 unvaccinated residents, or 100,000 fully vaccinated residents? Just recognizing that the majority of our population is vaccinated, and so I'm just curious for the clarification of what the denominator is.
Yeah, thanks for that. I'm going to turn that over to Kate, since she's the one with all the data points. So Kate, could you clarify, is the denominator fully vaccinated, or I think it's
total?
The denominator would be looking at the case rate looks at the population would be the number of people who are fully vaccinated. For the fully vaccinated case rate, extrapolating that to a rate per 100,000. For the unvaccinated population, it's looking at the population that is unvaccinated and then extrapolating that to a rate per 100,000. So it is, the unvaccinated population is smaller in our county than the fully vaccinated population. So when you extrapolate that to a rate per 100,000, that's part of the reason why that rate looks a little bit higher. But what it's doing is equalizing the rate that we're looking between those two populations and extrapolating it to a rate per 100,000 so that you can have a comparable rate to understand the frequency of cases.
I appreciate that.
Makes
Thank
sense.
you so much for that information. Yeah, I just want to make sure that we are totally transparent with the community as to how this is calculated, because we take our data and its accuracy very, very seriously. And I know it's something that we worked very hard on early in the pandemic to make sure that we had real-time data available to members of the public, so that we weren't just saying, trust us. We were saying, here is the information. This is why we are making the decisions that we are making. So any other comments from my colleague, Supervisor Gore?
Yeah, I just want to back you up and say thank you for running on a difficult issue, with a lot of emotion on it, getting everybody an opportunity to have their voices heard. I understand there's people that are frustrated on all sides of this issue. We have all encountered that frustration in our community, in our lives, and everything that we're doing. I stated it before. I don't know if folks heard it, but for me, masking, I respectfully disagree with folks who think that masking is an infringement on their right. I have a lot of friends who call me from Texas and other areas who tell me that it's an infringement on their freedom. And I say, shoot, man, I can't even buy a beer in your county on a Sunday because you're in a blue county. You want to talk to me about freedom. This is an inconvenience. I want to be very clear. If you don't like that, then that's your prerogative. But at this point, we're dealing with a pandemic that I actually believe in. And I have seen people not only in my family, but also in the hospital. And I've tracked as well. And so as strong as your opinion is, I respectfully respect your opinion and always want to make sure that I make the right decisions. But at the same time, this is where we're at. And so the only thing I'll say further is that the conversation about mandates, and people not wanting to submit to testing, for me, these are, once again, I respectfully disagree. I don't think testing to show that you don't have a disease that has been shown to kill 600,000 individuals in our country and 23 individuals in our county in the last 2 months is too much of an infringement. But once again, that's we're going to go through this. So I do at all aspects, just as Chair Hopkins mentioned, respect the ability of you folks to come in and state your piece. And I actually was extremely impressed by a lot of the data, the research, and the other stuff. And I think as we get more from this time of so-called emergency use authorization over into the area of full authorization on the FDA. If that does happen, we're going to have to continue to stay on top of this. And the other thing I want to mention for the folks who might be listening in who had a chance to speak their voice, there was a request. I made a request for us to review vaccine information from a lot of other vaccines. Measles, mumps, rubella, kind of the classic one that we all know about. But also the other things in the trajectory of what's mandated, what's not, how the laws work, and how we look at this going forward to normalize a conversation around vaccines overall. So I hope you'll stay close to us on this, and thank you very much.
Thank you, Supervisor Gore. Supervisor Gorin, anything to add?
I just wanted to thank everyone who commented today and all of the folks who commented on emails to the Board of Supervisors. I've listened very carefully and done some research on some of the items that you suggested, and yet I still put my faith in the science that we have available. All of the members of my family are vaccinated, and I will continue to endorse vaccinations. And yeah, I agree. I hate masks, but I want to be safe, and I'm caretaking a 95-year-old mother-in-law. I want her to be safe. So therefore, I safeguard my health so that she can be safe. So thank you for coming today. We're glad to be meeting once again in the board chamber, but I respectfully disagree with some of the comments that you've made, but I absolutely respect your ability to hold those opinions and comment to us. So thanks so much.
Thank you, Supervisor Gorin. Supervisor Corsi?
Thanks, and thanks again to health staff for bringing this information forward, continuing to be transparent with the information, with the data that we have on this. I think the numbers speak for themselves. We understand what we have to do here, and I'll save further comments for the next item.
Thank you, Supervisor Corsi. And again, thanks to the public commenters for their civility and for their willingness to engage in democracy and to participate in today's meeting. I do want to note that all of the literature has been collected and is on the clerk's desk to distribute to the board and also enter into the public record. So with that, that is an informational item, and we will be going ahead and moving on to the next agenda item, which I believe was 18. I'm just trying to get all of my ducks in a row here online and handing it over to Christina Kramer and Janelle Crane to introduce it.
Thank you. Janelle will be pulling up the slides, and as she's working on that,
I stand corrected, 19 was close.
Yeah. Thank you. Yes, so Christina Kramer, Human Resources Director, and with me today is Janelle Crane, our Deputy Human Resources Director. And we're here to give you an overview and recommendation on the employee COVID-19 vaccination verification and testing policy. Next slide, Janelle. Not working. Okay. All right. So as we heard in the previous presentation, there's been a series of health orders, and Dr. Mace strongly encouraged employers to basically adopt employee policies that implemented the same elements of the health orders, which is submit to testing if you do not provide proof of vaccination. And that's what this policy covers. I just wanted to review very quickly with you. We refer to health order number 1 as being the recent health order from the state regarding staff in high-risk facilities. We're working on compliance for that by August 23rd. And for your information, those facilities under that health order include the jails, the 2 jail locations, our juvenile hall, the crisis stabilization unit, Valley of the Moon Children's Home, and Redwood Children's Center. Order number 2 is the expanded local order that is effective September 1st. And that includes employees. It will now include all employees of the Sheriff's Office and anybody who are in the positions of park rangers, park ranger assistants, lifeguards, airport operations specialists, and for those who may work in temporary disaster shelters. So as we've been discussing, it's very important that the county lead by example. We are the largest employer, and enacting a policy for our employees does ensure the safety of our workplace and reduces transmission. When you take into consideration the number of employees we have and the households that they are living in, we can make a huge impact on the transmission. And it does mitigate the risk of any of our essential services being impacted by illness and outbreaks. The basics of the policy is that it is a policy for employees, all employees of the County of Sonoma and the special agencies and districts. That would be effective. We're working towards implementation for September 7th. It addresses all employees not covered under the health orders and will ensure consistent standards for our entire organization. It is a verification process, and for those who do not provide proof of vaccination, they will submit to regular COVID testing, which will be done during their regular work hours. And it does mirror the state and local orders. I want to point out a few things regarding the policy administration. The county administrator may amend or end the policy after consultation with the health officer, that should say county council, and human resources. Human resources is setting up the infrastructure and the processes for the policy, and will be administering the policy and guiding the departments on a day-by-day basis. Department's role will be to follow the processes and monitor compliance of their employees. And we already have established protocols for any COVID positive tests. And so the policy doesn't cover that because we already have that established process and protocols elsewhere.
Okay, I'm going to talk a little bit about the logistics. So we've already started gathering the proof in our high-risk settings. And as Christina mentioned, that's our jails, juvenile hall, CSU, Valley of the Moon, etc. So we started collecting proof as early as this week. The effective date of the high-risk order is August 23rd, which is this coming Monday. We still don't know the full scope of the testing needs. We were previously doing a self-attestation where employees were attesting to their vaccination status. And between that and the county-sponsored clinics, vaccination clinics that we provided previously, we know that 64% of the county workforce is vaccinated. However, we anticipate that number is actually much larger. We hadn't fully rolled out the self-attestation previously. So collecting the proof will help us to establish the exact number of individuals that will require that weekly testing. Human Resources completed a RFP process and contracted with national labs to provide that testing resource. And we have a number of ways that that will occur. In our high-risk facilities, we'll have on-site testing available to unvaccinated employees or those who don't provide proof. Other departments, we will distribute test kits to those departments who will then provide them to the employees that need to complete the weekly testing. We're considering other locations, but we'll certainly have drop boxes available where employees will be able to drop off their specimens after taking their tests. And then national labs, they have their own lab in Hayward. They will be providing the results of those tests, both to the employee and to the department designee. We've been working pretty closely with our high-risk facilities over the past few weeks to get them ready for Monday. And we started this week expanding that countywide in anticipation of your approval of the policy. With your approval, we'll start collecting that proof countywide in anticipation of an implementation date of September 7th. We've also been meeting with the labor groups, and we'll continue to do that in the coming weeks. As Christina mentioned, and also as Dr. Mays mentioned during her presentation, there's also a new state mandate. It's an actual mandate. Instead of a proof of vaccination or test, it requires vaccination for workers' healthcare settings. And that will be effective on September 30th. And it impacts all workers that are providing work in those facilities, in those settings. So for the county, that means our employees at our crisis stabilization unit fall under the vaccination order, in addition to any of our employees that are actually performing work in those healthcare settings, such as the local hospitals, psychiatric hospitals, and other healthcare settings. So we will have a group of county employees that will fall under that mandate. The final slide is just intended to show you the timeline of the various orders. So as you know, we have the mask mandate that's back in place indoors. And so that's the compliance date was August 3rd. And then we have the state order, which is for high-risk facilities, August 23rd, this coming Monday, followed by the county order for local law enforcement, fire, EMS, and disaster shelter staff on September 1st. County policy effective September 7th, and then the vaccine requirement for healthcare settings on September 30th. And that concludes our presentation. Christina may have some final comments.
Yeah, I just wanted to take a minute to acknowledge the Human Resources team and many others who've been involved in establishing the policy. And as you can see the health orders and the policy are very much intertwined. So that's why we've taken the opportunity to talk to you about some of the health orders and the implementation, as well as the policy. It's a big lift. We've been sort of flying the plane and building it at the same time, but it's a very important work that we're fully dedicated to. I want to thank the departments for their cooperation, and thank the employees in advance for their cooperation to the health order and the policy. So to clarify, the recommendation today is to approve the policy as presented. And that concludes our presentation, and we're available for questions.
Thank you very much, Christina and Janelle. Really appreciate that. I will bring it back to my colleagues for any questions on this item. Supervisor Gorin.
I don't have any questions, but I would really want to thank all of you and certainly all of our employees for understanding the seriousness of the situation that we're experiencing. And we are ready to demonstrate once again that we're a family. So thanks so much for your work. And I hope that Sonoma County could be the model employer moving forward in the county. Thanks so much.
Thank you, Supervisor Gorin. Supervisor Corsi?
Thank you. We're in a surge right now that mirrors the worst days of last winter. We've had 23 people die in this county in the last 2 months, after we went for a couple months with having very few deaths. We want to get out of this as fast as possible. I want to take off my mask. I want to make sure that people can open their businesses and have their customers coming and going freely and make a living. But today I got to rely on the experts that we employ, the professionals who do this work for a living. And we as a county need to lead with the best practices in this pandemic, as we have from the beginning. I understand that the only guarantee going forward is that things are going to change. So as we do this, I think we have to keep in mind that what we're doing is the best thing that we can do right now. Do right now, and then be prepared to adjust as we go forward. But meanwhile, we need to do what's best to keep our employees and our clients, residents, citizens of this county. We need to do everything we can to keep them safe. So I believe the data and the advice that the way we get to a future without vaccines and without masks is to use these tools right now. I support this mandate for our employees, and I urge everyone to get vaccinated and practice social distancing and masking, whether you're mandated to do it or not. Let's get out of this.
Thank you, Supervisor Corsi. Supervisor Gore?
I think I said it on the last item, and I just want to acknowledge the continued fight that we all find ourselves in, and respect even the outrage and the discussions that's out there is because it's real. There's a lot of pain in our community, and this isn't just because of this pandemic. 2017, 5,000 homes burnt down in our cycle of fire, flood, drought, pandemic. Supervisor Hopkins, sometimes, as you've mentioned, locusts. If it is locusts, we'll take them on too. But we are under disease conditions, and I through all the meetings we have, trust the professionals on our staff and where we've been, and I'm going to be keeping a steady eye on actions that we take to mitigate risk. So I feel that this is an appropriate measure. The masking in public spaces, as we've already kind of looked through, the vaccination and/or testing of individuals in our workspaces, and so I want to thank our staff more than anything for continuing to fight and work through the frustration. I want to also acknowledge that this has also been something that's come from our staff. This isn't just from the board. We had the head of our largest union come to us recently in the past couple different meetings and talked about the workers' fear for their own safety and the rights that they have. So as much as we all talk about our rights, I had somebody one time tell me a long time ago, the rights that your right to swing your fist stops at the bridge of my nose. So I want to protect our employees. So thank you very much.
Thank you, Supervisor Gore. And with that, we will go ahead and open it to public comment on this agenda item. Welcome.
Hello, it's me again, and I'd like to address the agenda item 19. I strongly disagree with any mandate for county workers to receive the COVID inoculations or regular testing. Bodily autonomy and informed consent are vital components of citizens' rights. These rights are enumerated in the Nuremberg Code of Ethics and codified into United States law in USA versus Brent. Any governmental body mandating the use of experimental drugs is violating U.S. law. You will be sued. Moreover, inoculating county workers does not protect them against COVID-19. The CDC has advised that fully inoculated people can and do become infected with COVID-19 and still transmit it to others. In fact, two of the most heavily inoculated countries in the world, Gibraltar, 99.9% inoculated, and Israel have increasing numbers of COVID-19 cases. Why is that? They're inoculated. The data does not support inoculation as an effective means to control COVID-19. In conclusion, I urge you to follow the United States law that prohibits governments from bullying people into taking experimental drugs. Support your Sonoma County workers' rights of free choice. Thank you.
Thank you for your comments. We'll go ahead and invite the next commenter up to the microphone. Thank you so much. Yeah, just come on up, introduce yourself, and then once you start speaking, we'll start the timer.
Hello, thank you to all my supervisor members, especially you, Linda Hopkins. I voted for you. And you seem to be a wholesome family person with the ranch life. But we seem to be in our nation in violation of all 10 of the Nuremberg codes. And you, my board of supervisors, seem to be at risk of violating all 10 of the Nuremberg codes, which carry the death penalty for those who seek to violate these international laws. Nuremberg Code number 1 is the voluntary consent being essential. During the Nuremberg trials, even the media was prosecuted and members were put to death for lying to the public, along with many doctors and Nazis guilty for crimes against humanity. Nuremberg Code number 2 yield fruitful results unprocurable by any other means. I had COVID with judicial rest, making sure I didn't get dehydrated, making sure I didn't get pneumonia by moving around and breathing deeply, telemedicine with ivermectin, hydroxychloroquine, vitamin D, vitamin C, zinc, etc. I'm here, and almost everyone I know has had COVID. Nuremberg Code number 3, base experiments on results of animal experimentation and natural history of disease. This gene therapy skipped animal testing and went straight to human trials, which indeed are not concluded and will not conclude until 2022 or 2023.
And thank you very much. That was 2 minutes. I know it goes by quickly, but if you have anything else that you would like to leave for us to consider and read, you're welcome to leave it on that table.
My
or
2
to
minutes
email
were
us
up?
separate. They are, yes.
Okay.
I know it goes by really quickly.
Okay, there's a 4, 5, 6, 7, 8, 9, and 10. I believe the paper was left for you.
Okay.
Would you like my highlighted one?
Sure. If you'd like to leave it, that would be great. You can go ahead and leave
What
it there.
happens to it after it's on the table?
Sorry? Oh,
What
it
happens?
comes right up here, and then it will be sort of copied and distributed to all of the members of the board, or scanned and emailed, and then part of the public
I
record.
appreciate that.
Of course. And I apologize. I think you weren't here for the morning session. We do have kind of a color-coded system, and I'll let everyone, if anyone joined us for this item too, know that it starts out green, and then it goes to yellow when you have 30 seconds left, and then it turns red when it's 2 minutes.
I
So
didn't
just
even see it. New
totally
experience.
understand. No, but thank you for coming and joining us today. I appreciate it. Take care. Welcome back. Good to see you again.
Thank you. I just wanted to come back in here again and say that I'm again standing up for friends and just people in general who I know who don't have the time to come down here and let you guys know that what you're doing is completely unethical and completely wrong. You guys think that by fighting for the people, you're mandating this vaccine or whatever, helping keep the people safe, when really what keeps people safe is people's spirit, the spirit inside their heart. And when you force people to do things through mandates or scare tactics or whatever you guys do, you're taking away that spirit in people's heart. So maybe you guys are sick and twisted and you like doing that stuff. That's all good. But I just got to let you know that the people won't take it. And all the safe stuff you guys talk about with this vaccine is kind of a lie. If you even go look on the CDC website for your own research and data, you can look at all of their statistics, and all of the deaths that have happened from this vaccine over the past 8 months have almost doubled the amount of accidental reports caused by vaccines for the last decade. So how about people start doing their own research and stop trusting these public officials? And again, just coming down here to speak for all the people who don't have the time to come down here today and don't have the time to come and speak what they want to say because of being censored or being scared or whatever reason, because there are a lot of us. So, and we're being patient and we're trying to fight it the right way. So take it or leave it. We won't stop. Thank you again.
Thank you for being here today. And you're welcome to come on up. And I would ask that you leave your mask on over your face while you're commenting. Thanks. And I apologize. It might be a little short for you, the microphone. And it tends not to stick in the more upright position.
Greetings.
Looks like you got it. Great.
Just wanted to thank you guys. I know you're all in a very challenging position. This is a very triggering issue. And I know you guys are probably dealing with a lot from a lot of people. So thank you. Just wanted to say that first of all, we're all human. We have a lot of things in common. We all want what's best for our health, for our family, and for our society. And we might just disagree on how to accomplish this. But above all, what's most important is that we're respectful to each other, especially when we disagree, because I feel like conflicts arise in the world when people don't communicate and aren't respectful of each other. So I hope I'm being respectful to you guys right now. And on the lines of respect, it's super important to respect everyone's choices on how they want to take care of their health. Everyone is different and has unique health issues and concerns. And this specific vaccine, there is a lot of scientific arguments for its safety, but the reality of it is there's no long-term data. And we have been told many times by experts on different things, like at one point tobacco was considered very safe. At one time there was many like things that we consume on a daily basis that were also considered safe. But after years of people consuming them, we learned that they weren't. So either like whatever you decide to do, I support you to have the freedom to choose what's best for you. But I think it's really important to respect, especially the employees. Like you guys said, they're important, just like everyone is. But I feel like coercing them or making it hard for them to keep their job without having this vaccine is not really respecting every individual's right to decide what's best for themselves. And I mean, ultimately, people will end up, taking it to court, and we'll see how it bets out in court. But I just wanted to say that I hope we can respect everyone's like choices on how to take best care of their health, given that we don't know what the long-term effects are. So thank you.
Thank you very much for your comments, and I really appreciate the message. Thank you very much. Take care. Welcome.
Thank you. Alex Crone. I just wanted to make a few comments on Dr. Mace and her statistics, which I believe are very misleading when she talks about the 300 and something deaths that have occurred in.
And hang on one second. Would you mind stepping a little closer?
Is that better?
That's much better.
Just
Thanks. And I'll give you a little extra time.
Okay, thank you. The 300 and something deaths that have occurred, and the vast majority of them being unvaccinated, is very misleading, since most of those deaths occurred when there was not even any vaccines available. So out of the last 6 people who died, 2 were vaccinated, okay, in the county. That's 33%. Those numbers are going to continue to change, okay? We are seeing from Israel, who started their vaccination program ahead of us, that not the vast majority, but the majority of people now hospitalized and dying are fully vaccinated. That's why they vaccinated 1 million people in the last week with the booster. Speaking of boosters, are you going to mandate the boosters as well? That's a question that I think the county employees who are being coerced into taking the vaccine deserve to know when they take the first dose. Are they going to be mandated to take a second and a third and a fourth dose? As what the experts are saying is that it's just inevitable until this virus mutates and becomes completely vaccine resistant. And we're going to need a different vaccine. What is the effect of multiple RNA vaccines, which are unlike any vaccine we've ever had? So don't compare it to other vaccines. What is the effect on our innate immunity? Our innate immunity, our natural killer T cells, are the reason why over 99% of people survive COVID and rid it without a vaccine. Those cells may be interfered with from the very specific high affinity vaccine-induced antibodies. And I probably over your head, but it's elementary to a virologist. And I'd like to see Dr. Mace answer that. Show me the data that says that's the unvaccinated causing a vaccine-resistant mutations of these viruses, because that is the opposite of what is actually happening here. So your short-sightedness could get people in a lot of trouble if you're not careful. So thank you for your time.
Thank you very much for your comments today. Have a good day and take care. Go ahead and welcome you up to the microphone here. And if you wouldn't mind introducing yourself, and then we'll start the timer whenever you start talking.
Hi, my name is Manuel Rivera Chavez. PBSO NewsHour reported a few weeks ago, 74% of people in a COVID-19 outbreak on Cape Cod were vaccinated. The data shows that 469 people with COVID and 346 people of those 469 were fully vaccinated. Only 4 people were hospitalized, however, and those were all people who had been fully vaccinated. The Delta variant is not stronger. It is more virulent and it is more transmissible, but there was no deaths in that specific case, which proves that there is something missing in the data that you guys are reflecting. A study published last week in the Journal of Infection is highlighting a startling scenario that could be contributing to the rampant increase of SARS-CoV-2 infections, since you guys like to speak about following the science. The new study addresses the concerns of antibody-dependent enhancement, or ADE, that has been a potential concern for this vaccine campaign by many scientists since its commencement. In general sense, ADE is a phenomenon in which subatomic antibodies induced by a vaccine, in this case, bind to a virus and actually make the virus better at entering the host cells and replicating. In another description, the virus neutralizing antibodies are outmatched by the virus facilitating antibodies, as the gentleman before spoke into. According to this recent analysis, the neutralizing antibodies in vaccinated individuals perform well against the original Wuhan strain of SARS-CoV-2. But in the case of Delta variant, the neutralizing antibodies in the vaccinated persons are diminished, and the potential is strikingly an increased affinity of facilitating antibodies that help the virus infect cells and replicate.
And thank you so much for your comments. I apologize, but your 2 minutes is up. And if you have anything else, you would be welcome to email it to us and we can make sure that's part of the public record.
Yeah, I'd like to state one last thing. In May 1st of 2021, the CDC transitioned to monitoring all report COVID-19 vaccine breakthrough infections to investigating only those among patients who are hospitalized or die.
Thank you
They are
very
not
much.
following
Appreciate it.
asymptomatic cases, which
Thank you very much. We're going to go ahead and move on to the next commenter. Take care.
Hello again. I wanted to talk about some of the slides that have been provided by Dr. Mace and her team. We see that Sonoma, according to her chart here, there's a Sonoma County case rate by vaccination status, which is a new way to look at this, I guess you guys have. And we've heard, and someone following me will put out the information, that the labs are no longer testing vaccinated patients. So when you provide these numbers for us, that there are 39 new cases per 100,000 for the unvaccinated, and yet only 8 new cases for those that are vaccinated, make sure you actually have vaccinated people getting tested. Because from what I understand with the employee mandates and everything that's going on now, people that are vaccinated don't have to take tests. So how do you know if there are any positive rates for vaccinated people in every situation, whether they're in school or by work? So those numbers have gone down where the vaccinated are not being counted in testing. And so of course your numbers rise for the vaccinated being tested. Further, did you notice that you guys also put out on your slide that in the last 7 days, the testing has increased 60%. So the numbers again will rise. So when you say, oh, we're getting a bunch of cases and there's this influx of cases, well, gee, I wonder why, because more people are being forced to get tested in every situation and everywhere they go. Another thing, you guys, there's only 9 people that have died in this county in the last 30 days. Out of 480,000 people, I think you all can do basic 8th grade math. Half of the people who have died from COVID in this county and worldwide are all over the age of work. They're 65 or 70 years or older, half of them. So now you take the full number of people that are dying and you break that down if you're talking about an employed situation where people are going to work and being mandated to do something because of some outrageous numbers that don't even include half of them. Or I'm sorry, that it only includes those people that are working.
Thank you very much. And that does conclude your 2 minutes. So I want to make space for the next commenter. Take care and have a good day. Welcome. If you wouldn't mind introducing yourself, and we'll make sure that the sound is working.
I'm back again. My name is Orleen Kurla, and I would like to speak about 2 issues. The testing, and I have this all in the book that I submitted to you. Just to let you know how faulty this testing is, the president of Tanzania, who used to be a chemistry teacher, decided to do his own little experiment. He submitted 3 tests. One was from a pawpaw fruit, another was from a goat, and another was from a sheep. He gave them each names and birth records and submitted them. The pawpaw fruit was found negative. So was the goat, but the sheep was found positive. And it just shows you how silly these tests are. And more people are coming to that conclusion. I had mentioned Rainer Vollmisch, the attorney in Germany, who also practices in California. He now has 10,000 medical experts supporting him in an international lawsuit, and 1,000 other attorneys. And the whole reason for this lawsuit, number one, is the faulty PCR testing. Number 2 is the fraudulent birth certificates. So many people that supposedly died of COVID, that was not really the case at all. And they have evidence of that. And the third one is the experimental vaccines. And by you voting to force your employees here in Sonoma County, anyone that works for the government, to go through one of these experimental vaccines, you're going to be held accountable for this according to the Nuremberg Code and to everything that this Mr. Fulnish is coming up with, as are his other attorneys. So I hope you will consider that.
That does conclude your 2 minutes. Thank you very much. And I would welcome the next commenter up to the microphone.
I'm not here to address your statistics, which can be manipulated anytime to have the results that you wish. That is a waste of time. I'm here to address your obligations and your duties to the people of this county as an elected official or not, who swore an oath to defend the Constitution, to uphold the Constitution. We are all created equal. If you didn't read the Declaration of Independence, I invite you to read it. I think probably you've forgotten it or never read it. We are all created equal. All men are created equal, which means you and I are equal, which means you can't give me an order and I can't give you an order. All statutes, codes, regulations, and mandates are not law. Therefore, you have no authority over anyone's property, no authority to administer my body, my property, or any county, or any person, any man or woman. You have no authority to administer any of this. So it is said in the Declaration of Independence that when a government goes rogue and becomes tyrannical, it is the duty of the people to replace or abolish it. And I tell you, for the people of this county, we are finished with you, and we will have to move forward with removing you from office since you have violated your oath. On top of the fact you have not taken the full oath of office, you have left out the part of the oath of office in the California Constitution, Article 20, Section 3, which states that you will not work with any group, political or otherwise, that would advocate to overthrow the government of the United States of America. Look it up. You have violated your own oath of office. And apparently, Miss Mace has 2 oath of offices on file.
Thank you very much for your comment. That is 2 minutes. And I do appreciate you wearing your mask and also turning it into a statement about your beliefs. So take care. And I would welcome the next person up to the podium. And I do mean that, by the way. That was not sarcastic. I appreciate it.
Hi,
Welcome.
we're here talking about the science today. It seems that the entire country wants some science and not other science. mRNA, experimental gene therapy. Okay, that is a classification of a drug. Experimental gene therapy. Federal law says that you have the right to informed consent. There's no informed consent. Where's the informed consent if the package insert is blank? The vaccine manufacturers are gathering their own statistics. They're not letting people see what the statistics are. In fact, one of the great minds of our time, the inventor of mRNA itself, Dr. Robert Malone, has been heavily censored and is now speaking out. What does he have to say about mRNA? He says, do not take it. Do not take it. Unless you're at extremely high risk, you protect the people that are high risk. You don't end everybody else's life. That is not the United States. That is not science. Stop selecting your science. Go look up Dr. Malone. Listen to what he has to say. He's been heavily censored. He's been deplatformed, even from a site that he pays for, which is LinkedIn. He had to petition to get that back up. He's been taken off of YouTube and Instagram and Facebook, and nobody will interview him. except with very few people. And now they're down to basically websites and webcasts and podcasts. Listen to what he says. Do not take mRNA. It's dangerous. They don't have any idea what's going to happen in 6 months, in 9 months, in 18 months, in 3 years, early onset of cancers. Listen to what he has to say. Listen to the science. Sundari doesn't have she's not the end all be all of science here. If she doesn't listen to what Robert Malone says, and what are we going to do? Listen to us.
Thank you very much for your comments. That does conclude your 2 minutes. Take care. And I'd welcome the next speaker up to the microphone.
Hi, my name is Erica Galindo, and I wasn't prepared to come today, but in my heart, I just knew that I had to come and speak. I find that what's happening in our country is so deeply sad, and we are asking you, because we know you are volunteering, you're working hard for the county, and you guys have a lot of influence as to what's going to happen to our personal freedoms. And I feel that this is really about our personal freedoms. This is a beautiful country. We live in a beautiful state. We have the most incredible vineyards and mountains and oceans. State and our country will become like a prison if we allow the government to mandate our every move. We just have to look at what big tech is doing right now. Companies like Google and Facebook and Twitter, they are completely suppressing our voice. They're taking away our freedom of speech. So any opposing medical opinions or experience or research is being shut down, and this is just wrong. This goes so much further than just our vaccinations. There are treatments. We know there are treatments available, but those treatments are being shut down by the government to say that you can only get a vaccination. And if we look at where the people are appointed, board members of the FDA and the World Health Organization and the NIH, many of those members are getting residuals on the patents for the vaccinations. So if you look at that, how can they be objective? It's not a level playing field when the people that are evaluating these drugs are making money on the patents. There's so much evidence against this, but it's about personal freedom. And what concerns me the most is if you take away our right to choose, which goes against the the oath of all medicine.
And that
never
does conclude
never
your 2
to
minutes. I
force
know it goes
people.
by fast.
Yes.
If you have anything else that you want to add, please do feel free to email it and we will review it at that
Okay,
time.
we just ask that you please hear the people of this county on this matter. Thank you.
Thank you. Have a great day. And I'd welcome the next speaker up to the microphone. Thanks for joining us.
Thank you. My name's Janet Churchill. I'm a lifelong resident of Sonoma County. I did not prepare to speak today, but I felt like I couldn't walk away from here today without saying something about the children, that if we don't end this insanity here soon, we will be, where does it end? Our children are going to be forced to be vaccinated. Are they going to vaccinate infants in the delivery room? I mean, it has got to stop here and now. We cannot be forced to take medication that is not even good for us. And I fear that we will have a population with no immune system, no natural immunity, no herd immunity, which was a naturally occurring phenomenon until now. Now herd immunity can only be had through a vaccination, which is crazy. It's absolutely not true. And if everyone's going around in a mask, how do we get herd immunity? Just on the natural way it is intended. So that's all I have to say. I just fear for our children. I won't be here much longer. This is, I'm old, but there's a whole lot of young people that need to have freedom in their life and in their future. Thank you.
Thank you for your heartfelt comments. Take care. And I would welcome you back to the microphone. Thanks for coming back.
Thanks for having me back. I just wanted to bring up a few other important points. Maybe people have talked about this already, but I think that really, I don't understand what's going on here. And what it comes down to is the fact that we have 338 people dead from COVID in the last year and a half. Of a population of 480,000, that's a 0.00007% death rate. You can just put those numbers into your phone, and that's the reality of what this county is seeing. And that's what I spoke to earlier, what I've seen through the whole pandemic in 2020 when I was working on the COVID units. It doesn't support what we're hearing from the media. This number is what I see in the hospitals. It's not high. Even right now in Sonoma County, I heard you saying something about having high numbers. There's not that many people hospitalized right now. I didn't get the number, but I know it's posted. You know, we don't have that many patients in ICU. I wanted to touch on discrimination. So these PCR tests, we have evidence that people who are fully vaccinated are still testing positive with these PCR tests. And so when you force people who are unvaccinated to take a PCR test, when the vaccinated are also testing positive, that's discrimination. And, you know, we don't know. That's the whole point of all this, is that we don't know the science yet because this is all so new. So why are we targeting people who are unvaccinated when we don't actually know what's happening with the people who are vaccinated? I also wanted to touch
very
on,
much, and that does conclude the 2 minutes. So if you have anything else that you'd like to add, please do email us or leave it behind. And thanks again for your service to the community and the medical profession. Welcome back.
I just wanted to start by saying thank you for looking out for the health of our public. I would say that we all agree on that. Where I would disagree is I think it would be nice if we were to take a step in an alternative direction to provide something for people, you know, maybe they're Sonoma County staff that have tested positive for COVID. Why can we not check for a titer? Pfizer actually did some research recently where they were checking people that, you know, had the vaccine and people who had natural infection. And they were shown that 72% of the people that had gotten the infection, they had adequate levels of antibodies. And so what I would say is, like, why can we not tread cautiously before trampling on the consciences of others? Why can't we provide another way to say, like, hey, immunity is our major goal. That's our main goal. If somebody got it through natural infection, why can't we accept that as an exemption? Because if they have immunity against the disease, that's really what we want. It's a different path to get there. But I think that before we trample on consciences of others, we should do more research. And this is not a peer-reviewed research yet, but it is from Pfizer. And I think more studies like this need to be done before we make a decision to just be like, you know what, you don't have a choice. We're just going to do this anyways. Why can't we provide an alternative? And I think that this would be a viable alternative. And I'll email you whatever I can, okay?
Thank you very much for your comments and the feedback. I appreciate it. Take care. Do we have another member of the public who would like to speak? Hello, welcome back.
Don't you guys take a break for lunch? You must be starving. I was hungry. It's hard to be up there, I'm sure, when you're hungry. So it's Dr. Kathy Allard again. Thank you for having me once again. And I just wanted to mention something about the testing that people were referring to early about the testing that's happening with vaccinated versus unvaccinated. Did you all know that the CDC actually had a directive in May of this year not to test vaccinated people? And that our local hospitals had a directive in their hospital protocols not to test vaccinated people for COVID. I've got the documentation. Actually, I'll be happy to send it to you. I have it from Scripps College down in San Diego, and I called the lab director at Provident, who confirmed up until July 27th, they weren't testing COVID for vaccinated patients. So the numbers you have, the numbers that are presented by our health person, is she there? Is Mace up there? Is she listening to any of this? Because she needs to hear from those of us who have done research. I've got a PhD, which is a lot more than she has in doing research. I'm telling you, I'm all over this stuff. So what I'm trying to say is that you need to look at those numbers because they're skewed if they haven't been doing any testing. It's all moot. So these things are really important for you guys to know. All these little shifts and manipulations that are going on when in fact they're not testing, and that's been hospital protocol. The Nuremberg Code states that the risk of experiment should never exceed the benefit. Let's take a look at that. Given the average employee is somewhere between 70 to 64 years here, the CDC reports the survival rate in their age groups from COVID is 99.98. That means 0.02% of these people die. Is that worth all this for you people? What about the flu? What about influenza in years before? The numbers were not that far off from this one. For this one, look what you're doing to our communities. You're destroying our youth. You're destroying our college students. You're destroying our little people with masks, not being able to read emotions on your face. And I'll tell you right now, as a psychologist, I see this every day in my practice. It's just sickening.
Thank
and you need
you
to take
very
a look
much.
at what you're doing, honestly.
And the 2 minutes is
Thank
up.
you
I
for
appreciate your comments, especially about children. Take care. And I would welcome the next person up to the microphone.
Hi. I would just like to add to what she said. I work at a hospital and I actually call patients before surgical procedures. And it's true. Up until recently, I would call patients, if you're vaccinated, bring your COVID card in, come in, not get tested. But if you're unvaccinated, you need to go get a test, or the day of your procedure, wait in your car and we'll do a rapid PCR test to confirm what she's saying. We were not testing the vaccinated people before surgical procedures. Now we are, but the difference, the vaccinated can come inside, they go to OCU, they get their PCR test before their procedure. The unvaccinated, how we have to separate these two classes, they stay outside and they get their PCR test before their surgical procedure. So why are we letting the vaccinated come in, get their PCR test? Some of them have come up positive. So why are we letting them come in, spread, be asymptomatic carriers and spread SARS-CoV-2? The unvaccinated are staying outside. They're not bringing anything inside because we're segregated. Everybody should be tested the same. And to the gentleman that spoke earlier about the 600,000 deaths, I don't know if you saw the most recent VAERS report, but as of July 30th, there's been 545,337 adverse events from this vaccine. What about those almost 600,000 people? And these PCR tests, the FDA recalled them the end of this year in December because they can't differentiate the difference between flu and SARS-CoV-2 virus. Why are we still using testing that is faulty and doesn't work? Also, I just want to say there's over 4,000 Bell's palsy, almost 100,000 office visits, almost 70,000 urgent care visits, almost 50,000 hospitalizations, and almost 13,000 deaths. That was as of 2 weeks ago. Now we're rolling out this vaccine.
Thank you very much.
Okay. Also, I would like to
Does
encourage you
conclude
guys
your time.
to collaborate with your
Take care.
constituents and listen to what we're saying.
Thank
Because
you
at the
very
end of the
much.
day-
I'm going to go ahead. That does conclude your 2 minutes. I would like to invite the next person up to the podium. You are disrupting the meeting at this point. Thank you.
Hello, it's me again, David Virgie, property owner, ex-bartender, drug and alcohol counselor, and caregiver, super caregiver. I come into your house, I clean, I cook, I give you your meds, you refer to medical stuff. At the clinic, you know, we took precautions for pneumonia and tuberculosis, but I basically want to say that you guys need to get a spine and make some real big decisions here and not push this mandate through, because flash forward to a year from now, surely many of you have doubts. Listen to those doubts. Don't listen to the propaganda. Stay awake tonight and listen, and do not push this mandate through, because in a year or so from now, when the mass majority are having terrible problems, and it finally comes out because it's being suppressed now, when it comes out, they will come for you. There won't be enough money to save your jobs. You'll be lucky to get a homeless shelter. So think about that right now. You're working for me. You're working for Sonoma County people, for Americans. And you need to remember that. So if you're going to listen to Sundari Mays or some other people at the top, don't. Think about yourself and think about us. Think about the people, the grassroots people. If you have a shred of doubt, and I know you do, with all the information that's out there, come on, I don't even need to say anything. There's doubt written all over it. So anyway, good day. Think about it. Sleep well.
Thank you very much. Take care. And I would welcome the next member of the public up to the microphone. Thanks for joining us today.
Thank you. I don't want to add any other additional information that's been shared. I think plenty enough substantial evidence to question the decision that's in hand here to put on hold until you do more research. This is premature on your part to require in mass vaccinations for something that the evidence is substantial enough to question and require additional research before you make such a decision as this. That's all I want to say. Thank you.
Thank you very much. Take care and have a good day. I would welcome the next speaker up to the microphone. Thanks for being here.
Thank you for having me. My name is Lynn Fleck. I've never done this before, but I feel like I must. I had COVID. I tested positive. My doctors, Kaiser, never contacted me for 5 days. Did they not care whether I got worse? Or were they hoping I ended up in the hospital? I don't know, but it was, you got to admit, that's pretty wild. Then as soon as 2 weeks passed, they asked me if I would please donate my plasma. I guess they think I now have whatever it is. Sorry, I'm so nervous. But they wanted my blood to help other people. Why would I get the vaccination when I have the best thing? I had COVID. Now I have the antibodies. I got COVID from a vaccinated person, my husband as well. They didn't know they were carrying it. Later, they developed mild symptoms. Vaccinated people can spread it more because they don't even know they're going to be spreading it. After we were exposed to this person, Father's Day came and we didn't know we had it yet. We went, there were 26 people there. No one else got it.
Apologize, but I think that person was just saying that they're having a hard time hearing you outside. So if you wouldn't mind coming a little bit closer to the microphone, and I'll give you a few extra seconds. I apologize for the interruption.
We went to Father's Day gathering. Oh, that's why. We went to Father's Day gathering, not knowing that we had COVID. There were 26 people there. No one else got COVID. They all got tested. My son, 2 weeks ago, had exactly the same symptoms as we had. He thought sure he had it, got tested, negative. What's going on? I don't know what's going on. The COVID tests are carcinogenic, and the shot itself, if you read the ingredients, I don't know how many people would go ahead and take it. My grandkids, all the kids are suffering socially, mentally. They will never catch up academically. Whatever happened to my body, my choice, or parents for their children advocating for them? People need to be allowed to make their own decisions.
And that does conclude your time. I did give you the extra time for the interruption. Thanks for participating today. I know that you said that you were nervous, but you were very articulate. So if you have anything you want to add, please go ahead and email us. Welcome.
Hi, thank you. First, I just want to say I hope that you're really listening to, all of the medical professionals we've heard here today that are seeing the patients in the hospital with these horrible side effects from the vaccine. You're hearing from people on the record saying that they're not testing the vaccinated. So the PD articles claiming it's all the unvaxxed in the hospital has to be taken with a grain of salt. So I hope you're really, taking that in today. And again, per the CDC, over 99% recovery rate for COVID-19 under 65, and about 91% or higher if you're over 65 years. And that's with our natural immune system. But even if the recovery rate was only 50%, people have the choice to decide how to treat their bodies medically. Also on the CDC website, it notes that 95% of the COVID deaths had 4 comorbidities. That means 5% was COVID only, or about 30,000. So again, you're in the flu percentage range. Also, do you realize that mRNA, which is the component and synthetic device in these injections, has been experimented on for decades and never made it past animal testing? You know why? Because once they were exposed to the wild virus, they encountered antibody-dependent enhancement, ADE, and their symptoms were exacerbated. Many of the animals got very sick, and most of those died. That is why mRNA has never passed animal testing before. Yet for COVID-19, they decided to rush it out for a 99% recovery rate and skip the animal testing. So the humans are the test. This is a massive human experiment. And if you dig deep in the CDC.
And that does conclude your 2 minutes. I appreciate it. If there's anything else that you want to add, please go ahead and send us an email. Do we have the next speaker who'd like to come up to the microphone? Welcome.
Hi, can you hear me?
Yes.
Great. I was watching the previous item earlier on the web, and after everybody had spoken and you guys had submitted your own commentary about what other people had said, a couple of questions arose for me. And the first question is, are vaccinated individuals also required to do COVID testing? Given that the CDC has announced those who are vaccinated can still acquire COVID and transmit COVID. It would be negligent to do otherwise. Also, the second question, do those who have natural immunity but have not been vaccinated still have to submit to COVID testing? So is there some sort of in between where people can say, hey, I may be testing negative for COVID, but I have the antibodies. So I have durable immunity to this disease. Incidentally, board members have mentioned multiple times they support the science and the experts. What determines which scientists you choose to support your perspectives? Which expert opinions and testimonies do you choose to listen to in terms of what will sway your perspectives? Are you open-minded to consider that there are alternate points of view other than what the CDC, who is just an advisory body, they're not actually there to make rules for us, have disseminated? And yeah, I mean, it sounds like you guys have already basically made up your opinions, extrapolating from what you were saying, and it does seem a little bit like you're kind of closed to other points of view in terms of that. Also, just wondering if you are you guys going to be making your decisions on this today or soon, and will you be considering this testimony? Thank you very much.
Thank you very much. Appreciate it. And we will hopefully address those questions in the discussion afterwards. Take care. And I'd welcome the next speaker up to the microphone.
I might have to put my...
Is that okay? Do you need a hand or are you good?
I think so.
Yeah, one of the challenges is the mic is definitely not an omnidirectional mic like you see at bluegrass concerts. You really have to just sort of be right in front of it. There we go.
Good afternoon. My name's Yvette. I am a registered nurse. I am married to a Sonoma County Sheriff's Department employee. And we both have had the privilege and honor to serve and work in this county for the last 5 years. The last 8 years of my career, I have worked in pre and post anesthesia. And before every patient goes into surgery, they are required to sign a document called an informed consent, where it explains the risks and benefits before they go into the procedure and everything that they're agreeing to. Where there is a risk, there must be a choice. Last year, my husband and I were both labeled quote unquote local heroes. Every day we had to go in and work directly with COVID positive patients, and we did not have the luxury of staying and working from home. Though the COVID vaccine has been labeled quote unquote safe and effective, there are risks and contraindications to taking it. Therefore, there must be a choice. I am asking you to reconsider enforcing a vaccine mandate for your county employees. Again, where there is a risk, there must be a choice. This last year, we have worked effortlessly and tirelessly for this community, and all we're asking for is a choice so that we can continue to serve this community. Thank you for your time.
Thank you for your service and for your husband's service and for taking the time out today. I would welcome the next speaker up to the microphone. That is it. So that does conclude our in-person public comment in the board chambers. And Marcy, I would hand it over to you to go ahead and accept comments virtually via Zoom.
Thank you, Chair Hopkins. For our members of the public in the Zoom meeting, if you would like to comment on item number 19, please raise your hand in the Zoom app or press *9 on your phone keypad to raise your hand. And I'll begin with Sunshine, followed by Andrea and Terry. Can you please unmute and state your name before beginning your comment?
Hi, my name is Michelle. I'm a county employee. We need to invest in ICU beds, personnel, and even more hospitals. How long will the weekly test be acceptable? Do you have a backup plan like teleworking or accepting natural immunity or just firing us? Flying a plane and building it at the same time, you say. I couldn't agree more. That is no place for irreversible vaccination mandates. It should be a choice. You say we are family, but that's only if we are vaccinated. Will a continued vaccine campaign and new boosters ever catch up with and reduce the speed? Probably not. Nature is far faster in adapting than our drugs could possibly be. Just take a rational look at what's transpired thus far. And there's 13 other variants originating from different countries that are being tracked. With COVID being too widespread and transmissible and adaptable to contain, it's exceedingly futile to try to drag our way out of this and not pay attention to what's actually making us more susceptible, with 95% of hospitalized COVID patients having pre-existing chronic diseases. Focusing on getting our citizens healthier would likely give us a better shot. And if you're wondering why these cases are being highlighted far more in unvaccinated, because the testing has stopped on COVID cases and in vaccinated individuals over the last 3 months. It stopped 3 months ago. The biggest problem with this is that, very similar to unvaccinated individuals, nearly 9 out of 10 COVID cases in vaccinated persons are all mild or asymptomatic. And so in the height of the Delta variant spreading, the vast majority of vaccinated individuals carrying it and spreading it are not being counted. This could call for an uproar from unvaccinated individuals to demand vaccinated individuals be restricted from accessing public place and community gatherings under the assumption that they're not carrying the virus or not infecting other people. But that's not the answer, is it? The pandemic of the unvaccinated has omitted who's likely most dangerous in this scenario: the vaccinated people who are unaware of antibody-dependent enhancement and are outspreading the Delta variant and other variants and are not being counted by the CDC because of their vaccination status. You can be vaccinated and unknowingly transmit the
And
virus.
thank you for your
to someone
comment.
who does
That concludes
get very
the
sick.
time. And can our next commenter please unmute and state your name?
Yes, hi, my name is Andrea. If we are truly a family, then why are you coercing your county employees to vaccinate? True families do not force their family members to do something they don't want to do. True family members respect freedom of choice. Freedom of choice means we're allowed a personal choice, a choice over what is put into our bodies, not yours. It is not your concern whether or not I choose to vaccinate. Please respect your family and allow us to make our own decision, not the one you feel is good for us. Over this past weekend, I was in the women's locker room changing with my young daughter when a lady approached us and told us we should have our mask on. She proceeded to ask if I was vaccinated, in which I replied, "That's not your business." And I proceeded to ask her if she had any contagious diseases like Hep C, AIDS, or tuberculosis, or did she abuse drugs or alcohol on a regular basis? This stranger became irate at me and told me that was not my business, to which I stated, exactly. Whether or not someone is vaccinated is not anyone's business, period. In the beginning, we were told, get vaccinated. It's 99% proof against the against COVID. And then you don't have to wear your mask. The narrative then changed to, oh, sorry, you have to wear your mask, even vaccinated, because guess what? You can still contract COVID and transmit it. Do you see the confusion that we are speaking of? You're causing a divide amongst those vaccinated versus not. Fun fact, 0 children under the age of 18 have died in Sonoma County. 0. Yet the scare tactic is the only thing we hear. Have any of you thought of what this is doing to our children psychologically? How long will children be muzzled like dogs? Our children need to be children. Let them breathe fresh air. They are not high risk. Thank you for your time.
All right, our next commenter, if you can please unmute and state your name.
Hello, my name is Terry and I'm in Rohnert Park. And I just want to speak up again to say that it sounds like you're headed down a pathway that I can barely speak without crying, because it's just so sad to think that you're going to take people's choice away from them. I don't think there's ever been one medication that doesn't have some people that it doesn't work for, or that it would harm more. And to make it just across the board mandated is just beyond belief to me. Yeah, what happened to my body, my choice? We used to be a county of progressive people with open minds that lived and let others live as well. And I just see that disappearing and vanishing before my very eyes. It breaks my heart, honestly. Where there is a risk, there must be a choice. I so agree with what the others have said. And the data that you've been presented has led you astray. It has been manipulated. In the pharmaceutical companies, I heard Pfizer's going to be earning $33 billion with the B dollars on this vaccine. That's their reward for murdering so many hundreds of thousands of people. And I heard the woman list the VAERS data and all the injuries and deaths that have resulted from that. And what we know about VAERS is that vaccine injury reporting system that the US government set up over 40 years ago. Typically only 1% of all the injuries and deaths are reported on that system. So what we're talking about is 100 times the numbers that we were given.
And thank you for your comment. Our next commenter is a phone attendee. So please listen and you'll be prompted to press *6 to unmute.
Hi, my name is Debbie Steen. I am the Chief Steward for SEIU 1021, one of the largest unions for county employees, about over 1,700 people that I try to get everybody's opinion on. And very often the management and the unions can disagree on many things. But this is one of those things that we all agree on, that the Board of Supervisors, County HR, Christina Kramer, Janelle Crane, and all of the unions have resounding support of this process. None of us, the county employees that I've spoken to, feel mandated to do anything. We are not mandated to get a vaccination. We are asked to test, and we are not required in any way to get a vaccination, nor do we feel that we're mandated. I feel like there's a lot of people here who are trying to speak for the employees, and I feel like that's pretty frustrating for me to listen to them. I'm here to thank you, the Board of Supervisors and the HR, on how you handled the requirements and respecting those that are vaccinated and those that are not. We have reached out to our members, and it was a resounding support of this process. Let's see, it's frustrating to listen to these people who are mostly not employers and are speaking on our behalf, and they have no idea that we've worked with county HR and with this whole process. So thank you for working with us and trying to create a safe work environment. Those that are vaccinated and are not vaccinated are feeling the support of the Board of Supervisors and county HR. So thank you again.
Our next commenter is also a phone attendee. Please listen and press *6.
Hi, I'm also a county employee, and I just want to start off by thanking the board. I know this is a very tough position to be in, and you have all shown a lot of composure and patience, and I especially want to give a big thanks to Dr. Mays. I know that you're also on the receiving end of a lot of ire, shall we say. But I just want to say that I support this non-mandate. It is simply, if you are not vaccinated, then you need to be tested. I personally, as an employee, feel like that creates a much safer work environment. And I appreciate that the board is giving more weight to comments by folks who are medical professionals who have spent their entire careers studying infectious disease and not those who have recently read up on the subject. So I appreciate all of your hard work. And again, thank you for your service.
Our next commenters are Lorinda, followed by a phone attendee, and then Jamie. If you can please unmute and state your name before beginning your comment.
Hi, my name is Lorinda. Thank you. I would just like to make you aware that the United States Code of Federal Regulations and the FDA require the informed consent of human subjects for medical research. The EUA, Emergency Use Authorization. COVID-19 injections are unapproved, unlicensed investigational vaccines that are still in their experimental stage. It is unlawful to conduct medical research on a human being, even in the event of emergency, unless steps are taken to secure the informed consent of all participants. I'm feeling as though you are missing this point. And I'm wondering what makes you believe, or what authority you feel gives you the authority, I'm getting my words tripped up, to mandate something that by federal law is not allowed to be mandated and must be given informed consent. The other thing I would like to ask the general counsel, I would believe, of the county, what do you have in place to protect the employees who have adverse reactions once they have taken this mandated vaccine? Will their health insurance cover their medical treatment? Will you be paying for their time off? Will you be paying their family if they die? I would like to know what the liability is, and I would like to know if our county can afford the lawsuits that are going to come from that. And I thank you for addressing these questions. Thank you.
Please unmute and press *6.
Hello, my name is Jamie Fowler, and I wanted to first of all comment on how proud I am of our residents in Sonoma County for speaking up against what's going on right now. It's really sad to see the state of where we're at and how we are actually forcing people to have vaccines in order to go to school or potentially have their jobs saved. I am really concerned with the number of people who have already had COVID and their natural immunity is not being counted towards a vaccination status. I don't understand how we have made the turn from having natural immunity from a disease and now we're being forced to have vaccinations instead of have our own natural immunity count towards something. I also wanted to suggest that the board waits on making any decisions from this because of all of the number of residents who called in with really valid information and really valid points. This is an unapproved FDA, this is unapproved by the FDA. So why are we forcing people to have to take this when there's obvious risk? And also these first responders who were out fighting on the front lines of COVID when it first started, they never had a choice whether or not to go to work. And now we're telling them what they have to do with their bodies. It should be their choice 100%. It sounds like the board has already made up their mind based on what Susan Gorin said and Mr. Gore, it sounds like you guys have already erred on that side. And I understand that, but I just hope that you will listen to the residents of Sonoma County and take a minute and wait. We have no idea what the long-term effects of these vaccines are going to be. And furthermore, I am concerned on who will be responsible and who will be liable if, in fact, there is adverse reaction. I thank you for your time, and I hope that you take everything that we're saying really seriously and really consider it, because there's a lot of people out there who are
comment. I know
scared.
you can't see the time, but it is up. So thank you so much. Our next commenter, if you can please unmute and state your name.
Hi.
Hi there, we're getting an echo. You may have two devices going. You want to try
Is that
again?
better?
Yes.
Okay. Well, my name is Jamie, and I am a county employee. And I am very liberal in people being able to make their choices for themselves. And it seems as though take the test or get the vaccine, it's like one or the other, or are we going to lose our jobs? What kind of test will it be? Is it the invasive, almost frontal lobotomy test through the nose? Is it going to be blood? Is it going to be saliva? Who will be giving the tests? And if the tests aren't done correctly, then it could not read correctly. And what's the percentage of false positives? How much will the county have to pay to make sure every week all these tests are tested and accurate and weren't compromised? And then what if the employees are unable? When do they take the test? How long does it take to come back? Do they not show up to work till the test results come back? And if you have to send it off, how long does that take? 12 days, like it was at the beginning? And is the county prepared to lose constituents if they decide to move because they don't want to live in a county that mandates things and doesn't let people have their own choice of freedom? Is the county ready to lose a lot of employees because people are going to stand by their convictions and not let someone rule over them? And if y'all were elected, you can be unelected on the next go round.
Our next commenters are Yarrow, Kelly, then Carmela. Please go ahead, unmute.
My name is Yarrow. I've lived in Sonoma County since 1984, and I'm a SEIU member who does not agree with these coercive tests and injections. Every point I would have wanted to make has been made far more articulately than I could ever hope to. For that, I want to express my profound appreciation to my fellow citizens who have spoken here today. The only thing that has not been expressed is that a lot of parents like myself, who after trying for a year to have our voices heard by you, finally made the heart-wrenching decision that our children would never be able to have a safe and happy childhood in California. Many of our friends who have the ability have made the same decision, and many more are making their exit plans now. Those are citizens, taxpayers, and school funding that you have lost. You've been taking the word of conflicted bureaucrats who have ties to the pharmaceutical industry instead of doing your own due diligence. It is not hard to unravel the fact that what we are dealing with is corruption of government, media, industry, and academia in order to make astronomical profits for the pharmaceutical industry and grant governments dystopian levels of tyrannical authoritarian powers. I can only pray that history and the people hold you accountable for the actions that it seems you're about to take, despite the almost unanimous opposition from your constituents. Thank you.
Hi, please unmute and state your name.
My name is Kelly, and I'm calling in to voice my support for everybody that has also voiced their opinion in rejection of these mandates and masking. It is not right. The information is out there, or at least there's enough information that you should raise a question. You began this meeting with the Pledge of Allegiance, and in that you state one nation under God, and below that is we the people, and below that is our public servants. Remember who you're serving. So do your research and either stand down or stand with us, because this is not right. You're on a path to tyranny, and you're standing on the wrong side. Thank you.
Hi, please unmute and state your name.
Hi, my name is Carmela. Thank you for letting me speak today. Can you hear me?
Yes, we can, Carmela.
Okay, perfect. Thank you. With regards to your vaccination and face coverings policies in Sonoma County, wherein you stipulate we must undertake medical interventions, including wearing a face covering, taking COVID tests, and receiving COVID-19 injections as a condition of continued employment with the County of Sonoma, we demand that the board not vote to or consider this matter, as it is a personal choice protected by the contract known as the California Constitution and the Constitution of the United States of America. All men are created equal, and any man or woman who would administer another man or woman's property, removing their God-given rights, must bear the burden of proof of such authority. The following points are to be immediately addressed as your responsibility to all county workers to uphold their constitutionally secured rights, initiated the day you swore or affirmed in your oath of office prior to taking your seat on the board to represent the people of this county. We demand proof of voluntary consent of all men and women prior to receiving the COVID-19 injection is not necessary. We demand proof that the Secretary has authorized the emergency use of this FDA unapproved COVID injection. We demand proof, the option to accept or refuse administration of this product, of the consequences of anyone refusing administration of this product, and of the alternatives to the product that are not available and their benefits and risks. We demand proof that mandates of such medical interventions are not in violation of the Nuremberg Code of 1947. We demand proof of claim that these mandatory requirements are not made under threat, duress, and or coercion of potential discipline and or termination. We the people do not accept your offer of this product, and this will serve as a notice of liability should you continue with this vote today. We the people will hold all board members, including the local Department of Health officers, liable for any and all harm or injury to each employee who receives the COVID-19 injection.
Thank you so much
threat.
for your comment. The next commenters are Kathy and then Lisa.
Hi, my name is Kathy Bibby, and I'm a resident of Sonoma County. And I want to speak to the freedom of choice and informed consent. And I'm going to tell a personal story here. Recently, I had a death in my family. My sister-in-law passed away suddenly. She was vaccinated, and then about a month and a half later contracted double pneumonia and acute leukemia. And she died less than a week later. And my brother-in-law received the vaccination despite the fact that he already had heart issues. And he had a heart attack and then had a blood clot. Luckily enough, they saved him by implanting a stent. And right now he has some cognitive issues that he's suffering from. So I want to tell these stories to just have you wake up and realize that what kind of system do we have where doctors are either forced to give these vaccinations or they're not taking into consideration all the factors of a person's current health situation before they give these vaccinations, which are totally experimental. So I don't think we're in a place as humans, we're not God. What gives us the right to mandate vaccinations? I say it's up to us individually. I concur with everyone else here today to give us our freedoms. And I hope that one day our medical system can wake up and realize that one size does not fit all. Thank you.
Our next commenter, can you please unmute and state your name?
This is Lisa. Can you hear me?
Yes, we can.
Too many people being required to test is backing up the testing system for those who are symptomatic and have an actual need for testing. It's also not fair to pregnant employees to mandate them to get a vaccine when it's impossible to know the long-term effects of this vaccine when administered in utero, as this vaccine has not been available for longer than the average gestation period of 9 months. On that note, there's no way to ascertain the long-term effects of this vaccine on anyone. It as well as the vaccinated people also spread COVID. They should also be subjugated to testing. It is discriminatory to force one group to do so, but not the other. That's all.
Okay, our next commenter, can you please unmute and state your name?
Yeah, I wanted to bring up a couple. Can you hear me?
We can hear you.
I want to bring up a couple things that haven't been brought up. One, Stanley Milgram decades ago did an experiment called obedience to authority. He took people in a controlled environment and had a teacher and a student. The teacher was the actual subject. The student was given what the teacher thought was electrodes, and it was a learning experiment. What he was really doing was trying to find out how many of those people would administer a lethal electrocution as long as there was a proctor there to prompt them to go ahead and do so. 65% did. That's where our leadership is right now. They're just bowing down to the authority of Dr. Mace, of the CDC, of all these other pharmaceuticals to just say, well, they're the authority in it, so let's just do it. This is wrong. This is absolutely wrong. It takes normally 10 years on average for a pharmaceutical drug to be developed. $32 billion in criminal fines over the last 12 years for those 4 companies. $32 billion for lying, for hiding evidence, and now they're immune from any liability. You think they're going to all of a sudden do something well? No. Macy must address the adverse reactions. Mr. Gore used the term anti-vaxxers in a derogatory form. MIT study said that the people that do not consent are highly intelligent, informed, and articulate. Average of do not consent is a PhD degree versus a master's degree for those who take it. As far as the president SEIU, you don't speak for anyone else's body. Your majority does not get to speak for bodily autonomy on individuals. And no kids have died from COVID, but one kid did die from that vaccine, didn't he? Have Macy explain that. Here in Sonoma County, a healthy young 15-year-old.
Thank you. And Chair Hopkins, that will conclude public comment.
Thank you very much. I will bring it back to the board to share any comments that they might like to make. Supervisor Corsi.
I want to apologize for jumping the gun, making my comments before we got to the public comment, but I do have one question now since I reversed the order last time. And I wonder if County Council Pittman can just address the legal questions that have been repeatedly brought up today.
Through the chair. So I've spoken to the attorneys in my office who are dealing and advising with the Department of Health. And there's a multiple front here, but the 2 statutes that most of the speakers keep citing to the provision of the U.S. Code and the Nuremberg Code are focused on impermissible or unlawful human experimentation. The FDA's issuance of the emergency use approval for the COVID-19 vaccination automatically took that out of the realm of either of those two codes. It is not considered experimentation. It was approved based on data and determined to be safe and effective for use for vaccinations, which is why the FDA allowed us to move forward, although it was a very expedited process and they're still looking at permanent approval. The U.S. Department of Justice issued an opinion regarding whether states and employers could mandate vaccines within the last month or so. They looked to mandates that were already stood up in several states and concluded that those were permissible and that could go forward, and that they extended the immunity of the FDA's emergency use protections to employers and state entities who were mandating those vaccines. Finally, on the employer front, this is not the first time that vaccines were required for some type of use. We regularly require that healthcare providers get flu vaccines every fall to ensure that they are not infecting patients they are serving. The EEOC made it pretty clear that mandating vaccinations as a condition of employment is permissible and will be upheld from an employer's perspective, and is not an impermissible requirement. And then finally, the only other thing, and I don't think it was encompassed within your question, but I do want to address, there was a suggestion that requiring unvaccinated persons to get testing or regular testing and exempting vaccinated persons from doing so was somehow discriminatory. Essentially, the county is offering employees the option. You can be vaccinated, or if you're not vaccinated, to ensure that the rest of our workforce is protected, then you need to submit regular testing. You don't have to have the testing through us. You can have the testing through a provider of your own choice. But if you go through the county will absorb the cost.
Thank you, Mr. Pittman. I don't have any other questions.
Thank you. Any other questions or comments from members of the board? Thank you very much. So with that, would anyone like to make a motion?
I'll move to approve staff's recommendation.
Second.
And I want to also thank Jana and SEIU for weighing in, and also I know it's, I'm just kind of throwing this in at the end, but the consultation between HR and our unions and the discussion that we need to have as an open area with our employees. I know that's not a part of my motion to write into it, but I really want to thank that. I know there's not unanimity in any body, even our unions, but the consultation between those areas is adequate. Not only adequate, it's appreciated. Sincerely, thank you.
I would add that, and I do think it is really important to listen to the employees and really appreciate HR engaging with our county staff. And again, this is not actually a vaccine mandate, right? We are offering folks an alternative and a choice, either regular testing or requiring proof of vaccination. So we are not, in fact, forcing anyone to receive a vaccine at this point in time. And I would like to make that clarification to members of the public. I just want to add one more thought on a personal note. And I want to thank all of the members of the public who came in here and engaged in respectful civil discourse and who shared their perspective and their opinions, and who also did respect our request to wear masks as they did so. So I want to say thank you. And I also just want to say, on a personal note, I think one of the reasons that I get along with a lot of West County residents is that I am a skeptic. I am skeptical of government. I am skeptical of the medical establishment. I am skeptical of corporations. I do independent research, and I do, consider additional perspectives. And in this case, I really do feel that I am following the best available science and data and doing what we can in an imperfect situation, an imperfect world, to keep members of the public who interact with our workforce, and also to keep our workforce, most importantly, safe and healthy as we move hopefully beyond and out of this pandemic at some point. So, appreciate again the civil discourse, and I really appreciate the staff who have been facilitating this hybrid version of a meeting. So thank you to all of the sheriff's staff and deputies for supporting members of the public and for facilitating the public discourse. It's really, really appreciated today. So with that, unless there are any other comments from members of the board, I would go ahead and ask Marcy for a roll call vote on this agenda item.
Supervisor Gorin,
Aye.
Supervisor Corsi,
Yes.
Supervisor Gore,
Yes.
Chair Hopkins.
Yes. And with that, the motion does carry, and that will take us over to our consent calendar. Closed session calendar. Saying the wrong word because it's been a really long day and I'm desperately hungry. So when my blood sugar goes down, so does my cognitive function. With that, I will go ahead and look to Marcy to take comment on the closed session calendar. And I do want to mention, just for the folks who will be participating, the staff in closed session, let's go ahead and take a 20-minute recess. And then we'll start, closed session 20 minutes after we conclude our public comment. And for members of the public who are interested in commenting on matters not on the agenda, we will not be coming back to that in time for a 3:30 time certain. So let's go ahead and shift that forward to 4:30, just so that you all are aware. So apologies for the delay, but we did have a lot of robust public comment this morning, which is why we are running late today. So Marcy, if you wouldn't mind accepting any comment on the closed session calendar, not the consent calendar.
Absolutely. And for the members of the public, these are the numbers 22 through 25B that are before the board today. Please either raise your hand in the Zoom app or press *9, or line up in queue should you want to comment in person. And beginning with those in Zoom, please unmute and state your name before beginning your comment.
And I can confirm that we don't have any public comments in person. So.
Thank you. And Amara, please go ahead.
Thank you very much. Good afternoon, Chair Hopkins and members of the board. It's been a very long morning for you, and I appreciate the ability to or opportunity to address you this afternoon. My name is Amara Morrison, and I'm an attorney with the law firm of Wendell Rosen in Oakland. Our firm represents the Donlin family wine cellars in connection with 11 small cannabis cultivation permits, which have been submitted to the county and which, if granted, would result in the detrimental cannabis cultivation of approximately 3 acres of property adjacent to our client's property in the Franz Valley. We believe the board's closed session item number 21 may be related to correspondence that we sent on behalf of our client, dated May 27th and June 16th, in which we made a number of points that we hope that the board will carefully consider during your deliberations in closed session. The primary point I would like to make is that should the county approve these 11 applications, we believe this action is contrary to the California Environmental Quality Act, because the applications have to be viewed cumulatively and as a project for purposes of CEQA. First, our research confirms that these applications evidence a well-coordinated and large-scale cultivation effort, and that evidence is provided in our letter. Second, this well-coordinated approach represents, we believe, an end run around the county's current small cannabis cultivation regulations, which are intended to streamline permitting for small independent growers. And really, these 11 permits need to be viewed cumulatively as a project under CEQA. And that is because CEQA prohibits the piecemealing or segmentation of environmental review of a project. Here, the whole project to be evaluated are the 11 permit applications and the full 110,000 square feet of cannabis cultivation. In conclusion, we ask the county treat these 11 applications as a single project, require the applications be subject to an adequate level of environmental review and mitigation under CEQA. And thank you so much for your time and attention.
All right, our next commenter, can you please unmute and state your name?
Yes, my name is Jay Vemke. I am also an attorney. I represent Betsy Lauer and her family, who own vineyards on Franz Valley School Road, directly adjacent to this cannabis project. I would just like to bring your attention in these 2 minutes. First of all, this project is not 11 separate people applying for a small outdoor grow. It's one large project that has been put together. We think of it as a coordinated, vertically integrated commercial cannabis grow operation, and it's run by a unified management team. And if you take the time to read the 11 applications, they're each about 95 pages each, they all file the exact same reports on biological resources, archaeological resources, and so forth. They are all copies of each other, except for the name of the applicant and the location of their particular grow. My second concern is water in this time of drought and the issues that rates. The water calculations provided in these applications have no experimental evidence. It's not clear where the numbers come from, and I feel that this should be examined in a normal use permit process. Finally, I think we're beginning to learn that cannabis and vineyards may not be good neighbors. Vineyards spray pesticides on a regular basis, and those sprays can drift over to the cannabis grows, which are organically grown, and that causes problems for them. Cannabis can also generate strong odors, and those odors could cause unpleasant flavors in the grapes, just like smokes from fires have been shown to do. If both these industries are to survive and thrive, the county should consider zoning that defines grape growing areas and cannabis growing areas where both crops can thrive but not cause damage to each other. Thank you for your time.
Thank you. And just a reminder, it is one comment per person per section of the agenda. So for right now, that would conclude public comment on the closed session calendar.
Thank you very much. And with that, we will adjourn into closed session and anticipate 4:30, although I'll say, if we get a little bit early, maybe 4:15 for public comment.
Okay, good evening. I'm going to begin our procedures to restart the meeting. Thank you, Jamie. And just one moment here. Excellent. We should be able to begin.
Thank you very much. So I'm going to go ahead and look to County Council to see if we have any report out from closed session.
Thank you, Chair Hopkins. This afternoon, the Board of Supervisors met in closed session to discuss the matters listed as items 20 through 25B on today's agenda. On item 20, the Board of Supervisors met in closed session in its capacity as the board. This is the labor item. I wrote this before we withdrew it. This item was withdrawn. It was not discussed at today's meeting. On item 21, the Board of Supervisors met in closed session with legal counsel to discuss anticipated litigation, the significant exposure to litigation in one matter involving cannabis permits along Franz Valley School Road. No reportable action was taken. The Board of Supervisors gave direction to legal counsel and staff. On item 22, the Board of Supervisors met in closed session as the Board of Supervisors and the Board of Commissioners of the Community Development Commission to confer with legal counsel on existing litigation in the matter of the State of California, ex rel. Maria Clark versus Vineyard Creek LP. By a vote of 4-0 with Supervisor Rabbit being absent, the Board of Supervisors and the Board of Commissioners directed legal counsel to file the appropriate paperwork with the court to give the county's approval to the proposed settlement between the relator and the defendants in this matter. On item 23, the Board of Supervisors met in closed session as the Board of Supervisors and the Board of Directors of the Water Agency to confer with legal counsel on existing litigation in the matter of Potter Valley Hydroelectric Project, FERC project number 77. No reportable action was taken. The Board of Supervisors and the Board of Directors gave direction to legal counsel and agency staff. On item 24, the Board of Supervisors met in closed session to confer with legal counsel on anticipated litigation, the significant exposure to litigation in one matter. No reportable action was taken. The Board of Supervisors gave direction to legal counsel and staff. On item 25, the Board of Supervisors met in closed session to confer with legal counsel on anticipated litigation, the significant exposure to litigation in one matter involving the Sonoma County Fire District. No reportable action was taken. The Board of Directors gave direction to legal counsel. On item 25A, the Board of Supervisors met in closed session as the Board of Supervisors and the Board of Commissioners of the Community Development Commission to confer with legal counsel on existing litigation in the matter of Vannucci versus the County of Sonoma. No reportable action was taken. The Board of Supervisors and the Board of Commissioners gave direction to legal counsel and agency staff. On item 25B, the Board of Supervisors met in closed session to confer with legal counsel regarding anticipated litigation, the significant exposure to litigation in one matter involving a cannabis permit application at 101 Trinity Road. No reportable action was taken. The Board of Supervisors gave direction to legal counsel and agency staff. That concludes the closed session report out from today's meeting.
Thank you very much. So with that, we will go ahead and move on to the next item on our agenda, which is item 26, the Evacuation Annex to the Sonoma County Operational Area Emergency Operations Plan. I'd like to go ahead and introduce Director of Emergency Management, Chris Godley, as well as Captain Sean Murphy from the Sheriff's Department. Thank you both for joining us today.
Good afternoon, Madam Chair. Christopher Godley, Director of Emergency Management. Thank you. We'll move through the item fairly quickly to ensure your board has time to address any questions or discussion you may have. Briefly, before you today is the action requested to receive the new evacuation annex to the Sonoma County Operational Area Emergency Plan. Let me start with a few slides, if I may. We'll be joined by Captain Murphy as well as Misty Wood, the Community Engagement Liaison from the Sheriff's Office, to present. Other county staff are available for questions as necessary. Briefly, for today, I would highlight briefly that evacuation is one of those challenging events that we've had more than a little experience with here in Sonoma County due to our both recent fires, but also our long practice with the Russian River flooding. And it is an uncertain event that we're looking to address here with this evacuation annex. Our challenge, of course, is not knowing exactly when and where the hazard will come from. While events like flooding or tsunami may be well understood, and so evacuation planning is relatively straightforward, more dynamic events like a hazardous materials spill or especially a large wildfire present challenges for us in developing specific evacuation plans. This annex provides the concepts, policies, and procedures that will help us negotiate all those uncertain events. For today, we're going to discuss very briefly the authorities related to evacuations, how evacuations are so intricately linked with our alert and warning program. We'll talk briefly about the evacuation zones that have been established, community engagement related to that, as well as the evacuation annex document itself. First, Captain Murphy will address the authorities related to evacuation and coordination.
Thank you. Good afternoon, board. Sean Murphy, the Sheriff's Office. First, I want to address the evacuation authority. So within the state of California, during disaster, emergency responders and local authorities can issue evacuation orders. Within Sonoma County, the sheriff or designee of the sheriff holds the authority for the unincorporated areas of Sonoma County. There are 7 orders that could be put in place. I'll read them out real quick. The first one is shelter in place. The second one would be resident only closure, soft closure, hard closure, and then we move up to evacuation warning, an actual evacuation, and lifting the evacuation order. Coordination efforts between the Sheriff's Office. We have a very good relationship with CAL FIRE, Sonoma County Fire District, the DEM, of course, and then mutual aid. Just a kind of hit on mutual aid again, is mutual aid is something that we request when we need help. All the Sheriff's Office in the state of California are your local mutual aid coordinators that reach out to the state. So hypothetical, if Santa Rosa needed mutual aid, they would reach out to the Sheriff's Office. The Sheriff's Office would reach out to Cal OES to make that request. In situations we've been in too many times at this point, we reach out to Cal OES for the mutual aid. They respond and they give us what we need. The next slide for the evacuation. If an incident occurs, what happens? Let's talk about a fire for a minute. Resources and notification. The Sheriff's Office has a protocol in place that if we receive a phone call from, or however it comes to us from CAL FIRE that there's a fire, we have a protocol in place of who's going to respond to CAL FIRE, who's going to respond to the incident command post. And what we have is you have that supervisor that shows up that has a face-to-face meeting with the battalion chief on scene. That's the coordination with CAL FIRE. It's also the coordination with the Sonoma County Fire District. From there, we go into coordination with the EOC, operations, and the DEM. We also have a PIO that responds to the scene at that point. Traffic control points and security. Traffic control points are an ever moving situation for us. It's a moving target depending on where that fire goes for traffic control points. And evacuation routes. I think that for most of us, evacuation routes to begin with in Sonoma County is Highway 101 north and south. Depends on where the fire is. If we can get more evacuation routes, that's great. But primarily, our evacuation routes out of Sonoma County is Highway 101. And then at the end of it, coordination, planning for repopulation if there's evacuations. Chris, and back to you.
Of course, one of the key components of any evacuation large scale is going to be alert and warning. And so to that end, there's been a significant tie-in with the existing alert and warning program that's been developed over the last several years, as represented by the alert and warning annex that was presented and approved by your board in April of this year. For evacuations, we expect to make use of all alert warning platforms depending on the nature of the hazard, the timeliness of the hazard, the areas that are needed to be notified, and the effectiveness of the systems in those areas and whether or not they've been impacted by an event. So the traditional warning systems that many of us in Sonoma County are now more than familiar with include the wireless emergency alert system on your cell phone, the SOCO alert system to which individuals can subscribe for voice, email, or text messages, emergency alert system, which goes out over television, radio, and cable TV, the NOAA weather radio, which we tested today, broadcasts to individuals with weather radios, and the sheriff's use of low technology tools like the high-low sirens, as well as other public safety agencies now more and more embracing the use of the ability to put people into a community using high-low sirens to quickly notify a neighborhood. We depend heavily, though, on people talking to each other. If someone gets a warning, do they talk to their neighbor, the person upstairs? That really is an effective way to multiply the effectiveness of any one of these systems. The Nixle is used again to augment these warning systems, potentially contain more and additional detailed information. And I would note that in evacuations, our Department of Health, Coastal Valley Emergency Medical Services Authority will make use of the image trend system that they use to communicate with medical facilities. The warning systems, though, and evacuations are technology driven for the most part, and so there are vulnerabilities. We certainly recognize that any of these systems could fail either because of loss of power, a communications link could fail or be overwhelmed. And so it's important for us to understand that the use of multiple systems is intended to help overcome deficiencies in any one system. And we have been working to improve the wireless and wireline capabilities of these warning systems by advocating at the CPUC, the California Public Utilities Commission, to require private companies, carriers, if you would, to ensure that there's sufficient backup emergency power at critical communications nodes to keep these systems functioning. We have seen some progress in this area in the last year. We do have some of the plans from the telecommunication carrier companies, and certainly this summer we'll see just how effective they are in these environments. Also important in evacuations is, of course, the message itself, how effective and how clear, how actionable is the information that we're providing to our residents. So to that end, as part of our alert and warning program, we've invested heavily in developing messaging that is going to be both timely and effective for our residents. We have created a tool in emergency management that allows staff to very quickly produce uniform and very complete warning messages. The tool allows us to enter specifics on a situation like the area affected that needs to be evacuated, the type of warning that we're issuing, whether it's an order or a simple warning notice itself or a shelter in place. And we can quickly generate a message in both English and in Spanish and in multiple formats that are suitable for each of the various warning systems that we make use of. Public information follows on very quickly by providing additional detailed and follow-up information. I would highlight the SoCoEmergency.org website, which is a quick link in our wireless emergency alert messaging. The SoCoEmergency.org website was recently updated by Information Systems Department just about a month and a half ago. It's a significant improvement in terms of the speed, the organization of information. It is interesting to note that is the most popular website on the county's service to the community. Last year, we had 7.3 million visitors to the site, largely driven, of course, by COVID, but also by the other fires that we had. And we've had more than 300,000 folks access preparedness information via the website. And public information will continue in both English and Spanish through social media. The 211 coordination that we provide now with the service through the 211 United Way Agreement, a joint information center that coordinates activities with cities and special districts, and the evacuation zone map itself, the updating of which areas are under a warning or an order or which ones can be rented. That graphic representation is extremely powerful tool for communicating with our residents. Speaking of which, Sean, if you want to talk about the evacuation zone maps.
I think, was Juan going to talk about that? I'm sorry. Or Misty?
Actually, let me have Misty Wood jump in on that, evacuation zones development.
Thank you, Chris. I appreciate that. So the evacuation zones was a project that the sheriff's office took on just after the Kincaid fire, when we realized that responding to large-scale disasters was now a normal part of our operations. Evacuation zones are predetermined geographic areas. They're already in the map and online for people to check, so they can really easily know whether or not they're under an evacuation order or warning, and whether or not they can repopulate back to their homes or properties. So this is a really helpful tool publicly to decrease stress and help people understand the orders. And it's also very helpful operationally, because we're not sort of making it up on the fly as we had done with a couple of previous fires. This was an extraordinary lift to get this project done. We had a deputy assigned to the project. He worked very, very closely with our fire agencies, both our locals and CAL FIRE, to really understand what the fire risks are in various parts of the county, topography, vegetation, access routes, things of that nature that would help us define where these boundaries of these evacuation zones should be located. We also got a lot of community feedback, so we incorporated that feedback as appropriate. You may remember that we released the draft of these zones during the LMU complex last year, a little bit ahead of schedule, certainly, still a draft, but we found it was beneficial to use it because it was such a helpful tool. And we also got good feedback before we finalized the map, both from the public and from the operations folks from Fire and Law. From an outreach perspective, we did a heavy campaign starting in May of both our evacuation zones and our evacuation tags. I'll start with the zone part of it first. We released the evacuation map, which is hosted at socoemergency.org on May 21st, and started our first push of public education through social media, directly emailing our contacts that we have, working with traditional media partners, and also placing it on our website. What I would say is the important thing about public outreach is that our campaign is bilingual and it's ongoing. So we don't just talk to people once about and expect people to retain. There's a lot of information in our world right now, but we regularly have follow-up education through different events and meetings. At this point, we're at about 19 follow-up presentations and events that we've done. We launched a very similar campaign for the evacuation tags, also in May, which you see on your screen right now. Evacuation tags are placed by residents as they evacuate in a highly visible location. So deputies and other first responders can very quickly tell if that property has evacuated or not. So this is a great way to get people out of harm's way, both deputies and the public, so firefighters can go in and do their job and put the fire out. So far, we've distributed 32,000 tags, more or less. We had a big push of distribution days in May. We had 14 different distribution sites throughout the county. 2 of those were specifically advertised as Spanish language distribution sites, 1 in Moreland and 1 in Agua Caliente. So we constantly are putting it out there to help people understand what these tools are, how they're available, and kind of how to best use them to meet their needs. And with that, Chris, I will turn it back to you.
Continuing with the effort to move past just theory in terms of developing preparedness for evacuations, emergency management has supported community evacuation exercises in 4 locations last year and this year to familiarize residents with the concept of evacuating, take a look at potential routes for evacuation, and safely practicing using those routes, as well as linking their actions with the exercise of SOCO alert and public safety high-low siren warning systems. We've also produced evacuation packs, basically information packages that are designed to move people quickly into action if they're asked to evacuate, with checklists that they can easily accomplish. That evacuation packs are designed to be physically adhered to the inside of a location like a closet near the front door, so people know where to go and don't have to look through their drawers to find information. We've distributed more than 10,000 of those in both English and in Spanish. Of course, the evacuation annex is the goal is to document all of this, provide a detailed narrative explanation of how their agencies coordinate with each other, access to make sure they are making use of authorities, as well as clearly defining who does what in terms of evacuation. And so most important to note that we're taking not just best practices, but also lessons we've hard learned over the last 4 years here in Sonoma County into account in developing these documents and procedures. And we're addressing the needs of selected areas of our community, those individuals that may be living in congregate care settings, medical facilities, individuals that are currently homeless. All this comes together in the evacuation annex. And we also address items such as animals, and the Department of Health Services and the Animal Services folks have done a great job in identifying how individuals can take care of their pets as well as their care animals. And the Department of Agricultural Weights and Measures is developing an Ag Pass program so that as evacuations occur, there may be some ability for individuals to reaccess an area to ensure that they're able to take care of livestock and other agricultural concerns. And of course, we also want to make sure that we're as streamlining as much as possible the ability for people to get back into their homes, rather than really cutting through the red tape and making sure that we can move people quickly in, because we know that's a source of frustration. It's a source of stress and tension. And our goal is to quickly integrate all the efforts that are needed to make sure that people go home safely and quickly. And that completes the staff presentation, pending your questions or discussion.
Whoops. Thank you very much. So I will go ahead and bring it back to the board for any questions on the presentation. Supervisor Gore.
Yeah, I just want to start. I mean, we sometimes do this as a commensurate thing and say, thank you for your efforts. But what I really want to thank you for is taking action and not just providing updates. You know, seeing, Misty and Deputy Murphy, seeing the evacuation zones go out in the maps. I mean, we had a lot of conversations with our community groups and others about the difficulty in understanding the maps over time. But at the same time, there was always a difficulty in understanding the maps because you guys were hustling and getting evacuation maps out there so that we were prepared. And that iterative process of what I call it is imperfect, relentless progress is really what it's all about. It's everything that we have here. I read the entire annex. I support what you have there. I see many different discussions we've had at the board and then with you all as individuals. And currently at this point, I feel like, our community is well served by the response mechanism that we have in place. So, these days when we're out in the community and we talk to folks, we say things like, hey, we're never going to go back to the days of 2017, caught on our heels. Like, we're in the emergency ops center with, staff in hand, National Weather Service forecasting, sheriff's office and emergency responders have an opportunity to stay ahead of the curve, evacuate areas so people aren't evacuating individuals as opposed to stopping fire conflagrations. So I just want to kind of get an understanding, especially from the sheriff's office side of things, and then Mr. Godley from the side of the fire services side of things, is how they really connect, because they're the ones that are independent districts predominantly outside of us, right? So, Misty and Sean, like, if, to the best of your ability, and then Chris as well, is, the level of coordination that we see or don't see that's behind the scenes on maps and other things like that. I'd really like to understand, because I can see the difference on the ground, but what it's like for you guys, not just in preparing these collaboratively, or maybe not, maybe just having to do it because you need to get done what you need to get done. But so the specific question is with respect to the fire agencies and the other kind of partners in first response that you work with, and either the coordination or lack thereof, or where it's good and it needs to be better.
Cap Murphy, if you want to start there, because all incidents in Sonoma County follow the standardized emergency management system, in which the ultimate authority to make decisions regarding response, including evacuations, is placed in the hands of individuals in the field, the incident commanders, if you would. I would note for Cap Murphy, it's law enforcement generally and a fire district or a local fire chief, maybe it's CAL FIRE. By joining together at the scene of the incident, they form what's called unified command. That joint effort allows them to cross-level information, share situational awareness, and immediately make decisions and execute those decisions quickly in the field. Cat Murphy, do you want to add to that regarding relationships with fire districts?
Yeah, I agree with you, what you said, Chris. I was very fortunate enough during the Kincaid fire to be at the Cal Fire base and kind of get to know a lot of the local fire chiefs and deputy chiefs here in Sonoma County. I can tell you for boots on the ground, me meeting with Cal Fire probably on a monthly basis, even outside fire season, getting to know each other, coming up with ideas how we're going to collaborate with each other. A perfect example is having a PIO at the Cal Fire base. The last fire we had, the glass fire, we had a full-time PIO at the Cal Fire base, so they're face to face with the PIO from Cal Fire. That was something that kind of developed along the way. The relationship we have with Cal Fire and with Sonoma County Fire District is, in my mind, outstanding. The understanding between all of us is our phones, especially during fire season, are on 24/7, and we get the phone calls for each other. The relationship, I can't say it enough, between the fire service and the sheriff's office is really outstanding at this point.
In addition to the response at the field level, Supervisor, the response continues, if you would, up the chain into the areas of support when the county activates its emergency operations center, or a city might activate its emergency operations center. The goal is to bring that intelligence from the fire community into their operations group, work it with the law enforcement representatives in that operations group, and ensure that the rest of the organization is meeting the needs of what those folks in the field are doing. If you would, the honest work. What kind of support do they need in terms of, as Cat Murphy alluded to, PIOs or public information officers? Perhaps it's lighting, food, traffic control support, other resources that can be brought to bear. The coordination with local fire districts has continued to strengthen, especially post 2017. Even the development of the evacuation zones by the sheriff's staff really required a real close contact with the local fire districts who know the areas, which areas should be in which zone and which ones should be in the zone next door, for example. So while the zones may not be intuitive to many residents, it really does come down to analysis by law enforcement and fire professionals as to where the boundaries should be drawn. It's just one example of that coordination.
Just maybe one point of follow-up is first of all, Captain Murphy, I apologize for, I think I called you Deputy Murphy, but I know you worked hard for that title. As I got elected supervisor, my brother looked at me on that night and said, "Hey, I want to remind you that in my company, supervisors report to directors, and I'm a director." But that being said, here's another side of it, right? Is that one of the things when we establish evacuation zones, obviously we have an interim ag access policy. We've iterated that 2 or 3 times. Want to get your thoughts on where we're at. And I know not a long example, but I know Andrew Smith, our ag commissioner, has worked with you guys, Alegría de la Cruz and others, to get that locked up and make sure that we're good going through this season. But the other thing for me, so that's one side, the ag, but the other thing is that you guys controlling versus what to expect once the National Guard shows up. Because when you guys are managing the perimeters, there's let me just say it. It's not bringing in the big mallet, right? With the Humvees that oftentimes scare people, but they have to be more hardline because they don't know our community, right? They come in. So I just want to understand from your guys' perspective and Chris, from you is that how does it work that for the requests for National Guard? I'm just looking for an interest level here. Is that once kind of we're into a week-long evacuation management? And is it really because our local forces need support so that they can be backfilled because they've been out there working 24/7 for 2 weeks or so? So we need the National Guard?
Yeah, Murphy, if you want to jump in first, as an extension of law enforcement mutual aid, I can certainly go further.
Sure. So I think the 2 times that we've had National Guards during the Tubbs fire, which was obviously we were very overwhelmed during that time. And then during the Kincaid fire, based on the size of it. And really that's what it comes down to. It's how much mutual aid can support us. I can tell you that, for example, San Francisco Police Department has been good to us every year. They come as soon as we call, and they send a lot of troops up here to help. We get some assets through mutual aid, but we are kind of out here in Sonoma County too. And if there's other fires going around, they're really spreading those assets around. So how that would work is our sheriff makes the request for National Guard to come in and assist us. And what they are is they're road blockers is what they are for us. They traffic control points. And typically what we do is we put them Kincaid Fire. They're way out there. They're out toward the Napa County line. Not a lot of interaction with anyone out there, but we need those roads blocked. They're an asset to us. There's no doubt about it. But for us, if we can get mutual aid and have enough mutual aid without the National Guard, that's kind of the direction we go.
Thank you very much. And thank you for your service, all of you.
Other questions? Supervisor Gorin?
Thank you so much. I also read through the annex and looked at the PowerPoint presentation previously. Great job. A lot of work to pull all the pieces together to help us understand. So that being said, I know when we evacuated during the glass fire, there were a lot of head scratching about what zone we were in. And yeah, I think some residents now have their evacuation packet. Thank you for helping to disseminate those. But I have no confidence that anybody really knows what zone they're in. And they only would research it if, in fact, a fire is happening or something might be happening imminently. Maybe it's a question of during the evacuation drills that will help people understand, but I guess I need to ask, how will we know what our zone is? How do we get that information out? And I think in the evacuation pack, there might be a sticker or something on the refrigerator that would say what zone we're in. But what are our ideas for communicating this so that people actually pay attention to that now? Hopefully we won't need it in the next couple of months, but we may.
I can take that one, Supervisor. We absolutely hope we don't need it, but we assume that we will. And our job really as educators, public educators, is to give the message in the way that the most people will receive it and retain it. We can't be responsible for people wanting to get the information. We realize that, but we are strategic in our messaging and in our tactics. So specifically for Know Your Zone, as we put it out on social media, one thing that we do is put out that information during a red flag warning. So we did that today. So during a red flag warning, people are more interested in fires, right? Because they're paying attention, they know what might be happening, and their antennas up saying something might happen. So that's when we put it out as a reminder, know your zone, get your evacuation tag, that sort of thing. So we're trying to capitalize on when people are the most interested in it and they will want to hear about it most. We don't expect that every person will want to know and will pay attention to social media, pay attention to the media, pay attention to a presentation their neighbor. We can't, I think that's an unrealistic expectation. So we do our best to make sure that we're reaching as many people as possible through as many modes as possible. So the outreach that we have done is bilingual, English, Spanish. Through media partners, we've done somewhere in the range of about a dozen interviews. We've done events that are in person and virtual through a variety of community groups, including COPES and CERTs, through the Emergency Preparedness Day in North County that drew about 1,500 people. So every time we get a chance, it's a part of our normal conversation now when we talk with folks. Again, trying to reach people when they're paying attention is one of those strategies. We'll continue to put it out during red flag warnings. And I believe that during a fire, that's when people are really going to pay attention. It's another opportunity for education. So while we do want everybody to be as prepared as possible, the reality is some people aren't going to pay attention until they have to. It's just the way that the world works, unfortunately. So we expect that we will continue to put out that information about Know Your Zone, how to look it up, how we issue evacuation orders during fire incidents when we do have their attention.
I know the county has the ability to push out messages over Nextdoor. Not everybody is a fan of Nextdoor for obvious reasons, but are you using Nextdoor as one of the platforms to push out the message regarding know your zone and give helpful hints on where to jot that zone number down?
Yes, Nextdoor is one of our platforms. When I say social media, just to clarify a little bit more, we are regularly using Facebook, Twitter, and Instagram primarily. We also do use Nextdoor as well, and we did, as part of this campaign, we did an initial push to everybody about the Know Your Zone campaign. So that's one of the platforms that we use.
Thank you. A final
You're welcome.
question is, each of the supervisors, I think, received this ginormous tub of emergency packs. It is so heavy, I can't even move it, let alone lift it. Were you responsible for depositing the backpacks in our cubicles?
I believe, Madam Supervisor, that would be Department of Emergency Management. I believe that we had evacuation packs or disaster packs that were asked for by some of the district aides so that they could use those as models for other community groups to encourage people to get their own disaster packs. I would also, if I could briefly mention, the zones are not necessary to be evacuated. It's helpful for people to know their zones, but when we issue emergency warnings, in addition to the zone name, we also provide a full geographic description of the area being evacuated. So it's not critical to know the zone, it's helpful.
And I agree with that. As one of the people who evacuated during the glass fire, it was the discontinuity occurred between the county and the city, but nevertheless, we all seemed to get out safely. So that's the good news. Thank you once again. Good information, good collaboration, good coordination. And I hope we are working carefully with the city of Santa Rosa and other cities on all of the information in the annex and making sure that we coordinate evacuation and emergency preparedness, of course. Thank you.
Thank you, Supervisor Gorin. Supervisor Corsi?
Thanks. My colleagues asked the questions that I had. I do want to echo their comments about thanking you for this work. I mean, you know, one of the benefits of practicing the same skills over and over again is you get better at them the more you do it. Unfortunately, we keep practicing those skills over and over again. So I do appreciate the improvements that have been made and expect that we're going to continue to see improvements. But this is good stuff. While I've got you here, I'd like to ask about today. And we've been in this room or that room all day long. And I'm wondering about the alert test that did it happen today? And if it did happen, do you have any assessment of how it went?
So through the chair, Christopher Godley, Director of Emergency Management, we did in fact continue with the test today. There was some concern about its coincidence today with both a red flag warning being issued for tonight and PG&E going to conduct public safety power shutoffs starting tonight as well. The test was relatively limited in scope. However, we were looking at technical aspects of these systems, and we did get enough feedback, if you would, from participants to give us an idea of how well the test performed. We're doing pretty good. The test went well. It's not 100%, but we've identified the areas that we thought may be a weakness, and now we can work in turn with both the state, but more importantly, the Federal Communications Commission to address these issues, because ultimately many of these warning systems are federally managed programs, and it's going to require their efforts to move the technology to be even more effective for our residents here in Sonoma County.
Okay, glad to hear you got it in and you got some results to work with. Again, thanks for the work.
Thank you, Supervisor Corsi, and thank you for an excellent informative presentation. And I really also oddly enjoyed perhaps reading through the annex because, it just really codifies a lot of the work that we have done. And we really, truly have gotten better with each and every evacuation that we have affected in Sonoma County. A couple of questions, because I think that these are the sort of top two questions that I tend to receive from constituents. And I know that it was covered in the annex. Pets and livestock. I know there's mention of some of the volunteer organizations that work with that, but if there are any additional things that you would like to share in terms of the procedure for evacuating pets and livestock, and then also potentially highlighting the difference between the Ag Access Program for sort of access to commercial agriculture versus how we have been able to care for smaller backyard types of livestock in the past. I think it would just be great to set some ground rules for what folks can expect.
So Madam Chair, I take a bit of that question, then I'll ask Andrew Smith, our Ag and Weights Commissioner, to jump in. But briefly, relatively to service animals, first and foremost, they're always allowed to go everywhere during an evacuation, on transportation, at temporary evacuation points and shelters. Small pets can also be now taken on transportation. This annex clearly establishes policy that during an event, if the pet can be secured where it's not a danger to others, that pet can be transported along with the evacuees. We know how important pets are to folks, and many folks won't leave if they can't leave with their pets. So it's our policy to move everybody out at the same time. Relative to small livestock and to especially the Ag Pass program, let me ask Andrew Smith to jump on. I believe, Andrew, there, if you want to raise your hand, you can be selected as a speaker at this point, and we can have you address that question.
Perfect. And I'm wondering if we could also touch on the role that Animal Services has played in our evacuation as well, because they did excellent work. And I do believe that the Sheriff's Office was also engaged and involved in some of that work as well.
I would just add that while we're waiting for Andrew Smith, Animal Services has done a great job, both based on their experience from 2017, plus the fact that they've deployed staff to other fires in recent years. They've come back with a whole host of good ideas. Working with volunteer groups, especially those that are advocating for animals in these disaster scenarios, Animal Services was able to complete and develop their Animal Emergency Response Plan. This guides the activities of not only the Animal Services staff, but all the affiliated animal services organizations that they work with to ensure a unity of effort in addressing the needs of individuals and their pets, their animals, small livestock. It's a pretty good plan. They put it to the test in 2020, last year twice, and it worked out relatively well. But it's important to note that a large effort is needed to take care of these animals. And most of the resources are actually not in the government. They're actually already in the community. And there have been several good community group efforts over the last several years that have really stood up the ability for folks to organize themselves, communicate with each other, and make real significant progress in developing capabilities that are going to support these animals during these times of evacuation. It's hard to keep up with them sometimes, I guess I would say, on behalf of Animal Services. But we really do feel that we're in a much better position now than we were 4 years ago, especially relative to that specific aspect. I don't know if Andrew Smith is able to join us. Don't see him. Okay, he went off the clock.
I'm not seeing him, but it's possible if he's a phone attendee. So if you're able to connect with him, I can definitely promote, but I don't see him.
Okay. Well, just to paraphrase for Andrew Smith, there is the Ag Pass program that has now been developed in coordination with the agricultural and livestock communities, and especially with the Sheriff's Department coordination. Kat Murphy, if you want to touch on that, otherwise I've got a little detail.
I don't have a lot of information on it. It's our assistant sheriff has really taken on that role through Ag, and I just don't have enough information to speak directly.
Very briefly, the Ag Pass program is ready to go. Policy and procedure have been established. The identification badge has also been established. And at this time, I believe they're issuing that pass to the agricultural community on a trial basis this year to make sure that access is going to be not only understood by the agricultural community, but also local law enforcement agencies. It is important to note the Ag Pass program is not a get out of jail or get by the blockade free card. If there's danger in that area and that people want access to it, they're still going to be restricted from entering if there's a real immediate life safety threat. But we do understand that there are circumstances in which those in the agricultural and livestock community need access, potentially even on a very limited basis, to make sure that they don't lose their investments. And if we can accommodate that safely, that is the intent of the Ag Pass program.
And it looks like Misty wanted to maybe jump in. Did you have a few things to add? Thanks.
I did. Thank you, Chair. I have a little bit of familiarity with the program. I think Chris summarized it really well. I think the important distinction for the public and for the board is that the ag commissioner is the one who's vetting people to assure that they do live there and they do have an agricultural operation. And the deputies or the mutual aid officers are simply checking to make sure that they have the pass. It is important to note, as Chris mentioned, this is not a free-for-all pass. It is still at the discretion of the peace officer staffing that post to ensure that it is safe to let that person in. And we have denied people, and people aren't always thrilled, but at the end of the day, it's our job to make sure that people are as safe as possible. We do also put the animal rescue phone numbers in our nixles when we send those out as the sheriff's office to let people know right away those resources are available, because somebody said it very well: if they can't live without their pets, they're not going to leave at all. So that was what I wanted to add. Thank you, Chair.
Thank you very much. And I have to say, I was very impressed by the mobilization of resources during the Wallbridge fire, and animal services even going in and doing it, providing food to livestock who had been left behind, or assisting with evacuations and coordinating with the Halter Project and other community-based organizations to help get livestock out of the danger zone. Last question, another common question that I heard was, okay, hey, my home is not in an evacuation zone, but it is across the street from a mandatory evacuation zone. And, true or false, sometimes you can't actually get to your home that it is in a that is not in an evacuation zone because it is adjacent to an evacuation zone. And I think this one is for the sheriff's office. In other words, you've got a checkpoint, right? That's before your house. And even though you're on the green side where you're allowed to be, you may not be able to access it because of a checkpoint that is really geared at establishing a perimeter around an evacuation zone.
Right. Thank you. I understand what you're saying. I hope that's few and far between, number one, that happens. I think that the deputies we have out there and the officers we have from out of the county do their best to get those people back to their home to deal with it. I'm not saying that always works perfectly. That could create an issue. There's no doubt about it. It is, if we have an evacuation zone and the zone right next door, the street next door is not an evacuation zone, those people have a right to get to their house, whether it's to save their animals, to get belongings. They have a right to get to their house and get that stuff. I think a lot of it comes down to manpower too, how we're doing with manpower at the time. That's my 2 cents on it. They should be able to get to their home.
I appreciate that. And also recognize that sometimes we find ourselves in very short-staffed situations with respect to, not a lot of mutual aid because there are multiple fires, or the extent of the fire and the evacuation is so great. And I appreciate the work of all of the deputies supporting those efforts when we do have that. Actually, one final question, and that is with respect to evacuation and our regional parks employees and vehicles potentially being outfitted with high-low sirens. Do we need additional funding for that effort? Is there any support that is needed from the Board of Supervisors to advance that project forward? Because I think it's such a great answer to providing some internal mutual aid from our parks rangers who tend to be familiar with many of our rural parts of the county.
So I have met with regional parks. I do support them getting the high-low sirens for sure. Conversation is we have to make sure that they understand that they're not law enforcement to a certain extent, but in a situation where we need to evacuate people, they could be a huge help to all of us to have those high-low sirens, to go through neighborhoods, to get up in there. Maybe we don't have enough deputies to get up in there, but for those extra bodies we have, and just go through neighborhoods and talk to people, have the high-low sirens going. I fully support them working with the sheriff's office on that.
Great. And Director Godley, do you have any update in terms of do we need additional resources in order to move forward with supporting just the physical infrastructure investment, right? Of making sure that those high-low sirens are installed so that they can act at the behest of the sheriff's office during an evacuation event.
Madam Chair, my last conversation on the subject, I believe, yes, there's still funding required. Briefly, the Parks Department runs older vehicles with older siren control systems that cannot be retrofitted with the new high-low tones relatively inexpensively. They actually need to be replaced with a modern digital version, if you would. Some of the parks vehicles have been augmented with temporary high-low siren additions, but I think there are about 14 vehicles that need to be replaced, if you would, with the new siren controller systems. I do not have a dollar figure on that, but it's certainly less than 100,000.
Great. Well, I would welcome that coming back to the board if there is a request for contingency funds for that, because I think that expanding our internal mutual aid system is critical for evacuations. Actually, I guess since I have an opportunity to look to my colleagues, would you support sort of expanding that capacity at regional parks and bringing that back as a board item if needed? I'm seeing thumbs up for that. Great. Wonderful. Any final questions from my colleagues or comments, since this is an informational item, before we go to public comment? Seeing none, I will go ahead and check in and see if we've got any members of the public out in the hallway on this one. 0. Thank you so much. We do not have any members of the public present today, so I will go ahead and ask Marcy to lead us in public comment via Zoom.
Thank you. If anybody would like to comment on this item, please raise your hand in the Zoom app or press *9 on your phone keypad. And again, this is item number, I close the document. We're not yet, what I'll say is we're not yet at the public comment on matters not on the agenda. So thank you very much. And our first commenter is a phone attendee. So if you can please listen for the prompt and unmute by pressing *6 before beginning your comment. Hi there, do you want to begin your comment? I can see that you are unmuted. Okay, and this is for a phone attendee. We're not hearing you right now. We'll try one more time. Okay, and I do apologize, we're not hearing you right now for this phone attendee. But you certainly can email any comments to bos@sonoma-county.org and we can forward them to the full board. Our next commenter, if you can please unmute and state your name.
Hi, my name is Lorinda. Thank you for hearing me. Today you heard articulate testimony from the people of this county. Well-researched science and data, as well as firsthand accounts from doctors and nurses in the
I'm
field.
going to go ahead and interrupt you because this is actually specific to item, I believe it's 26, which is our evacuation annex. So we're not taking.
I'm sorry. Thank you. Thank you.
Thank you. All right, and Chair Hopkins, there are no additional hands for comment on item number 26.
Great. So with that, thank you so much. Unless there's any other final comments from my colleagues on the board, thank you so much for all of your work on this. Really proud to move this forward and appreciate receiving this item. Since it is informational, I don't believe that we need to take a vote to formalize this one. So thank you all very much. And with that, I'm going to go ahead and move on to board member reports on assigned boards, councils, commissions, or other attended meetings. It's been a couple weeks. What does everyone have? Supervisor Gore?
Yeah, just I've had some different CSAC engagements. One of them was our exec board meeting, just to report out on that. It was in Sacramento. We were going to have some more stuff in person. I believe Supervisor Corsi was at the homeless meeting, the regional homeless meeting, which was on Friday, that I wasn't able to attend. Hope that was productive. I know I had lined up to have Tina Rivera and Dave Kiff represent that as well, so that we'd have an idea not to talk about homelessness as an issue, but talk about state funding and how we link to it. So I think that's the biggest thing that I really want to track as we go forward. And had a North Coast Resource Partnership executive board meeting, and that's it. Thank you.
Thank you, Supervisor Gore. Supervisor Gorin? Nothing to report. Supervisor Corsi?
Going back to July 28th, Continuum of Care Board. Supervisor Gore and I had a Measure O ad hoc meeting on July 22nd. And North Coast Broadband Consortium Oversight Committee on August 5th. Aging Together Leadership, August 5th. Health Action Council, August 6th. Attended the CSAC New Supervisors Conference on the 11th and 12th. Santa Rosa Plain GSA board meeting on the 12th. Presented to the Mayors and Council Members Association meeting on August 12th, along with staff, including CAO Bratton and Dave Kiff and Tina Rivera. And the CSAC regional meeting on homelessness on Friday, the 13th. That is it.
Thank you very much. And for my part, I did attend a Bay Area Air Quality Management District meeting, as well as a Sonoma Clean Power Authority Board of Directors meeting. We did also have a community meeting for the community of Occidental. So with that, we will go ahead and move on to public comment on matters not listed on the agenda, but within the subject matter jurisdiction of the board and on board member reports.
Thank you, Chair Hopkins. And I'll just, if through the chair, state that we do have accident determinations that we can do when you see appropriate.
Great, thank you for the reminder. So I will first check to see if we have any members of the public present for public comment. No members are present in the board chamber. So Marcy, I would go ahead and ask for public comment to be taken via Zoom.
Certainly, thank you. And for our members of the public, please raise your hand in the Zoom app or press *9 on your phone keypad to comment on the section of today's agenda, which is matters not listed on the agenda. And I will begin with our first commenter, David, followed by 2 phone attendees.
And if we could take that to 90 seconds, given the lateness, I would appreciate it. Thank you, Marcy.
Thank you. Please go ahead, unmute and state your name.
Thank you. My name is David Applebaum, and I am calling in from Sonoma. I'm commenting on the need for more stringent licensing management policies and enforcement measures on transient vacation occupancy owners and the potential introduction for Picasso. We are in the midst of an extremely risky time across 3 critical vectors: economic, with jobs, housing, diversion of money out of the hospitality sector; environmental, with mega droughts and wildfires; and health, with continued COVID crises and the Delta variant. The continued metastasis of transient vacation ownership properties, transient vacation occupancy properties, and now with the potential introduction of yet another disruptive vacation residency scheme, Picasso, without fully vetted policies, plans, and resource impact studies to support it, assumes unacceptable levels of risk to our neighborhoods and communities: community cohesion, quality of life, community health and safety, community resource stewardship, and community economic viability. Permits have been granted too easily based on those who can pay and fit a far too narrow zoning profile versus the character of the neighborhood profile. Moreover, too many of these permits have been granted to out-of-town owners who own 2 or more properties solely as income investment. Now corporations such as Picasso view our community as ripe for the plucking as they seek to gain a foothold into our neighborhoods and introduce still more transient tenants into residential neighborhoods, eroding the quality of life, character, and sanctuary that these neighborhoods should provide to its full-time residents. We need
Thank you so much for your comment.
Generate policy.
Thank you. Our next commenter is a phone attendee. If you can please unmute by pressing *6.
Chair Hopkins and members of the Board of Supervisors, thanks for hearing my comments. This is Jim Duffy. I'm calling from Rohnert Park. I am calling to ask you to begin a national search for the Director of IOLARO position to commence the search to commence in September because the current director's term expires or contract expires in March, and it takes 6 months. 65% of the voters supported Measure P that increased the power of the office and changed the qualifications for the director. Can you hear me?
Yes, we can.
Okay, sorry about that. So Measure P increased the power of the office and also changed the qualifications for the director position. And so we should get more candidates this time. Having guaranteed the office's existence by giving it a guaranteed funding piece, it will be easier for us to get qualified candidates from around the country who have been doing oversight work. And the people of Sonoma County deserve the best director that we can attract. And so this has nothing to do with who the current director is and everything to do with Measure P passing. In fact, as we go forward, we're likely to change the ordinance again somewhere down the road, 5 or 10 years down the road. It's very common for oversight offices.
And thank you so much for your comment. That does conclude the time. Our next commenter is also a phone attendee. If you can please unmute and state your name.
James Savage, 9/11 Truth Campaign. Are bound by oath of office, County of Sonoma, 5th District Supervisor, Linda Hopkins, Chair of We the People's Board of 4 Super Puppets. You are serving Communist China again, damn it. Help us, Honorable Supervisor David Rabbit. At the end of our last meeting of our County of Sonoma Board of Supervisors on July 27th, 2021, a special meeting of We the People of Sonoma County's government that lasted over 9 hours. 6 of us each got only 60 seconds over the phone as public speakers to save our dying democracy from Communist China. You and 3 other duly elected public servants openly conspired to falsely, maliciously move our county administration office from our 60-year-old, very accessible and functioning building to a vacant 7.4-acre and empty building owned by Sears Holdings in a struggling shopping center in downtown Santa Rosa, over a mile from our present county administration building, county courthouse, jail, and sheriff department that are all now conveniently together next to the U.S. Highway 101, providing easy access for all county residents. Insane. Thank you. 4
Thank you
of
for your
you
comment.
elected public.
Can our next commenter please unmute and state your name?
Mary Morrison. Number 2, 4 of you elected public servants want your constituents to spend over $25 million in property taxes for far less convenient service locations for county administration. Why? Because you and they are probably conspiring to get sizable kickbacks that violates California Penal Code Section 182A3, Exhibit A, reported to our Sheriff Department in event number 3. Since February 2020, your crimes have aided special interests that are prospering from Communist China's so-called wildfires that murdered 24 county constituents and demolished over 4,600 county homes in less than 90 minutes on October 2017 including Supervisor Susan Gorin's home, after former supervisor, now our state senator, Mike McGuire, removed vacationing Supervisor Gorin's valuables. Number 4, since February of 2020, Communist China's COVID-19 plague has murdered over 600,000 Americans, including 320 in our county of Sonoma. Now, 4 supervisors are more interested in moving our roomy and convenient single-floor county administration center that is across from our county courthouse and our county jail, down the street from our county sheriff department, with all plenty of room to grow along US Highway 101 into a congested city
And thank you for your
location.
comment. I know you can't see the timer, but that does conclude the time. Our next commenter is also a phone attendee, so please press *6 when prompted and state your name.
What?
Hi, please go ahead.
9/11 Truth Campaign, Richard Hannon. The city of Santa Rosa has 7.4 acre vacant lot that Sears Holdings has tried to sell since 2018. 4 of the 5 bound by oath county officers plan to build a $5 million plus multi-floor administration center in the city, while prices are inflating higher we have ever experienced. It makes no sense. Except for the bankrupt owner, Sears Holdings, we, the suckers, are going to pay $20.4 million for something nobody else wants, and that won't work for us. No doubt 4 of you elected public servants are getting a cut of the $20.4 million now somehow that can land you in jail. 6, since 9/11, governments like our county of Sonoma, California, have been serving traitors and organized crime who are hiding the truth about 9/11 for Communist China and Port Authority of New York and New Jersey. 7, your public office and your constituents' resources should be focused on helping we, the people, survive Communist China's attacks on our country. Forget moving our administration facility into the city for Sears Holding at we, the people's expense. We are facing the highest level of organized crime that is run by Communist China's top foreign agent and California's boss Deb, Phantom President Willie Brown, the Wizard of Deception. Communist China wants to destroy our democracy. If you go ahead with serving Sears Holdings at our expense, you, Linda, will breach your contract with us as
Thank
a public
you for your
service.
comment. That concludes the time. Our next commenter, if you can please unmute and state your name.
Hi, my name is Michelle. Linda, you say you're not mandating COVID vaccines in order to keep our county jobs at this time. I am a county employee. Since we can take the weekly test, I have a question for you. Are mandatory vaccines to keep our jobs something you're considering and or possible, especially if the CDC is not recommending using these tests after the end of the year? Just trying to figure out my livelihood and if you guys are going to be taking that away from me and my family. Thank you.
And our next commenter, if you can please unmute and state your name.
Hello again. My name is Lorinda, and I'm calling from Sonoma. Today you heard articulate, thoughtful testimony from the people of this county, well-researched science and data, as well as firsthand accounts from doctors and nurses in the field. I find it difficult to believe you were aware of everything brought to you today, some of which cast doubt on the safety of COVID-19 vaccines. If I was in your position, I would want to be absolutely certain I had done my due diligence before I made a decision that would force people to decide between a paycheck or the lesser of two evils. Yet you did feel confident enough to make that decision for over 4,000 county employees today. I think it's time to do things a different way. I'm inviting everyone on this call to join in a 50 states discussion of what it means to be a de jure form of government rather than a de facto form of government. The conversation will take place starting on August 30th. Anyone interested may find more information at dejureforsure.com. That's DEJURE, numeral 4, SURE.com. www.cenacom. Thank you.
Next commenter is a phone attendee. If you can please unmute by pressing *6.
Tom McDougal, 9/11 Truth Campaign. If you go ahead things at our expense, you, Linda, will breach your contract with us as a public servant and be giving aid and comfort to possible enemies of the state and committing treason against the state of California in violation of California Penal Code, Section 37, reported to our Sheriff's Department with an event number 8. Since 9/11, we, the deceived, and now in 28,468 billion bankrupt people in our county of Sonoma, California have been deceived by 10 Congresses, about 10 of 25 Al-Qaeda martyrdom battalions, suicide bombers, attacking the Twin Towers in New York on 9/11 with 2 of 6 Al-Qaeda martyrdom battalion hijacked domestic airliners that reportedly caused 2 110-story massive steel structures at the World Trade Center to collapse in under 8 seconds, killing 2,760 New Yorkers. 9. The truth is the Port Authority of New York and New Jersey that own asbestos-loaded Twin Towers had to lease them to 6 weeks new 99-year lessee Larry Silverstein because the asbestos was causing tenants to die from breathing, causing me.
Okay, and thank you. I think we lost that commenter just at the end there. Our next commenter, if you can please unmute and state your name.
Poppy.
Please go ahead.
I personally know a Sonoma County student with a medical exemption for regular childhood vaccinations that has been denied starting 4th grade this year, told that their medical exemption will not be accepted. I personally know a Sonoma County teacher that's being pushed out of his job due to the new requirements to get the vaccine or test twice weekly, which we know will be a mandated jab once Pfizer gets FDA approval at the end of this month. I personally know of a Sonoma County CNA working in one of our local hospitals, tested positive for COVID and was denied therapeutic ivermectin and had to find healthcare outside of our county. I personally know vaccinated people who have tested positive. Is it the COVID funding you received that's forcing your hand and responding in a way that does not align with the people you represent? Or have you spent today calling in to talk to you? The problems are mounting and are across the board: education, economic, healthcare. The whole system will collapse if you don't change your position to a place of reason. Thank you.
All right, our next commenter, if you can please unmute and state your name.
Hello, can you hear me?
Yes, we can hear you.
My name is Franny, and I'm a resident of Sonoma County. I'm not here to ask for your permission or ask for my rights back. I'm here to tell you that I am a free American citizen. I have God-given rights, and as a daughter of the American Revolution, my ancestors fought for my God-given rights. No tyrant can take them from me. The Board of Supervisors is clearly acting on behalf of the pharmaceutical industry and the CDC's interest, not your constituents. Dr. Mace does not represent the people of Sonoma County, and she certainly does not represent the people of West County. She doesn't even live in Sonoma County. She lives in the East Bay. We did not vote her in. My husband is a healthcare worker. He has a religious exemption to the vaccine, but will be refusing any testing. Don't call it a choice if you don't have the option to refuse. Informed consent includes the right to refuse the treatment, not to be forced into invasive and inaccurate medical diagnostics. He has seen patients with stroke, blood clot, and amputation as a direct result of the COVID vaccine. Yet you're requiring everyone subject themselves to this absolute risk. He's risked his own safety to work 16-hour days for the past year and a half. A year and a half of working on an ICU unit, and sometimes with COVID patients. If these healthcare heroes are willing to take this risk and are still not compelled to take the risk of this vaccine, what does that tell you? We will not comply with your unlawful tyranny. Thank you.
Okay, I did see another hand, but it seems to be lowered. I'm just looking quickly before we close public comment. All right, and that will conclude comment.
Thank you very much, Marcy. So now I'm going to bring it back to the board for a vote on acts and determinations. So Marcy, would you mind leading us in a roll call vote for acts and determinations? Item number 27, please.
Absolutely. Supervisor Gorin?
Aye.
Supervisor Corsi?
Yes.
Supervisor Gore?
Yes.
Chair Hopkins?
Yes. And that will bring us to our adjournment, unless I have missed anything else on the agenda. Going once, going twice. All right, we will be adjourning today in honor of a number of community members who left us too soon. From the 1st District, Patrick Hoffman. From the 2nd District, Roylene Jeanette Baumgardner. From the 4th District, Colin Vazoller. And district-wide, Mert Preston and Caroline Marker. If you wouldn't mind joining me in a moment of silence for those members of our community that we lost. My thoughts are with the families of those community members, and with that, we will adjourn the meeting for today.